Nos gustaría compartir con usted algunas buenas prácticas para que todos los participantes puedan disfrutar de la mejor calidad de sonido. Para que la interpretación funcione bien, es importante que escuche en el mismo idioma en el que hablará cuando tome la palabra. Por ejemplo, si tiene intención de hablar en inglés durante su intervención, asegúrese de conectarse también al canal del idioma inglés en Zoom. Envíe las notas escritas que tenga por adelantado. Eso ayudará al servicio de interpretación a prepararse para su intervención. Y asegúrese siempre de hablar con claridad y a un ritmo natural, para que los intérpretes puedan dar una interpretación precisa de su declaración en los otros idiomas. Evite utilizar el micrófono integrado de su ordenador. Unos buenos auriculares proporcionarán la mejor calidad de sonido para los demás participantes y para los intérpretes. Limite los elementos perturbadores en su entorno y recuerde cerrar la puerta y ventanas antes de hablar para evitar los ruidos de fondo. Durante su intervención, evite utilizar un teléfono móvil o conectarse a través de un Wi-Fi inestable. Y si presenta un mensaje pregrabado, no utiliza textos superpuestos ni música de fondo. Si usted necesita ayuda, puede enviar un correo electrónico a gbs@support.who.int o llamar al +41 22 791 211. Conectarse rápidamente a los datos de soporte indicados en la reunión de Zoom para obtener ayuda inmediata. Le deseamos el mayor de los éxitos en su reunión.
Nous souhaitons partager avec vous certains conseils utiles afin que tous les participants puissent profiter de la meilleure qualité sonore possible. Avant de vous connecter, assurez-vous que la dernière version de Zoom est installée sur votre ordinateur. Pour le bon fonctionnement de l'interprétation,
We'd like to share some good practices with you so that all participants can enjoy the best sound quality. Before connecting, make sure your computer has the latest version of Zoom installed. For the interpretation to work well, it is important that you listen to the same language in which you will speak when you take the floor. For example, if you intend to speak in English during your intervention, make sure you are also connected to the English language channel in Zoom. Send any written notes you have in advance. This will help your intervention. And always make sure you speak clearly and at a natural pace so that the interpreters can give an accurate interpretation of your statement in the other languages. Avoid using the built-in microphone of your computer. A good headset will provide the best quality sound for other participants and interpreters. Limit any disturbing elements in your environment, and remember to close doors and windows before speaking, to keep out any background noise. During your intervention, avoid using a mobile phone or connecting over unstable Wi-Fi. And if you are providing a pre-recorded message, please do not use any text overlays or background music. Should you need any support, you can send an email to gbs-it-support@who.int or call +41 22 791 2111 or connect quickly to the Zoom meeting support details displayed for immediate help. We wish you a successful meeting.
Nos gustaría compartir con usted algunas buenas prácticas para que todos los participantes puedan disfrutar de la mejor calidad de sonido. Para que la interpretación funcione bien, es importante que escuche en el mismo idioma en el que hablará cuando tome la palabra. Por ejemplo, si tiene intención de hablar en inglés durante su intervención, asegúrese de conectarse también al canal del idioma inglés en Zoom. Envíe las notas escritas que tenga por adelantado. Eso ayudará al servicio de interpretación a prepararse para su intervención. Y asegúrese siempre de hablar con claridad y a un ritmo natural, para que los intérpretes puedan dar una interpretación precisa de su declaración en los otros idiomas. Evite utilizar el micrófono integrado de su ordenador. Unos buenos auriculares proporcionarán la mejor calidad de sonido para los demás participantes y para los intérpretes. Limite los elementos perturbadores en su entorno y recuerde cerrar la puerta y ventanas antes de hablar para evitar los ruidos de fondo. Durante su intervención, evite utilizar un teléfono móvil o conectarse a través de un Wi-Fi inestable. Y si presenta un mensaje pregrabado, no utiliza textos superpuestos ni música de fondo. Si usted necesita ayuda, puede enviar un correo electrónico a gbs.support@who.int o llamar al +41 22 791 2111 o conectarse rápidamente a los datos de soporte indicados en la reunión de Zoom para obtener ayuda inmédiata. Le deseamos el mayor de los éxitos en su reunión.
Nous souhaitons partager avec vous certains conseils utiles afin que tous les participants puissent profiter de la meilleure qualité sonore possible. Avant de vous connecter, assurez-vous que la dernière version de Zoom est installée sur votre ordinateur. Pour le bon fonctionnement de l'interprétation, il est important que vous écoutiez la même langue que celle dans laquelle vous prendrez la parole. Par exemple, si vous avez l'intention d'intervenir en anglais, assurez-vous de vous connecter également au canal anglais dans Zoom. Envoyez vos éventuelles notes écrites à l'avance. Cela aidera le service d'interprétation à se préparer à votre intervention. De plus, veillez en permanence à parler clairement et à rythme naturel, de sorte que les interprètes puissent traduire précisément votre déclaration dans les autres langues. Évitez d'utiliser le microphone intégré de l'ordinateur. Un bon casque donnera un son de meilleure qualité pour les autres participants et les interprètes. Limitez les éléments perturbateurs autour de vous et n'oubliez pas de fermer portes et fenêtres avant de prendre la parole, de manière à éviter tout bruit de fond. Lors de votre intervention, évitez d'employer un téléphone portable ou de vous connecter sur un Wi-Fi peu stable. Et si vous communiquez un message préenregistré, veuillez ne pas y ajouter de texte ni de musique de fond. Si vous avez besoin de soutien, vous pouvez envoyer un courriel à gbs-it-support@who.int. Appelez le +41 22 791 21 11 ou vous connectez rapidement au lien affiché afin d'obtenir un soutien immédiat pour les réunions Zoom. Nous vous souhaitons une bonne réunion.
Просим ознакомиться с некоторыми рекомендациями, соблюдение которых обеспечит хорошее качество звука для всех участников. Для подключения к Zoom убедитесь, что на вашем компьютере установлена последняя версия приложения. Для правильной работы синхронного перевода важно, чтобы вы слушали тот же язык канала, на котором вы будете выступать. Например, если вы намерены выступать на английском, убедитесь, что вы также подключены к английскому каналу в Zoom. Просим заранее предоставить текст любых записей к вашему выступлению. Это поможет службе синхронного перевода подготовиться к переводу вашего выступления. Просим всегда говорить четко, соблюдая нормальный темп речи, чтобы синхронные переводчики могли точно передать ваше выступление на других языках. Старайтесь не пользоваться встроенным микрофоном компьютера. Качественная гарнитура обеспечит хорошее качество звука для других участников и синхронных переводчиков. В избежание фоновых шумов постарайтесь не допускать посторонних шумов в помещении. А перед выступлением не забудьте закрыть окна и двери. Для выступлений старайтесь не пользоваться мобильными телефонами или неустойчивым подключением к интернету по Wi-Fi. Кроме того, делая видеозапись выступлений, не следует использовать наложение текста или фоновой музыки. Если вам потребуется помощь, вы можете отправить сообщение на адрес электронной почты gbs-it-support@who.int, позвонить на номер +41 22 791 21 11 или для получения быстрой помощи соединиться с группой поддержки заседания в Zoom, используя указанную контактную информацию. Мы желаем вам успешной встречи.
نود أن نشارككم بعض الممارسات الجيدة التي ستساعد جميع المشاركين على الاستمتاع بأفضل جودة صوت ممكنة. قبل الاتصال، تأكد من تثبيت النسخة الأخيرة من تطبيق زوم على حاسوبك. لتيسير الترجمة الفورية، من المهم أن تستمع بنفس اللغة التي ستتكلم بها عند أخذ الكلمة. مثلا، إذا كنت تعتزم الحديث باللغة الإنجليزية في مداخلتك، اشبك بقناة. أرسل أي ملاحظات مكتوبة مسبقا. سيساعد ذلك فريق الترجمة الفورية على التحضير لمداخلتك، واحرص دوما على التكلم بصوت واضح وبإيقاع طبيعي ليتمكن المترجمون الفوريون من ترجمة بيانك بدقة للغة الأخرى. تجنب استخدام الميكروفون المدمج في جهاز الحاسوب.
确保您的计算机已安装最新版本的 Zoom。为了使口译工作顺利进行，您打算在发言时讲英文，请您同时确保连接到 Zoom 平台的英文语言频道。请发送您事先准备的书面稿件，这将有助于口译人员为您的发言做准备。要确保您以自然语速清晰发言，以便口译人员能将您的发言准确翻译成其他语言。请避免使用电脑内置麦克风。质量良好的耳麦将为其他参会者和口译人员提供最佳音质。限制环境干扰因素。讲话之前，发言时，请避免使用手机或连接到不稳定的无线网络。如果您提供预先录制的发言，请不要使用文本覆盖和背景音乐。如需获得任何支持，请您发送电子邮件至 gbs-support@who.int，拨打+4122-791-2111，或快速连接到所示链接，迅即获得对 Zoom 会议的支持。我们预祝会议一切顺利。
Nous souhaitons partager avec vous certains conseils utiles afin que tous les participants puissent profiter de la meilleure qualité sonore possible. Avant de vous connecter, assurez-vous que la dernière version de Zoom est installée sur votre ordinateur. Pour le bon fonctionnement de l'interprétation, il est important que vous écoutiez la même langue que celle dans laquelle vous prendrez la parole. Par exemple, si vous avez l'intention d'intervenir en anglais, assurez-vous de vous connecter également au canal anglais dans Zoom. Envoyez vos éventuelles notes écrites à l'avance. Cela aidera le service d'interprétation à se préparer à votre intervention. De plus, veillez en permanence à parler clairement et à rythme naturel, de sorte que les interprètes puissent traduire précisément votre déclaration dans les autres langues. Évitez d'utiliser le microphone intégré de l'ordinateur. Un bon casque donnera un son de meilleure qualité pour les autres participants et les interprètes. Limitez les éléments perturbateurs autour de vous et n'oubliez pas de fermer portes et fenêtres avant de prendre la parole, de manière à éviter tout bruit de fond. Lors de votre intervention, évitez d'employer un téléphone portable ou de vous connecter sur un Wi-Fi peu stable. Et si vous communiquez un message préenregistré, veuillez ne pas y ajouter de texte ni de musique de fond. Si vous avez besoin de soutien, vous pouvez envoyer un courriel à gbs-support@who.int. Appelez le +41 22 791 21 11 ou vous connectez rapidement au lien affiché afin d'obtenir un soutien immédiat pour les réunions Zoom. Nous vous souhaitons une bonne réunion.
Просим ознакомиться с некоторыми рекомендациями, соблюдение которых обеспечит хорошее качество звука для всех участников. Для подключения к Zoom убедитесь, что на вашем компьютере установлена последняя версия приложения. Для правильной работы синхронного перевода важно, чтобы вы слушали тот же язык канала, на котором вы будете выступать. Например, если вы намерены выступать на английском, убедитесь, что вы также подключены к английскому каналу в Zoom. Просим заранее предоставить текст любых записей к вашему выступлению. Это поможет службе синхронного перевода подготовиться к переводу вашего выступления. Просим всегда говорить четко, соблюдая нормальный темп речи, чтобы синхронные переводчики могли точно передать ваше выступление на других языках. Старайтесь не пользоваться встроенным микрофоном компьютера. Качественная гарнитура обеспечит хорошее качество звука для других участников и синхронных переводчиков. В избежание фоновых шумов постарайтесь не допускать посторонних шумов в помещении. А перед выступлением не забудьте закрыть окна и двери. Для выступлений старайтесь не пользоваться мобильными телефонами или неустойчивым подключением к интернету по Wi-Fi. Кроме того, делая видеозапись выступлений, просим ознакомиться с некоторыми рекомендациями, соблюдение которых обеспечит хорошее качество звука для всех участников. Для подключения к Zoom убедитесь, что на вашем компьютере установлена последняя версия приложения. Для правильной работы синхронного перевода важно, чтобы вы слушали тот же язык канала, на котором вы будете выступать. Например, если вы намерены выступать на английском, убедитесь, что вы также подключены к английскому каналу в Zoom. Просим заранее предоставить текст любых записей к вашему выступлению. Это поможет службе синхронного перевода подготовиться к переводу вашего выступления. Просим всегда говорить четко, соблюдая нормальный темп речи, чтобы синхронные переводчики могли точно передать ваше выступление на других языках. Старайтесь не пользоваться встроенным микрофоном компьютера. Качественная гарнитура обеспечит хорошее качество звука для других участников и синхронных переводчиков. В избежание фоновых шумов постарайтесь не допускать посторонних шумов в помещении. А перед выступлением не забудьте закрыть окна и двери. Для выступлений старайтесь не пользоваться мобильными телефонами или неустойчивым подключением к интернету по Wi-Fi. Кроме того, делая видеозапись выступлений, не следует использовать наложение текста или фоновой музыки. Если вам потребуется помощь, вы можете отправить сообщение на адрес электронной почты gbs-it-support@who.int, позвонить на номер +41 22 791 21 11 или для получения быстрой помощи соединиться с группой поддержки заседания в Zoom, используя указанную контактную информацию. Мы желаем вам успешной встречи.
نود أن نشارككم بعض الممارسات الجيدة التي
natural, para que los intérpretes puedan dar una interpretación precisa de su declaración en los otros idiomas. Evite utilizar el micrófono integrado de su ordenador. Unos buenos auriculares proporcionarán la mejor calidad de sonido para los demás participantes y para los intérpretes. Limite los elementos perturbadores en su entorno y recuerde cerrar la puerta y ventanas antes de hablar para evitar los ruidos de fondo. Durante su intervención, evite utilizar un teléfono móvil o conectarse a través de un wifi inestable. Y si presenta un mensaje pregrabado, no utiliza textos superpuestos ni música de fondo. Si usted necesita ayuda, puede enviar un correo electrónico a gbsuport@who.int o llamar al +41 22 791 2111 o conectarse rápidamente a los datos de soporte indicados en la reunión de Zoom para obtener ayuda inmediata. Le deseamos el mayor de los éxitos en su reunión.
نود أن نشارككم بعض الممارسات الجيدة التي ستساعد جميع المشاركين على الاستمتاع بأفضل جودة صوت ممكنة. قبل الاتصال، تأكد من تثبيت النسخة الأخيرة من تطبيق زوم على حاسوبك. لتيسير الترجمة الفورية، من المهم أن تستمع بنفس اللغة التي ستتكلم بها عند أخذ الكلمة. مثلا، إذا كنت تعتزم الحديث باللغة الإنجليزية في مداخلتك، اشبك بقناة اللغة الإنجليزية في تطبيق زوم. أرسل أي ملاحظات مكتوبة مسبقا. سيساعد ذلك فريق الترجمة الفورية على التحضير لمداخلتك، واحرص دوما على التكلم بصوت واضح وبإيقاع طبيعي ليتمكن المترجمون الفوريون من ترجمة بيانك بدقة للغة الأخرى. تجنب استخدام الميكروفون المدمج في جهاز الحاسوب. استخدم سماعة رأس خارجية مزودة بميكروفون لضمان إيصال صوتك بأفضل جودة ممكنة للمشاركين الآخرين والمترجمين الفوريين. أبعد أي عناصر مشوشة عن محيطك، وتذكر أن تغلق الأبواب والنوافذ قبل أخذ الكلمة للحد من أي ضوضاء في الخلفية. أثناء مداخلتك، تجنب استخدام الهاتف الجوال أو الاتصال على شبكة الواي فاي. إذا كنت تقدم بيانا مسجلا مسبقا، الرجاء عدم إضافة نصوص أو موسيقى خلفية. للحصول على الدعم، أرسل رسالة إلكترونية إلى فريق الدعم على العنوان التالي: gbs-it support@who.int. اتصل على الرقم +4122-791-2111 أو اتصل سريعا بفريق دعم الاجتماع على تطبيق زوم باستخدام التفاصيل المعروضة بالحصول على مساعدة فورية. نتمنى لكم اجتماعا موفقا.
为使所有参会者都能获得最佳音质，下面我们与您分享参会指南。在连接之前，请确保您的计算机已安装最新版本的 Zoom。为了使口译工作顺利进行，请确保收听的语言频道与您发言时使用的语言频道相同。比如，您打算在发言时讲英文，请您同时确保连接到 Zoom 平台的英文语言频道。请发送您事先准备的书面稿件，这将有助于口译人员为您的发言做准备。要确保您以自然语速清晰发言，以便口译人员能将您的发言准确翻译成其他语言。 请避免使用电脑内置麦克风。质量良好的耳麦将为其他参会者和口译人员提供最佳音质。限制环境干扰因素。讲话之前记得关好门窗，以防背景噪音。发言时，请避免使用手机或连接到不稳定的无线网络。如果您提供预先录制的发言，请不要使用文本覆盖和背景音乐。如需获得任何支持，请您发送电子邮件至 gbs-support@who.int，拨打+41-22-791-2111，或快速连接到所示链接，迅即获得对 Zoom 会议的支持。我们预祝会议一切顺利。
We'd like to share some good practices with you so that all participants can enjoy the best sound quality. Before connecting, make sure your computer has the latest version of Zoom installed. For the interpretation to work well, it is important that you listen to the same language in which you will speak when you take the floor. For example, if you intend to speak in English during your intervention, make sure you are also connected to the English language channel in Zoom. Send any written notes you have in advance. This will help the interpretation service to prepare for your intervention. And always make sure you speak clearly and at a natural pace, so that the interpreters can give an accurate interpretation of your statement in the other languages. Avoid using the built-in microphone of your computer. A good headset will provide the best quality sound for other participants and interpreters. Limit any disturbing elements in your environment, and remember to close doors and windows before speaking, to keep out any background noise. During your intervention, avoid using a mobile phone or connecting over unstable Wi-Fi. And if you are providing a pre-recorded message, please do not use any text overlays or background music. Should you need any support, you can send an email to gbs-it-support@who.int or call +41 22 791 2111, or connect quickly to the Zoom meeting support details displayed for immediate help.
Excellencies, colleagues, under this item. The floor. Thank you. The floor. Thank you.
Thank you, Madam President. We shall start with those member states delivering regional statements and then move into the national statements. And with that, I have the pleasure in first inviting Indonesia to make a statement on behalf of the ASEAN, to be followed by Cape Verde making a statement on behalf of the Portuguese-speaking countries. Thank you, and Indonesia, you have the floor.
Thank you. Mr. President, I have the honor to deliver this statement on behalf of ASEAN member states. We have been facing this COVID-19 pandemic for over a year now, and fortunately, we have seen the light at the end of the tunnel with the COVID-19 vaccine. We commend WHO on having spearheaded COVAX facility, a truly excellent initiative with the fundamental freedom of equitable principle of COVID-19 vaccines so that no country is left behind. We note that vaccine rollout has started in most countries and we continue to strive for equitable vaccine access. The gap in vaccination rollout between high, middle, and low-income countries remain large and need to be addressed urgently to prevent more new variants from emerging. ASEAN member states have rallied and worked together to address the pandemic in a holistic, comprehensive, inclusive, and practical manner in the Southeast Asia and the larger region. A special ASEAN summit and the Special ASEAN Plus 3 summit was held in April 2020 to address the severe and multifaceted challenge caused by the pandemic. Learning from our responses to the previous crisis in the region, ASEAN has strived to fortify its resilience and preparedness to respond to the future pandemic and health emergency. Effort based on the whole government effort has been initiated to the ASEAN Coordination Council Working Group on Public Health Emergency and other relevant sectoral body. ASEAN has launched a coordination platform to enhance cooperation with external partners and has established the COVID-19 ASEAN Response Fund, the ASEAN Regional Reserve for Medical Supply for Public Health Emergency, an ASEAN Strategic Framework for Public Health Emergency. ASEAN has also continued to mobilize existing initiative and capacity building programs such as the ASEAN Emergency Operation Center Network, the ASEAN Biodiaspora Virtual Center, the ASEAN Risk Assessment and Risk Communication Center, and ASEAN Plus 3 Field Epidemiology Training Network. In view of creating a greener, healthier, and safer Southeast Asia, ASEAN has started its work on the post-COVID-19 recovery. An ASEAN Comprehensive Recovery Framework has been initiated to facilitate regional connectivity and economic recovery. Following adoption, its implementation is ongoing and include discussion on the development of ASEAN Travel Corridor Agreement Framework to support the resumption of essential business travel while ensuring strict health protocol. ASEAN Center for Public Health Emergency and Emerging Disease is also to be established soon to enhance regional health security. Madam President, COVID-19 has brought unprecedented challenge to our member state, not just affecting the health sector, but also impacting the economy and social welfare of the people. Considering the current situation, ASEAN reaffirmed our commitment to work together to control this pandemic. A special video conference of the ASEAN Health Minister has been scheduled later this year. A key item for discussion is enhancing the laboratory capacity across the region and reinforcing genomic surveillance of SARS-CoV-2 to be able to swiftly detect and share information of a potential variant of interest and variant of concern that will be pertinent in determining public health and social measure and infection prevention and control. Finally, ASEAN calls upon all member states to work together to intensify regional and multilateral cooperation to end this pandemic together and to better prevent, prepare, respond to other public health emergency. I thank you.
Thank you, and may we now invite Cabo Verde to make their statement on behalf of the community of Portuguese-speaking countries.
Sr. President. Madam President, I speak on behalf of the community of Portuguese-speaking countries. Allow me to congratulate the WHO, especially the Director General, for his commitment and leadership during this profound health crisis that impacted seriously countries' economic and social fabric. Since the WHO declared COVID-19 as a public health emergency of international concern in January 30th, 2021, the pandemic has punished countries all over the world. Without exception, it has created an unprecedented health crisis. All over the world, more than 165 million cases of COVID-19 have been identified, leading to more than 3.4 million deaths. The epidemiological situation in the community of Portuguese-speaking countries is no exception, and it requires huge efforts in resource mobilization to improve the health care system, especially for patients in intensive care units. Access to diagnostics is essential to identify suspected cases and for contact tracing. Notwithstanding, this is totally dependent on the availability of tests and their geographic distribution. Madam President, the need to build community resilience has been discussed in the third ad hoc meeting of the Ministers of Health of the Community of Portuguese-speaking countries, in which they expressed concerns about the epidemiological development and adopted a set of measures to fight and respond to the pandemic. In that meeting, countries reiterated and strengthened commitments made during the fifth ordinary meeting in 2017 regarding the coordination of health surveillance and response, including epidemics and disasters. The Community of Portuguese-speaking countries consider that universal and equitable access to vaccines, diagnostic and safe and effective quality treatment for COVID-19 is of utmost importance. Universal access to vaccines is a prerequisite for an effective international vaccination and for containing the spread of the SARS-CoV-2. With that in mind, the Community of Portuguese-speaking countries ask those countries that have exceeding doses of vaccines to share them with us so that we can advance on our broad vaccination campaign. The Community of Portuguese-speaking countries acknowledge the importance of inoculation as a global public good and supports the international initiatives and collaboration to accelerate the development, production, and equitable access to vaccines. Integrated public policies, including the strengthening of health systems, are tools that drive the recovery and should be implemented in order to slow down the negative effects of the pandemic. Therefore, the Community of Portuguese-speaking countries calls on the WHO to continue its efforts to offer collaboration and assistance to those countries most affected by the COVID-19 pandemic, especially those with vulnerable health systems, where vaccination programs have been delayed. To conclude, we'd like to highlight the efforts to raise population awareness regarding the adherence to different programs, and we'd like to express our appreciation for all health professionals and those who have been involved in fighting the pandemic. Thank you very much.
Thank you very much. And may we now invite the Russian Federation to be followed by Nigeria.
Esteemed Director General, colleagues, I would like to begin my statements with a few words of sincere gratitude to the medical community for the selfless efforts that they have undertaken to fight against COVID-19. The pandemic continues to remain a difficult test for all countries of the world. Russia, aware of the scale of this challenge, is providing all-round assistance to the international community. Struggling countries have received supplies of medical equipment and medicines, and Russian specialists on a number of occasions have traveled to foreign states to treat patients. And we are continuing to provide financial assistance to a whole host of international organizations, including the World Health Organization. We note that the foundation of the fight against infectious diseases must continue to be the international health regulations adopted by WHO in 2005, and they have proven their relevance and effectiveness. We note that it is inadmissible to create mechanisms that duplicate the work of the WHO to combat the pandemic. The large-scale immunization of populations is a key element to preventing the spread of the infection. Russia was the first country in the world to register a vaccine against coronavirus, and we have at our disposal another 3 effective vaccines against COVID-19. Our flagship vaccine, Sputnik V, has been registered in 70 countries, covering almost 40% of the global population. Bilateral channels that are being used to transfer vaccines contribute to diversifying supply chains, transferring national technologies, and creating jobs. In order to improve the availability of vaccines, the Russian Federation supports the idea of removing the patent protection for vaccines against coronavirus. We propose that the WHO optimize the procedure for the pre-qualification of new vaccines in order to reduce the time taken to consider applications. The pandemic has become a driver for the use of digital health technologies. Russia has implemented a single information system to monitor infectious diseases, the foundation of which is the Federal Register for Patients Suffering from COVID-19. At its core is a service to keep populations informed and to issue vaccine certificates. As part of efforts for digital pharmacosurveillance, we have implemented the mass monitoring of the effectiveness and safety of the Sputnik V vaccine, and we obtain high-quality RWD data. In terms of the digitalization of medical provisions, a federal medical benefits register has been created, and we are concluding work on implementing a system to monitor the movement of medicines across all medical and pharmaceutical organizations. The novel coronavirus infection is severe for patients with chronic diseases, particularly those suffering from tuberculosis. We call upon countries to spare no efforts in preventing the return of an epidemic of this terrible infection. Thanks to its systematic work, the Russian Federation has managed to be taken off the WHO list of countries with a high burden of tuberculosis. We express our determined readiness to support WHO's efforts in combating tuberculosis, and particular attention needs to be paid to preventing non-communicable diseases, which are among the leading causes of mortality. Russia has presented for consideration by the Assembly a draft resolution to reduce the burden of diabetes and to adapt a global NCD action plan. We express our gratitude to countries for the support that they are providing. Thank you for your attention.
Thank you very much. And may we now invite Nigeria to be followed by Portugal. Nigeria, you have the floor.
Thank you, Madam Chair. Nigeria aligns itself with the statement of Benin on behalf of the African region, and I bring you greetings and best wishes of the government and people of Nigeria. The past year has been daunting and defined by the novel SARS-CoV-2 virus that challenged health systems and battered country economies the world over. It changed the way we live and do business, with World Health Assembly convening for the second time virtually. Millions of lives have sadly been lost and many more sickened. With new surges and variants of COVID-19 in some countries, others are anxious about protecting their citizens. The speed with which COVID-19 has spread around the world demonstrates that it is a threat to mankind rather than to individual nations. Therefore, global solutions under an empowered World Health Organization are required. Nigeria has not spared the impact and has perhaps fared better than some others so far, but it by no means sees itself as free from the shadow of a new COVID-19 surge. Some experts have stated that it is a matter of when and not if. Nigeria's government has already preemptively activated social and public health measures and non-pharmaceutical and other interventions to reduce risk. Less than 2% of Africans have received COVID-19 vaccination, and with just 4 billion COVAX doses allocated to Nigeria, and with follow-up delivery uncertain, we opted to fully vaccinate about 2 million health workers and elderly in phase 1. By May 19, 2021, 93.5% of the target population had been reached with first doses, and will receive the second dose by July 9, 2021, when current stocks expire. I thank partners and governments who kindly supported us from the onset of the outbreak till now. The COVID-19 pandemic is a threat to already struggling health system. Another wave could be calamity if we do nothing. Vaccination go on in all countries, but will stall soon. It may need due to vaccine stock out. In our view, it is time to share their doses with Africa and other low and middle income countries in the name of equity and not just to give away vaccines that are about to expire or when moved by horror stories of a surge. Unfolding events elsewhere show clearly that vaccination is of best value only if given before a mass COVID-19 resurgence and not during or after. Nigeria received polio-free certification in August 2020 with great relief. We are, however, among countries still dealing with sporadic cases of circulating vaccine-derived poliovirus, and technical tools to address it include routine polio and novel OPV immunization. Allow me to stress that resilient primary healthcare systems are indispensable in the long term for this purpose and the related purposes like COVID-19 response, and they should therefore be supported by partners. In the past 5 years, Nigeria invested heavily in national public health security to align with WHO emergency program areas. Country capacity is strengthened along the 13 thematic areas of international health regulations to coordinate activities of the National Action Plan. Signs of donor fatigue and diminishing resources, Nigeria pledges to use donations and allocations judiciously and hereby expresses interest in technical and material support from the WHO and member states to develop our systems and our manufacturing capacity. I thank you for your attention.
Thank you, Honourable Minister. May we now invite Portugal to be followed by Argentina.
Director General, distinguished colleagues, I'm honored to address the 74th World Health Assembly on behalf of Portugal. We align ourselves with the previous statements made by the EU. Portuguese is the 5th global language in terms of importance. It's the official language in 8 countries, and it's spoken by over 280 million people in all continents. Also within the WHO, we have been promoting Portuguese and advocating for multilingualism. Allow me to start by recognizing the work accomplished by the World Health Organization in addressing the most serious public health crisis since its foundation. As we continue to fight this pandemic, many achievements and their reach can hardly be overstated. Such achievements, like the multiple vaccines being administered worldwide, are astonishing as they are unprecedented, and it would have not been possible without the guidance and leadership of the WHO. The successful efforts made to develop COVID-19 vaccines or the setup of the ACT Accelerator illustrate the paradigm of multilateral cooperation embodied by this organization. Both are remarkable examples of collaboration and solidarity. However, as we celebrate success, we must also recognize failures, and the report by the IPPR is blatant in its conclusions and assertive in its recommendations. This was a preventable pandemic, and the responsibility for a faulty, delayed, and ineffective response may be ascribed to many actors, state and non-state actors. The price we have to pay for not acting immediately on the panel's recommendations is too shocking to consider. As we contemplate what lies ahead and take on the arduous task of recovering from the effects of this pandemic, we have a historic opportunity to end many inequalities, including those that persist in our social protection and health systems. Together, we must take a leap forward towards an equitable and inclusive future with social protection mechanisms that are more resilient and responsive. The overwhelming speeding at which COVID-19 spread throughout the world made it clear that the upgrade of surveillance systems, digital transformation, and global cooperation are crucial to strengthen the world's resilience in the face of cross-border public health threats. Strengthening mental health support is also vital, dictated by the increased incidence of conditions stemming from the psychological effects caused by the pandemic. Lastly, the renewed commitment to the 2030 Agenda and the SDGs is the only path for achieving UHC. The new global health architecture, derived from our collective effort, must be capable not only of dealing with future global crises, but also fighting to prevent future crises. Thank you very much.
Thank you. And may we now invite Argentina to be followed by Botswana.
Gracias, señor director general.
Thank you, Mr. DG. The COVID-19 pandemic represents one of the major challenges that humanity has had to face in its history. It's had serious health, social, and economic consequences, and without a shadow of a doubt has also made it harder to reach our sustainable development goals. Latin America faces doubtless one of the most critical moments in the pandemic. We are facing a new wave that is impacting all our countries greatly. We also need to face unprecedented challenges that require innovative solutions based on coordinated global action based on values such as solidarity, equity, and respect for gender and human rights. In the current scenario, vaccines, medicines, and other health technologies represent essential tools to the right to health that need to be understood as global public goods. Therefore, we are deeply concerned by the inequality that has characterized the distribution and access to vaccines at a global level. This has seriously affected our region as well as other WHO regions. We believe firmly that we need to strengthen local production as well as production of specifically health technologies, and capacity building at the regional and national level can truly remedy the situation in the face of future health pandemics that doubtless will occur. Issues such as IP and technology transfer are essential pillars if we're going to expand the production of medicines in our respective countries. We need to address these obstacles in the supply chain. In an international context, forums such as this one, the World Health Assembly, and others such as the Third Fair Pricing Forum that Argentina had the honor of co-sponsoring together with WHO are doubtless places which allow us to work on solutions towards a shared goal that involve many different actors. As was emphasized in the Fair Pricing Forum, we need to bring to the fore the role of transparency, the costs that go into R&D, supply chain costs, and everything that goes into the creation of vaccines. And each government needs to set up an agenda for innovation. All those elements are key. We need strong multilateralism, and to achieve this, we need governmental commitments, but also the cooperation and support of industry actors, those who produce vaccines, be they public or private. And this also needs to include states as well as international organizations and agencies, as well as civil society. We support the work to strengthen WHO so that it can respond to health emergencies more readily. We are convinced that we can develop concrete, coordinated action to put an end to this pandemic and to prevent future health emergencies and to build together a world that is both healthier and fairer. Thank you very much.
May we now invite Botswana to be followed by the Republic of Korea.
Thank you very much, Director. Director General, Excellencies, distinguished delegates, Botswana aligns with the statement delivered by Benin on behalf of the 47 member states of the Africa region. We thank the Director General for the high-level address, including on the update on the 3 billion targets of the 13th General Program of Work. We note with appreciation the achievements made. The outlined priorities will ensure that we sustain the health gains achieved and accelerate our progress towards universal health coverage. Human resource for health, as stressed by the Director General, remains the cornerstone of the public health care system. Botswana highly appreciates the designation by the World Health Assembly of the year 2021 as the International Year of Health and Care Workers, in appreciation and gratitude for the unwavering dedication in the fight against the COVID-19 pandemic. We further commend the commitment and contribution of all healthcare professionals to ensure continuation of provision of quality essential health services. Chairperson, we know that equity has emerged as a central thread in all areas of health and development. In this regard, we are deeply concerned about the inequitable access and distribution to COVID-19 tools, including vaccines, diagnostics, and therapeutics in low and middle-income countries, which continue to hamper our ability to end this pandemic. In this connection, we thank the Director General for his continued advocacy for global solidarity and equity. However, as Botswana is an upper middle-income country, it must be noted that the pandemic has undermined our ability to respond effectively in respect to accessibility and affordability of COVID-19 products. Botswana is at a stage where COVID-19 vaccines are being administered to the people of Botswana. The country adopted a COVID-19 risk-based vaccination plan, which prioritizes the elderly, including those with comorbidities and the frontline workers. In an effort to secure vaccines for its people, Botswana has subscribed to multilateral pool procurement mechanisms, including COVAX facility. Lastly, Chair, we welcome the CSWHA theme, ending this pandemic, preventing the next, building together a healthier, safer, and fairer world, which sets the tone for building fairer and resilient health systems as a key investment to assure health security. I thank you, Chair.
Thank you, Honourable Minister. May we now invite the Republic of Korea to be followed by Malta.
Honourable Chair, Director General, distinguished delegates, the world has been working together to combat COVID-19 based on principle, no one is safe until everyone is safe. Yet our member states have been showing considerable disparity in their processes and pace. For our part, Korea has been supplying COVID-19 diagnostics worldwide and through contract manufacturing of vaccines contribute to making sure that vaccines reach every country. Korea promises active support for WHO activities in the future as well. Today, most of all, I would like to suggest a way that we as a global community can end this pandemic and prevent the next. The first, in order to combat the current pandemic, we must focus our efforts on developing vaccines and therapeutics as well as expanding their production. For our way back to normal and continued fight against variants of concern, we need to expand the vaccine production through new manufacturing bases and technology transfers. At the same time, Korea calls for everyone's attention on streamlining clinical trials by establishing tools such as ICP to facilitate the development of next-generation vaccines. Next, in order to prevent the next pandemic, we need to revamp global health emergency response systems. Especially, Korea would like to emphasize the importance of timely notification and information sharing regarding threats to public health. Timely detection and notification of health emergencies through strong health systems are essential elements of preventing disease X from developing into a pandemic. The same principle applies to the Japanese government's decision in April to discharge contaminated water from the Fukushima nuclear power plant into the ocean. In this context, the Korean government hopes that the Japanese government transparently discloses information and urges that extensive consultations with stakeholders should take place before any disposal as the matter is unprecedented. Korea also requests full objective verification with the participation of the WHO, IAEA, and the international community on this matter as well. Thank you.
Thank you. May we now invite Malta to be followed by Kazakhstan.
Madam President, Director General, Regional Directors, colleagues, Malta aligns itself with the statement delivered by Portugal on behalf of the European Union and its member states. A year on, COVID's great toll on health, economies, and society in general is evident, but our shared threat has brought shared solutions. Amongst others, we know that vaccines work. The vaccination rollout is well underway in Malta, and we are tangibly experiencing good results in terms of lowered positivity rates and a significant decrease in hospitalizations, ITU admissions, and COVID-related deaths. Collaborative work in joint procurement of COVID-19 vaccines by European member states has proven to be an exemplary mechanism, demonstrating that together we can achieve better outcomes. Such advanced purchase agreements could be replicated widely in many fields to encourage research and development and improve access and price transparency of cancer treatments, orphan drugs, antimicrobials, and others. Malta reiterates that all efforts should be maintained towards equitable access to and fair distribution of qualitative, safe, efficacious, and affordable medicines and vaccines. We commend WHO's work with partners towards ensuring wider availability and access to COVID-19 vaccines. Gaining public trust and addressing vaccine hesitancy through a broad communication strategy, Malta has vaccinated 70% of our adult population with at least a single dose of the vaccine. 38% have been fully vaccinated. In the light of increased mobility and until adequate global immunity levels are achieved, we also recognize that prudence, continued surveillance, and timely public health action is crucial. We look forward to further developments and technical guidance regarding the length of immunity afforded by the various vaccines. Looking ahead, we recognize the significant impact of this crisis on the mental health and well-being of our citizens and workers, including healthcare workers and other frontliners who have worked tirelessly, often going beyond the line of duty. Malta continues to implement and build on our national mental health strategy, with a focus on improving mental health services, particularly in the community. We appreciate the prominence being given to mental health by WHO and look forward to engaging further in discussions during the International High-Level Euro meeting in July. Likewise, Malta calls for further multi-sectoral action and collaboration to tackle antimicrobial resistance, learning from the pandemic to address the growing threat of AMR. Lastly, Malta wishes to express its appreciation and support to WHO and thanks Director General Tedros for his leadership throughout this extended difficult period. We remain committed to working proactively and collaboratively towards a better, healthier, safer, and fairer world. I thank you.
Thank you, Malta. May we now invite Kazakhstan to be followed by Sweden.
Thank you, Madam Moderator, distinguished Director General, delegates of the 74th World Health Assembly. 2020 was a challenging year. In 2021, Kazakhstan pays particular attention to providing measures to counter coronavirus infection, strengthening epidemiological service, vaccinating population against coronavirus infection, strengthening transport medicine in remote areas, improving quality of medical services, and constructing modern hospitals and others. Kazakhstan, for now, has a comprehensive system for assessing and forecasting the epidemiological situation. With the support of the WHO, Kazakhstan started registration of COVID-19 cases without laboratory confirmation based on clinical and epidemic data. Kazakhstan has developed its own vaccine against COVID-19 and started vaccination on February 1st, 2021. We widely use IT technologies, including vaccination passports. The main priority for the healthcare system now is to ensure the access and quality of primary healthcare. During the COVID-19 pandemic, primary healthcare remains one of the key measures for responding and providing essential health services to the population. As this issue is becoming increasingly important for today's global agenda, Kazakhstan is initiating to include primary health care to the agenda of the 77th session of the UN General Assembly and hold a high-level meeting in September 2022. The purpose of this high-level meeting is to familiarize the heads of the UN member states with the operational framework of primary healthcare and ensuring universal health coverage and achieving the Sustainable Development Goals, as well as its role in the implementation of response measures to combat COVID-19 pandemic and others. Kazakhstan is also taking the initiative to hold a high-level event called The Role of Primary Health Care in COVID-19 Pandemic Response in Leading Equitable Recovery, which will take place on June 22nd. We want to take this opportunity to ask the WHO Director General to support the initiative and hold this event and to speak to the participants on the importance of using this document. We also invite WHO member states to actively participate in discussing the primary healthcare role as a COVID-19 response measure and its further promotion on the level of UN General Assembly. Dear Dr. Tedros, distinguished delegates, the COVID-19 pandemic has affected all countries and only joint actions of the global community will help to cope with it and to return to the normal life. As stated earlier, we need bold ideas and bold commitments. Thank you for your attention.
Thank you, Kazakhstan. May we now invite Sweden to be followed by Côte d'Ivoire.
Excellencies, ladies and gentlemen, dear Dr. Tedros, I would like to thank the Director General for his report and to align our statement with the statement made on behalf of the European Union. It has been an overwhelming year for all of us. The pandemic has hit hard all over the world. So many lives have been lost. Our health workforce has been stretched to the limit, and health systems have been challenged like never before. Economy worldwide have been severely affected, and poverty and lack of access to education has become an even bigger problem than it was before. Adding to that, there have been rapid increases in risk of violence and reduced access to care, including sexual and reproductive health and rights. This means that we are failing short of our goal to secure universal health coverage and ensuring health and well-being for all. In fact, the world is now at risk of seeing entire generations falling behind. This is something that we must avoid at all costs. We must act now to end this pandemic, and we must commit to taking decisive steps to prevent another global health crisis. It's paramount that we act on the recommendations from the independent panel, the IHR Review Committee, and the oversight body of the Health Emergencies Program. Now, more than ever, we need a strong World Health Organization to coordinate the global health response and to create a fit-for-purpose preparedness system. No one is safe until we are all safe. Sweden stands prepared to do our part. We commit to unearmarked financing of WHO, ensuring a strong preparedness system and providing robust data for surveillance. We hold ourselves accountable to the international health regulations. We commit to global vaccine solidarity and support to the COVAX facility, of which we are proud to be the world's largest donor in per capita terms. We commit to supporting the Health Emergencies Program, and we commit to ensure that the WHO is equipped to perform its important work wherever it's needed. We must all do what we can to create stronger national and global systems for surveillance, preparedness, and response. We need to invest in our own health systems to equip them better for the future. Viruses see no borders. In this pandemic and in the next one, we must all act to ensure that lives are protected. The term health in all policies is key, and the role of public health and health systems preparedness cannot be overestimated. I look forward to taking great strides forward with all of you in the years to come. Together, we can create a better future for everyone. Thank you.
May we now invite Côte d'Ivoire to be followed by Morocco.
President, ladies and gentlemen, I would like to welcome all of the participants of this World Health Assembly, and we are pleased to be able to participate also. Well, the data is available. Epidemics are taking place, and COVID is the biggest example of this. These different threats should concern us, and we need to act now. Madam President, this is a challenge for humanity, and we need to show solidarity and be able to move forward. Solidarity is fundamental. It needs to be at the heart of the management of this pandemic. We need to be open to dialogue and to collective responsibility. The issues are complex, and this is why we need to commit to efforts and to intelligence and to establish networks and to strengthen existing networks. Madam President, Côte d'Ivoire is delighted to have experience in dealing with epidemics. In fact, the threat of the Ebola virus, which affected the West African population between 2014 and 2016, and the response to yellow fever epidemics have strengthened our health systems. Also, the Ivorian authorities have put into place a platform and healthcare operations which facilitated the detection of COVID in March of 2020. Our government has made funds available in order to fund the response to this pandemic, and has also provided funds for economic support for the population. Madam President, we commend the COVAX facility, and we have received a number of doses of the AstraZeneca vaccine. Vaccination sessions are taking place, and mobile teams have been deployed across the entire national territory. Many doses have been administered, and many people have received the population. Madam Chair, distinguished delegates, a number of challenges remain, and they require us to redouble our efforts and our intelligence in order to deal with these challenges effectively. It is our common responsibility. We need to build together a more healthy world, a fairer world. And this is something that we need to do right now. Thank you.
May we now invite Morocco to be followed by Panama.
In the name of God, the merciful, the compassionate. Madam Chair, ladies and gentlemen, Mr. Director General, distinguished ministers and ambassadors, the global crisis we are confronted with is one of the most difficult situations we have confronted in contemporary times, which requires a comprehensive and coordinated response through vaccination and treatment. It is important that we provide medicines and vaccinations in an equitable way through COVAX facility. The situation in the Kingdom of Morocco is stable at the moment, in spite of the various variants that have been recorded. All these measures were based on the instructions of His Majesty King Mohammed VI and the attempt to take the necessary measures to deal with the situation of nationals and foreigners. The situation at the moment requires a higher level of health response, and in this situation, His Majesty the King gave instructions for the implementation of a three-staged approach over 5 years, whereby we will be providing services to an extra 22 million citizens. The final phase of this process will provide a recorded database whereby individuals and families will be compensated for loss of income, and the policy adopted by the government aims to improving palliative care. The government is also embarking on a policy of improving human resources in the medical sector while allowing foreign doctors to practice in the country. There is also a policy of involving all sectors in the response to the pandemic, and all sectors, including the private sector, would be heavily involved in this process, with a new policy for involving the other sectors in the process. I would like to praise the efforts by health staff who are in the front line. And I would like also to thank the Director General for the assistance provided by the organization. May the Almighty help us in confront this pandemic. Thank you for your attentive listening.
Thank you. And now to Panama, followed by Egypt.
Buenos días.
Good day. Esteemed President, Ministers, Director of the World Health Organization, ladies and gentlemen. Panama wishes to express its gratitude towards WHO for all the solidarity and cooperation shown during the pandemic. We've seen that multilateralism is the way to overcome global challenges. Only by showing a united front and by pooling our strengths will we succeed. We also want to take advantage of this opportunity to recognize all the work of the scientific community, especially those experts in our country and all the health staff that through their different specializations have provided essential support in this fight. The support of WHO has been absolutely essential for our country and has also allowed us to move forward on a bilateral basis, moving forward with new strategies, special contention measures to limit the spread of the virus. Just like other members of the international community, Panama places a great importance on public health, and we've had to make sacrifices with respect to our social and economic interests. Just like other countries in the Americas, we had to implement measures and border checks, which were a great challenge for our software platforms. However, first and foremost in mind was always to protect the health and well-being of all our population. We also wanted to help continue to contribute to the safe transmission of goods and peoples throughout the world. We've worked to raise awareness in different sectors, trying to reach each and every individual, as well as families, with an understanding of promotion and prevention. And we also tried to promote biosafety, which allowed us to emerge from our second wave and now we've reached a stable plateau. We want to welcome the support of the private sector, as well as religious organizations and civil society. All these actors understood that this was an extremely sensitive time, and that a crucial part of the war against the pandemic had to take place at community level. And we had to do this with true and real social participation. I would urge you to continue working together, to continue to cooperate with closer ties, if possible, between governments and multilateral organizations, because COVID-19 is merely a reminder that 8 billion people are now facing a common challenge that we could not face separately. The solution is in our hands. We need to work as a team. Thank you very much.
Thank you, Panama. And may we kindly remind member states to please adhere to the allotted speaking time of 3 minutes. Thank you, and we beg your indulgence. With that, may we now invite Egypt to be followed by the Netherlands.
Dear Dr. Tedros, Your Excellencies, I would like to start by extending my thanks to all those who has contributed to the organization of this assembly, especially Dr. Tedros, with whom I have close working relationship. The strategies adopted in this session shows that we are operating in exceptional circumstances, and we hope that we will be able to achieve our goals and recover from this pandemic. We have to build on the experience that we have accumulated over this period, and the member states have realized the need to continue with providing primary health services and dealing with the most vulnerable in the first place. We have acknowledged the right of children to continue to enjoy normal life, and we continued with the vaccination against measles and other diseases, and this is part of what we have worked on, complemented by mental health. We have adopted a national plan to deal with chronic and non-communicable diseases. Also, we embarked on implementing a national plan which Egypt has accelerated, relying on public health services. This resulted in the elimination of viral hepatitis, and we were able to reduce the level of morbidity as a result of non-communicable diseases. I would like to take this opportunity on highlighting the importance of the efforts by the government and the investment in the health sector. This is important in protecting citizens and providing security for our citizens. This pandemic, with all its problems, has provided an opportunity to improve the quality of services. Egypt played an important role in developing the Sinopharm vaccine, and we have contributed to the COVAX facility. We have also contributed to the African mechanism, AVAT, and it was clear to us that it is important to adopt an international strategy to provide vaccines and medicines with special emphasis on transfer of technology. Egypt has already built a constructive relation with other member states and the development of vaccines, especially with China. We hope that Egypt will become a central hub, a regional hub for the provision of cheap medicines and affordable medicines. And the pandemic has taught us a lesson that regardless of the differences that we have, we are all part of one human race, and we need to adopt a rigorous policy that would enable us to overcome this crisis. Thank you, ladies and gentlemen.
May we now invite the Netherlands to be followed by Canada.
Dear Chair, Director General, distinguished colleagues, it is my honor to speak to you on behalf of the Kingdom of the Netherlands. We align ourselves with the statement made by Portugal on behalf of the European Union. Let me first express our appreciation for the World Health Organization and health workers worldwide. The evaluation panels are very clear. None of us were prepared for this pandemic, even though we were warned. We know now that political leadership, transparency, community engagement, and sustainable and predictable financing for WHO are essential. And this calls for a global health framework, supported on the highest political level. I hope that during this World Health Assembly, we can start the process for such a new framework, building on principles set at the Global Health Summit last week. We need to prevent future zoonotic outbreaks and to combat antimicrobial resistance. Therefore, it remains vital to bolster the implementation of the international health regulations. Investing in resilient local health systems from a One Health perspective is key. And the Global Leadership Group on AMR, in which I participate, advocates for political action. Preventing pandemic crisis should be our common aim for the years to come, and we need to help each other out of this crisis as well. Access to vaccines is therefore of utmost importance. The Netherlands is committed to making a substantial batch of vaccines available through the EU vaccine sharing mechanism and COVAX. But there's more than vaccines. The Access to COVID Tools Accelerator is a unique partnership to which the Netherlands has contributed 147 million euros. It will, however, only be truly effective if global equitable access to all tools is ensured. And meanwhile, we cannot lose sight of pre-existing crises. We need to ensure that essential health services, routine vaccinations, and activities continue, in particular for WASH, mental health, and psychosocial support, HIV and AIDS, and sexual and reproductive health and rights. And in doing so, we need a strong and trusted WHO. We were shocked by the recent revelations of possible inaction by the WHO after alleged sexual abuse by WHO staff. A quick and thorough response is needed. We thank you again for all efforts to overcome this health crisis and building a healthier, safer, and fairer world for all.
Thank you. And may we now invite Canada to be followed by Eswatini. A distinguished delegate from Canada, it would seem we're unable to hear you. If we could kindly ask that you would unmute. Thank you. If we could kindly confirm that Canada is still in a position to deliver its statement. Thank you very much. And it would seem that we're having some technical difficulty with the sound. May we suggest that we move on to Eswatini to be followed by Bangladesh, and then we shall try and return once more to Canada. Thank you, and Eswatini, you have the floor.
Excellencies, dear colleagues and friends, the Kingdom of Eswatini has not been spared by the COVID-19 pandemic and experienced a severe second wave that resulted in a drastic increase of cases and deaths compared to the first wave. The country has recorded 1,855 cases per 100,000 people and 67 deaths per 100,000 people. Currently, we are seeing very low numbers. Eswatini is on alert and using achievements and lessons learned to strengthen health systems to respond better in the event of the third wave. Our achievements include a ground-up construction of a 100-bed COVID-19 facility and expansion of clinical spaces in the country. The establishment of the COVID-19 testing laboratory and oxygen generation plants have ensured self-sufficiency for these needs. We have learned that we need to significantly increase investment in epidemic preparedness finances, human resource equipment, medication, and capacity building, especially for critical care skills, to minimize delays in the response. Public health education and engagement are crucial to ensure public health social measures are implemented to prevent disease transmission. More importantly, the role of transparent and decisive leadership has ensured achievement of set goals and sustained our response. Our gratitude to WHO and to all our supporting partners. We have, however, faced challenges including emergence of new variants that test our understanding of coronavirus and response mechanisms. We are currently working to expand our TB genomic sequencing to COVID-19 within the next week to fill this gap. Poor access to vaccine has limited our ability to bring things back to normal, but with the few 32,000 doses received so far, we have managed to vaccinate over 35,000 of our population and are ready to scale up rapidly. The COVID-19 pandemic has provided a wake-up call on our global interdependence to health threats. No country can control pandemics working in isolation. Taiwan is no exception. The Republic of China, Taiwan, has provided Eswatini with critical support in the response. They further brought capacity in country to manufacture high-quality surgical masks, augmenting our commercial space to export. Recently, Taiwan has also had to face significant challenges. Only through international cooperation can we realize early containment of the pandemic and leave no one behind. Let us therefore unite and work together to win this war against COVID-19. Your Excellency, I thank you.
Thank you. May we now invite Bangladesh.
Thank you. Madam President, today we have a grim picture before our eyes. Devastated economy, overwhelmed health system, record number of unemployed people, huge loss of lives, and so on. Each and every country is struggling, but it is a fact that the developing countries are disproportionately affected, and hence global efforts must consider such national circumstances. Since the inception of the pandemic, Bangladesh responded with the whole of the government approach under the leadership of our Prime Minister Sheikh Hasina, and it took possible emergency measures in line with WHO's Global Strategic Preparedness and Response Plan. Since launching of nationwide COVID-19 vaccination in February, within 3 months, over 5.8 million people have received the first dose, and around 3.5 million have received the second one. However, there is a shortfall of around 2 million doses of AstraZeneca vaccines to cover the second dose due to sudden supply disruption, and we need those on an urgent basis. We count on the COVAX facility to help us overcome this unforeseen crisis, as we also expect to receive the supply of 20% of the total need committed already under this facility. Madam President, the government of Bangladesh is steadfast to ensure affordable and quality health services for its people and to attain the health-related SDGs, including the universal health coverage target. Due to our pragmatic policies, we have been able to bring down child and maternal mortality rates significantly. We have taken primary health care to the reach of even rural people through community health clinic and other measures. While national efforts are required to guarantee the well-being of the people, the global health system must be rebuilt to respond to global health crises like the current one. We need a WHO which is strong, effective, and fully equipped to provide leadership in fighting such calamities through coordinated and timely response. In this context, my delegation would like to highlight a few points. First, the COVID-19 vaccines must be treated as global public good and vaccine hesitancy, nationalism, and protectionism must be put aside for a just and equitable vaccine regime for all. Second, production of vaccines, therapeutics, diagnostics, and other medical equipment must be scaled up to meet the global demand through sharing of technology and technical know-how, as well as providing compulsory or voluntary licensing to help the pharmaceutical industries and other health-related industries across the world. Third, provisions of the TRIPS agreement must be waived temporarily to help the development, manufacturing, and distribution of COVID-19 vaccines, therapeutics, and other tools to fight the public health crisis. Fourth, mental health has been severely affected due to this prolonged pandemic, justifying the necessity to integrate mental health services into healthcare system. We must strive to do so. And finally, global, regional, and national targets should be set up to achieve the goals of antimicrobial resistance, which is a significant public health concern and which could aggravate during the times of pandemic. I thank you, Chair.
Thank you, Bangladesh. And may we now invite Mexico to be followed by Chile.
Dr. Tedros, señores.
Esteemed Dr. Tedros, distinguished ministers, today we're in an important health forum, and I wish to recognize all the efforts made to step up to the challenge of the pandemic. Today we build a better future with our feet planted firmly on the ground. Alone we are powerless. We are exploited by a system that excludes. Today, more than ever, it's been shown that we've only survived thanks to collective agreements. Today, we're more familiar with SARS-CoV-2, and we have more information that gives us different options when it comes to making the right decision to facing this shared enemy. Today, science bears fruit, and vaccines are a reality. Mexico wishes to recognize all international efforts to promote national vaccination programs. However, we share WHO's concern in the face of limited production and distribution of vaccines, and especially with respect to the stark inequality of access, especially regarding those countries that have not been able to access a single dose. The challenge is immense, but the need is just as big. So we want to reiterate our appeal to promote equitable access in this health crisis. This will not be achieved unless we have solidarity and complete commitment with values such as our public health as a public good. As our president has said, health needs to be for all people in all places. To reach this utopia, Mexico is encouraging different alliances that promote technology and knowledge transfer so as to overcome bottlenecks in the supply chain and the manufacture as well administration of vaccines. For example, thanks to support of friendly nations such as Argentina, China, and Russia, we have promoted a special program that promotes the use of safe vaccines in our country. In a very short space of time, Mexico has set up alliances that could be replicated in other parts of the world to accelerate the manufacture and distribution of available vaccines. We need to address capacity building and the supply chains in the Americas region and the Caribbean, as well as our brother nations in Africa, so as to streamline the process and so as to benefit the entire world. We need to act now, not tomorrow, to strengthen our healthcare systems, to fight against COVID-19 and other scourges such as maternal death, HIV/AIDS, NCDs, and so forth. Today, not tomorrow, we need to start to rebuild our healthcare systems, focusing on primary healthcare and also bearing in mind the social determinants of health. That is why Mexico wishes to reiterate its commitment to rebuild health policy so that we can awaken from any nightmare of exclusion, which allows us to move forward in harmony with the environment and not destroying it. We need to strengthen access and solidarity, and we need to recover the advice of Bertolt Brecht who said that only those peoples who live by their convictions can have hope. Thank you.
Thank you. May we now invite Chile to take the floor.
Señor Director General de la
Mr. DG of the World Health Organization, Madam President, distinguished delegates. We are deeply thankful for all the efforts carried out by the DG when it came to preparing this World Health Assembly. Organizing it in a virtual format was a major challenge. We are all at a very particular time in global health. The decisions we make here will influence how we face the ongoing pandemic, and will also set out guidelines for how we will face future pandemics. As a country, Chile has followed with a great deal of interest how the crisis has unfolded, and we have applied policies as our knowledge of the disease increased. We also adapted our healthcare system to face the challenge. By doing so, we've been able to show that we can well and truly integrate public health and private health systems. In this regard, we want to emphasize the essential role played by WHO when it supported a coordinated global response with the participation of all key actors representing values such as solidarity and fair access to health. The ACT Accelerator that has facilitated access to the tools against COVID has been an effective instrument that has allowed COVAX to move forward, among other initiatives, and this has facilitated access to vaccines. The support and guidance of WHO, specifically in our region, the support of PAHO, have been crucial to face this challenge. It's also helped to identify those spaces where we need to rethink capacities and develop new skills, and we hope to have a more integrated approach in Latin America and include more countries. We have a complex geopolitical setting where we need to accept our responsibility towards multilateralism. It needs to be legitimate and inclusive, and it needs to be broad. It needs to be sufficiently broad to help governance. We need to improve our response capabilities to pandemics. We also need to improve the reaction time of WHO in the face of health crises. Resolution 148. This is a shared responsibility for all countries. In this forum of fruitful debate, Chile wishes to join the creation of useful ideas and how we look at the future global health architecture. Thank you very much.
Thank you, Chile. And I now have the pleasure in handing back to Madam President.
Thank you. I would now like to hand over the facilitation of the remainder of this session to the Vice President of the Health Assembly.
Je vous remercie. Nous allons continuer à écouter les déclarations.
Thank you. We're going to continue to hear delegations, and I shall give the floor to the Secretariat to moderate the debate. You have the floor.
Thank you very much. And with that, may we now invite the distinguished delegate from Niger to be followed by Burkina Faso. Niger, just confirming that you're still in a position to deliver your statement. Thank you.
C'est bon, on est en ligne. Merci, madame.
Thank you, Madam. Madam President, Ministers, Mr. DG of the World Health Organization, ladies and gentlemen, esteemed colleagues, Niger would like to express its full support to the theme of putting an end to the pandemic and working towards a healthier and fairer world that has been selected for the general debate. Yes, we are in the second year of the COVID pandemic, and we still need to face surprises with the emergence of new variants, their spread and outbreaks in many different countries. Bearing that in mind, my delegation is pleased by the innovative international cooperation mechanism that has been set up to accelerate the fight against COVID and to facilitate the production of diagnostic products, treatments, as well as vaccines against COVID-19, and also to guarantee equitable access. Madam President, in that regard, I would like to explain that Niger has adhered to all WHO recommendations towards the pandemic and has set up an effective response mechanism with bilateral and multilateral support. This has allowed us to achieve satisfactory results when it comes to the management of the two waves that have affected our country. Just like other members of the international community, Niger has launched its vaccination campaign starting in March 2021 with the support of bilateral cooperation, and we need to mention China and India in that connection, as well as the COVAX facility. We wish to express all our gratitude and thanks to them. There are many lessons learned regarding the management of this pandemic, as well as other health challenges such as hepatitis. Niger has focused its efforts on strengthening our response to outbreaks, and we've intervened to improve monitoring as well as lab analysis of disease. We've also improved social mobilization as well as other sorts of interventions with respect to drinking water and general hygiene. We also address social behaviors. Our government has also accelerated the creation of Emergency Operations Center and a National Observatory for Health. To conclude, my President, His Excellency Wissam Ahmed, makes health a central pillar of his public policy and wishes to assure you of his determination to work shoulder to shoulder with other members of the international community to reach new milestones regarding health, especially as regards to sustainable development goals. We wish that governments and in the international community work more closely together so that we have more resilient systems so we can prevent and defeat health challenges. In that regard, we have a lot of hope. We're going to continue to participate in the working group on strengthening the preparedness and response of the WHO in the face of health emergencies. And we hope that an international legal instrument that will address the prevention of pandemics will emerge. Thank you very much.
Je vous remercie, Niger, and may we now try to connect once again with Canada.
Dr. Tedros, honorable ministers, distinguished guests, let me begin by saying thank you to the healthcare workers here in Canada and around the world that have made such a profound contribution to respond to COVID-19. We see you and we are grateful. The efforts of the WHO have also been critically important, and this pandemic has taught us that now more than ever, we need to be investing in public health to be better prepared. Today, I would like to highlight 3 key ways to move forward towards a transparent, inclusive, and accountable WHO that provides leadership, protects the vulnerable, and makes sure that no one is left behind. The first is emergency preparedness. The findings from the independent reviews of the response to this unprecedented global health crisis have been clear. We need change to be better prepared for the future. I do want to thank everyone involved in the reviews. Canada will be a constructive and thoughtful partner in acting on your important recommendations. To do this, we need a global health community where everyone is included and can participate, not just member states. Many actors are contributing to better public health outcomes around the world, including Taiwan, and they should be given opportunities to participate. The second is that progress can only be possible when approached through the lens of health equity. Strengthening comprehensive, resilient, and gender-based health systems that support health for all and protect the most vulnerable amongst us is vital. This also means addressing mental health in real and accessible ways. We need to ensure that everyone has access to supports that they need to recover from the effects of this pandemic. And that's why Canada is acting to improve health equity now, whether through contributions to the Pan American Health Organization to roll out COVID-19 vaccines for people in Latin America and the Caribbean, especially those in vulnerable situations, or by contributing to the WHO and the ACT-A Health Systems Connector, which will help address bottlenecks and enable speedier access to vaccines and therapeutics. Sharing global vaccine supply, a central role for the COVAX facility, must also be accelerated, and Canada will do its part. In total, Canada has committed more than $2.5 billion to support the global COVID-19 response, as Prime Minister Justin Trudeau recently highlighted. The third element I would like to highlight is that of being safe and secure, an integral aspect of global health. And to this end, I urge the WHO, together with the UN and humanitarian partners, to take decisive actions on any revelations of sexual exploitation, abuse, or harassment. Leadership must champion accountability to ensure that activities and behaviors fully respect human rights, gender equality, and the responsibility to do no harm. The WHO has a critical role that includes working with the member states to take action on the recommendations from the reviews, particularly on emergency preparedness, supporting health equity, and helping the world to get vaccinated. Let me conclude where I started, by thanking the health and care workers for everything that they have done. Care work, whether it's with the young, the elderly, or those in need at any age, has been consistently undervalued for too long. I hope that will begin to change in this International Year of Health and Care Workers. Let us not forget their contributions every single day. Merci beaucoup.
Thank you, Canada. And may we now invite Burkina Faso to be followed by Germany.
C'est un honneur pour moi de prendre.
It's an honor for me to take the floor on behalf of Burkina Faso before this august assembly, which is meeting despite the persistence of COVID-19. On behalf of the government of Burkina Faso, and in my personal capacity, I would like to commend the President of the 74th World Health Assembly for her election and to thank Dr. Tedros, Director General of the WHO. Burkina Faso commends the Director General and his team for holding the 74th World Health Assembly so successfully in the context of COVID-19. Madam President, distinguished delegates, Burkina Faso, like other countries, is facing the health crisis caused by COVID-19, and it is hampering our development. We already have a testing security situation, and now we are being faced with the issue of resilience. Burkina Faso would like to thank the WHO and other technical and financial partners for their multifaceted support since the disease has reached us in our country, and we appeal for continued support through a number of different resources while supporting low-income countries that have vulnerable health systems, particularly in terms of vaccination. This pandemic should not make us forget other public health issues which are causing a greater number of deaths than COVID-19, and recall the need to ensure the continuity of health systems in order to be able to effectively deal with other health problems. And this is why my country is committed to really draw the lessons from the resolutions that will result from this World Assembly for a better response to COVID-19, and beyond that, to strengthen our health system. We also align ourselves with the declaration of the African region, and we commend the team of the WHO for their exemplary work and for the results that they've obtained. And I would like to conclude my statement by commending health workers across the entire world and by calling for cooperation and international solidarity in order to end this pandemic as quickly as possible. Thank you.
Thank you. And may we now invite Germany to be followed by Ecuador.
Excellencies, ladies and gentlemen, colleagues, I have three key messages. First, WHO must be empowered to safeguard the world from future pandemics. The world cannot afford to not adequately equip WHO for its leading mandate in global health security. The world needs an authority that leads and coordinates pandemic preparedness and response. The WHO's constitution clarifies that WHO has this authority. However, the world's expectations vis-à-vis WHO as being the lead agency in global pandemic preparedness by far outweigh its given abilities. WHO is lacking the needed capacities politically, legally, but also financially to fulfill the world's expectations. WHO's role in pandemic preparedness is not sustainably financed. Through the membership fee, the 194 member states together invest roughly only 6 cents per world citizen in WHO per year. Is this adequate for the WHO's task to safeguard global public health? I guess not. WHO's emergency program is unfunded by 2/3. WHO's contingency fund for health emergencies remains chronically underfunded and has never reached its envisaged financing volume. This is not acceptable. Second, investments in WHO's pandemic preparedness function pay off. The investments needed to fully equip WHO as a real safeguard of global public health are minor compared to the enormous sums all states are currently investing in the response. There is a growing consensus that the future needs to look differently and that WHO's preparedness and response function needs to be sustainably financed through its member states, no matter what. My final and most important message: we do not have a deficit of great recommendations, but until now we do have a deficit of political will to implement the obvious lessons deriving from this world catastrophe. Numerous recommendations to make the world safer have been presented already after past global health crises. But unfortunately, they have never been implemented because the political focus had already moved and the political momentum for the needed change was missed. We cannot afford to let this happen again. We have to do our utmost to ensure a safer world for the future. We cannot go on with business as usual after this once-in-a-lifetime crisis. We all have to invest in change. Based on the experiences in the COVID-19 pandemic so far, many recommendations have been thoroughly compiled by different panels. These panels will present their work at this WHA, this World Health Assembly. Let us build on this and use this opportunity to ensure robust global health security structures for the future. As the Independent Panel for Pandemic Preparedness and Response put it, the next pandemic might not wait for us long. The time for change is now. The time for an ambitious pandemic treaty is now. Let's move on.
Thank you, Germany. And now to Ecuador, followed by the United States of America.
Señor Presidente de la Asamblea.
Madam President, Mr. DG, esteemed colleagues, ministers, fellow citizens. It's an honor for me to participate in the 74th World Health Assembly representing Ecuador. This is an important forum. We need to use it to lead the global response in one of the most challenging times for public health. Today, a year and a half since the beginning of the COVID pandemic, health services and systems have suffered under an enormous pressure in all countries. All populations have been gravely affected by the disease, and this proves that no state can combat this disease in isolation. With over 3.3 deaths worldwide, my country is no exception. Starting in March 2020 till May of this year, we've had over 17,000 deaths, 49% of which are women. We need to look at access for priority groups. We need to strengthen the diversity of supply chains, as well as the access to basic products that could, down the road, facilitate access to the vaccine. We also need to improve scientific R&D process, especially in developing countries, and we need an international health cooperation agenda that is effective and where the lives of each and every citizen throughout the world has the same importance regardless of the wealth of their country. Right now, we need to focus on successful planning and implementation of national immunization programs and control of the pandemic. International organizations need to facilitate timely access to vaccines. Ecuador has had a high level of COVID because of a weak response due to the multiple overlapping facets of the crisis that cover economic, social, as well as other factors. Now we have a new government in which health will be a priority, and we will guarantee fair and equitable access to the vaccine within a broad, integrated response strategy to COVID. We are also going to launch reform of our health system, working towards universal health coverage. We will facilitate access for those that are most vulnerable. We believe that a timely vaccination policy on the principles such as equity, respect, and reciprocity will be the way to move forward with economic recovery at all levels. In that connection, we are deeply thankful for WHO's work and the group of experts on strategic planning for the development of strategies that help all. We also want to appeal to the Secretariat and the international community, saying that we need to move forward with other initiatives, such as the COVAX mechanism, which go beyond the unilateral approaches in the current market. Last but not least, I would like to appeal to principles of solidarity for all states, and that we take action in this spirit and work with cooperation in mind to put an end to the pandemic. This needs to be a worldwide response because while COVID-19 affects mostly low and middle income countries, no country will be able to recover fully economically or socially if anyone is unsafe, for which reason...
Conclude your statement.
Al igual que promover la salud.
We need to promote health and special care for the most vulnerable. Thank you.
Thank you again. And may we now invite the United States of America to be followed by Finland.
Assembly President, Director General Tedros, fellow ministers, and distinguished leaders, on behalf of the United States, I want to extend our thanks to the leadership of the World Health Organization and the staff who have worked tirelessly for the health and well-being of all humanity. I want to thank the Pan American Health Organization for leading efforts to combat the pandemic and deliver much-needed supplies and vaccines to our neighbors in the Americas, as well as AFRO and its concurrent work to respond to multiple Ebola outbreaks on top of COVID-19. And of course, I want to express our gratitude and support for our frontline workers, whose sacrifices and services are appreciated more than I can express with words. The COVID-19 pandemic not only stole a year from our lives, it stole millions of our lives. Now we must honor our departed by taking urgent action this year to strengthen health security and pandemic preparedness so that we are better prepared for the next global health crisis. This means improving global triggers so all countries take swift action toward the next biological threat. This means establishing a global health security financing mechanism that is sustainable with strong accountability and oversight. And this means developing surge capacity for the global manufacturing of personal protective equipment, vaccines, therapeutics, diagnostics, and the healthcare workforce. We cannot forget that people are the backbone of any response and must ensure and increase investments in our healthcare workforce. And we must also do more to understand our current pandemic and look forward toward detecting, preparing, and responding to future biological threats. Phase 2 of the COVID origin study must be launched with terms of reference that are transparent, science-based, and give international experts the independence to fully assess the source of the virus and the early days of the outbreak. As member states of the WHO, we need to come together and finish this fight against COVID, our greatest test. We need to fully implement and adhere to obligations under the international health regulations. We need to improve transparency, immediately share critical information about outbreaks with pandemic potential, and strengthen health systems to withstand shocks. Global collaboration will be key in tackling the many challenges still before us. Collaboration with non-state actors must continue, and we must invite Taiwan to be a part of the World Health Assembly as an observer. The challenges before us are many, but not insurmountable. They begin by ensuring the resilience of global health systems through sustained investments and by addressing inequity and helping all people realize their right to health. Together, we must address racial, gender, and other forms of inequality, promote sexual and reproductive health and rights, and strive for equity across society. An inclusive global public health approach must include the voices of minorities, women, and lesbian, gay, bisexual, transgender, and intersex populations. We must continue promoting critical nutrition and vaccinations, fighting HIV, tuberculosis, and malaria, and addressing climate change. And we will do this together as a strong and agile WHO. Together, we will beat this pandemic. Together, we can help all people realize their right to health. Thank you.
Thank you. May we now invite Finland to be followed by Uruguay.
Honourable President, Director General, delegates. Finland aligns herself with the statement of the European Union and its member states. Health emergency preparedness begins in communities and with well-coordinated, responsible government action. It builds on strong and resilient health systems and essential public health functions with comprehensive primary health care and skilled health workforce as a basis. Finland has paid special attention to ensuring the protection of people in vulnerable situations. Cooperation and trust across the government and society has been built and maintained in normal times. Leadership and commitment at the national level must be coupled with strong multilateral cooperation and global solidarity. The unprecedented speed and level of support from public funding of the COVID-19 vaccine development is a success story. It is important to strengthen production capacity and equity in distribution globally. The ACT Accelerator provides important lessons for future preparedness. We need to enable World Health Organization to effectively lead and coordinate global health security preparedness and response. At the same time, we must maintain our focus on the achievement of comprehensive physical, mental, and social well-being. It is essential to empower people and communities to take care of their mental health and overall well-being. Finland believes that it is time to rethink the dynamics between well-being and the economy, where well-being impact will guide decision-making. Investments in health, skills, and education, gender equality, and social protection contribute to sustainable recovery. We believe that the Council on the Economics of Health for All will provide invaluable advice both to WHO and its member states. Our Prime Minister, Sanna Marin, is honored to act as its patron. Finland is committed to work together for a more equitable, healthier and safer future. Thank you very much.
Thank you. May we now invite Uruguay to be followed by Venezuela.
Estimados representantes.
Distinguished representatives, let me express the best wishes from Uruguay. We are here at the 74th World Health Assembly with a backdrop that invites us to move forward as an international community, believing in dialogue and exchange as a valid response. We are all aware of the severity of the COVID pandemic and how it's affected all our countries, putting extreme demands on our healthcare systems. I don't want to lose sight of the bigger picture, but right now I will focus on how the pandemic has affected the countries of my continent, the Americas, and in particular the countries of the region, which has had an increase in infections and deaths. The vaccination policy that we've rolled out in the face of this pandemic requires strong logistical and planning efforts so that we can reach herd immunity as soon as possible. Uruguay, just like many other countries, believes in multilateral mechanisms. However, they have all failed, at least in part, since they did not provide in time the desired amount of vaccines so that we could generate sufficient immunity. That is why it is absolutely essential to be clear on delivery dates and the amounts of doses that are going to be delivered. Sadly, we have not risen to that challenge as of yet. Therefore, it is extremely urgent to review the global health architecture to avoid these problems, which include uneven production, unequal distribution of vaccines, which only prolong the duration of the pandemic. We also need to look to the future and think of the future and have a structure that can respond quickly on a worldwide basis to these catastrophic events. We also need to think about how we're going to recover the sick of other diseases, NCDs, cardiovascular diseases, cancer, HIV/AIDS, mental health, as well as all the post-COVID scars, those that are known and those that are yet to be known. Therefore, as part of the international community, we need to continue to strengthen all cooperation mechanisms. We need to learn from the challenges we faced and strengthen the post-COVID recovery. Health systems need to be resilient, they need to be able to count on sustainable funding, and they need to guarantee equitable access for all states, equitable access to vaccines, medicines, treatments, and PPE. The international community needs to display greater solidarity, cooperation, including everyone, and these needs to be the pillars on which we build our future. Thank you.
Thank you. May we now invite Venezuela to be followed by Denmark.
Muchas gracias. Saludos.
Thank you. Greetings from the people of Venezuela and our constitutional president, Nicolás Maduro, that ratifies his commitment to the health of all, which is the same as saying he is committed to peace, happiness. We want to recognize the WHO and its Director General in its efforts to face the pandemic. In Venezuela, we're now facing the second wave of the pandemic. The first one took place between July and September 2020, which coincided with a massive return of Venezuelans from neighboring countries that were looking for medical care and social security. The second wave started in March of 2021, and it coincided with the identification of the more highly transmissible and lethal Brazilian variants. We are currently in a plateau stage with 1,000 cases a day, and it's starting its decline. We've taken measures to promote integral health care. We've gone knocking on doors. We've recommended the use of masks from the beginning of the pandemic, and we've also rolled out the Venezuelan method 7+7, 7 quarantine days and 7 flexible days, so that we manage to strike a balance between control measures and reopening the economy. To put an end to the pandemic, we need peace, and we need to work in harmony among our peoples, which is why we demand an end to the financial blockade and all coercive measures promoted unilaterally. We also wish to express our solidarity with the people of Palestine and the people of Colombia that are suffering from a violent repression. Unilateral measures implemented by the United States and its allies make it difficult for us to access essential products to produce a vaccine, and this violates the right to health of our people. We support mechanisms to speed up the equitable distribution of vaccine products and initiatives to release the patents that would reduce the cost of production and further guarantee universal access to vaccines. Last but not least, we want to applaud the support provided by PAHO, WHO, and other UN agencies, as well as other international bodies and countries such as Cuba, Russia, China, Iran, Turkey, among others, that have mitigated the effects of the blockade around the country. Thank you very much.
May we now invite Denmark to be followed by Algeria.
Dear delegates and dear Director General, the COVID-19 pandemic has highlighted the significance of multilateral cooperation. WHO is a vital leading partner in the global preparedness and response to health emergencies. And that is why Denmark strongly supports the ongoing work of ensuring an inclusive and ambitious process of strengthening the WHO, based on the learnings from the COVID-19 pandemic. For WHO to maintain a strong position, the organization must strive to uphold its legitimacy and relevance. This calls for a clear emphasis on the core mandate. The normative role of WHO serves as the cornerstone of this mandate and provides a solid foundation for the development of sustainable health systems in member states. A strong WHO must be able to rely on sustainable financing across all core functions and programs. More flexible funding will allow us to avoid the chronic underfunding of areas such as non-communicable diseases, data and science functions, and emergency preparedness. We have come a long way since the outbreak of the pandemic last year. Vaccines against COVID-19 has been developed at a so far unseen speed. But we are not there yet. We need to make sure that all countries win the battle against the pandemic by securing worldwide access to vaccines. We must also address some people's hesitation towards the vaccines and tackle the spread of misinformation through transparency and science-based communication. In my opinion, WHO plays a vital role in doing so. If this assembly decides so, Denmark will become a member of the executive board for the upcoming 3 years. In assuming this role, we will do our utmost to support the leading role of WHO in global health. All is possible through strong collaboration between countries. Let us use the current momentum to accelerate progress in global health cooperation, to make sure that the world stands better prepared and more united in our effort to achieve health and well-being for all. Thank you for your attention.
Thank you. May we now invite Algeria to be followed by Ghana.
Mr. Director General, ladies and gentlemen, distinguished members of the Assembly, the Assembly is taking place at a time we are confronted with one of the most serious crises in our modern times. This crisis has had not only health problems but economic issues that had made this crisis unprecedented. And with all these problems, I think the crisis brought about the readiness to deal with issues that we have not confronted before. Member states have taken major steps to deal with this crisis, and Algeria was no exception in this regard. We were able to coordinate at the Ministry of Health with other sectors to determine the needs of the epidemiological situation and how to show a political will to deal with that problem. We have been able to control the situation. However, the consequences of this pandemic remains to be another challenge that we have to deal with. And the health situation requires continued follow-up in coordination with other sectors past COVID-19. We firmly believe that building responsive health systems will enable us to deal with any future pandemics. Solidarity is an important element that we have to keep in mind in any step that we take in dealing with COVID-19. I think multilateral and bilateral arrangements are of paramount importance. Of course, this leads me to the issue of vaccines and the manufacturing of vaccines in sufficient quantities and access to these vaccines. I would like to conclude by stating emphatically that Algeria stands side by side with the international community to deal with this pandemic and any future crises. Thank you.
Thank you. May we now invite Ghana to be followed by Mauritania.
Thank you. Madam President, distinguished delegates, Ghana joins other delegations in congratulating you on assuming the presidency of the 74th World Health Assembly. We thank the Director General for an insightful report and commend the Secretariat for a forward-looking theme that links how we end this pandemic with a vision for a healthier, safer, and fairer world for the future. We align with the joint statement made by the UHC 2030 co-chairs, UHC Movement Political Advisory Panel, which states, among others, that to end this crisis and build a safer and healthier future, the world must act urgently in three linked areas: equitable access to COVID-19 tools, preparedness for future emergencies, and universal health coverage. Ghana welcomes the reports of the Independent Panel on Pandemic Response, the IAR Review Committee, and the Independent Oversight and Advisory Committee for the WHO Health Emergencies Program, all of which point to significant gaps to the current global and national health systems. We support the IPPR's recommendation to elevate preparedness and response to the highest level of political leadership. Madam President, it is encouraging to note that Ghana is seen as one of the countries that have managed COVID-19 effectively. Despite its devastations, COVID-19 has had some positive implications for Ghana's health sector, including behavior changes such as hand-washing practices, greater attention to health system with high political will for health system investments, leading to large-scale construction of healthcare infrastructure projects and commencement of processes for setting up a Ghana CDC, institution of local production of health sector inputs such as PPEs and ultimately vaccine production. Madam President, no country will be able to end the current pandemic. In that regard, Ghana reiterates its commitment to multilateral efforts to end the pandemic while forestalling those of the future. In the spirit of never wasting a crisis, we call for scale-up of research and development for medicines, including traditional medicines, therapeutics, diagnostics, and vaccines to address supply chain constraints. We support calls for a waiver of intellectual property restrictions for COVID-19 vaccines and countermeasures to promote access. We further support proposals for a new international treaty for pandemic preparedness and response to address weaknesses in the current global health governance system. We join calls for the full funding of the WHO emergencies program and for the ACT accelerator, including its vaccine pillar, the COVAX facility. Thank you.
Thank you, Your Excellency. Honourable Minister, may we now invite Mauritania to take the floor.
الله الرحمن الرحيم. السيد الرئيس، السادة وسيدات وزراء الصحة، السيد المدير العام للمنظمة.
Ladies and gentlemen, excellencies, we are pleased to be here at this session of the WHA. We have the honor of taking the floor, and we do hope that the problems caused by the pandemic will be dealt with as required, namely in weak and vulnerable countries. In Mauritania, we truly hope that we will be able to vanquish the pandemic via vaccinations. Here and now, I would like to express our gratitude to the international community for its efforts on research for a vaccine which is now able to limit the consequences of the pandemic. Yet we know that vaccines are not produced in sufficient numbers. We truly hope that there will be more solidarity amongst the international community and through COVAX. This is an initiative that we welcome and we have contributed to. Madam Chair, we have put in place all of the financial and human resources that were possible in our country under the auspices of the President of the Republic to fight against the COVID-19 pandemic. And the economic conditions in the world and in our country have made this very difficult, obviously. We, nevertheless, have also provided assistance to thousands of vulnerable families. We consider that it is important to continue this effort and to provide medicines, high-quality medicines, to these people and to meet the needs of victims, the most vulnerable people to the pandemic. I would like to salute the WHO and its management for their efforts and encourage them for their efforts to improve the public health situation throughout the world. Thank you.
Thank you. May we now invite Poland to be followed by Armenia.
Honorable Chair, distinguished Dr. Tedros, regional directors, colleagues. Poland fully aligns itself with the statement delivered by the EU on behalf of its member states. Poland appreciates WHO's efforts in fighting the pandemic and its leading role in the global COVID-19 response. We see, however, a need to reform and strengthen the organization so that it can fulfill its mandate even better. Global solidarity in the fight against COVID-19 is a key to ending the pandemic and keeping the healthcare systems resilient. Ensuring equitable access to vaccines is paramount in this process. Despite our own challenges, Poland decided to support our neighbors in this regard. Only by uniting our efforts, we can combat the virus and prevent future outbreaks. Thanks to digitalization of the Polish healthcare system, we have been able to deliver essential health services to the society and progress with our vaccination program. Being aware that digitalization brings also huge challenges, speeding up the introduction for e-health services was a step to ensure the continuity of basic health services for our citizens. Poland welcomes with full appreciation the proposed resolution on the health workforce. The pandemic took heavy toll on doctors, nurses, paramedics, and community health workers who save our lives, risking their own. Let me take this opportunity to thank the world's medical staff for their tireless efforts and huge dedication. Honorable Director General, colleagues, no one is safe until everyone is safe. Cooperation in the spirit of solidarity is essential to end this pandemic and prevent the next one. Strong One Health approach in making policies is crucial to prevent future outbreaks and tackling AMR. We must do our best to make sure that every person in the world gets medical services whenever they need it and that no one is left behind. Thank you.
Thank you. We now invite Spain to be followed by Jamaica.
Presidencia. President, Director General, governments, ladies and gentlemen, it is a real honor for me to speak to you today at this 74th World Health Assembly. I would like to begin with a few words just to express the support that Spain offers to the leadership of the WHO and commends it on its leadership in COVID. We highly value this organization, which must lead global efforts, and we must ensure that reforms are carried out to increase transparency and accountability. For Spain, the World Health Organization is a key partner. As Pedro Sanchez, the president of the government, has already said, Spain believes that a multilateral response is the only way to tackle this global crisis. For that reason, we think that a leadership role is important. We need a mechanism that provides key responses. And this needs to include, for example, Act A and the Vaccines Initiative and the COVAX facility. We welcome all of this development. We are convinced that leadership on certain issues such as intellectual property rights under international agreements and all of these efforts such as the Act A Accelerator are not only ideas, they're real actions that save human lives. We are putting all of this into practice. We have a Council for Scientific Research, which is focusing on distributing Spanish diagnostics and treatments through open licensing processes. It's important to share knowledge. It's also important to increase distribution and production of vaccines to guarantee that no one will be left behind. In Spain, we support the idea of an international treaty on pandemics to improve preparedness, risk analysis, and early warning systems, as well as providing a more effective response that allows countries to gain access to the necessary tools and materials that they need to combat pandemics. This treaty would improve and complement the current ongoing work. We would like to announce that Spain has formalized its application to the Permanent Committee of the WHO. Because we want to actively participate in the work of this organization and promote multilateralism as a priority solution to guarantee global health. Dr. Tedros, member states, delegations. If we believe in global health, we must make sure that we produce tangible results. And this assembly is an excellent opportunity to do this. We need to take important political decisions. All of the global population is in our hands, and we owe it to them to do this properly. Thank you.
Thank you. Apologies to Armenia, who will now take the floor, to be followed by Jamaica.
Chair, Excellencies, distinguished delegates, ladies and gentlemen. On behalf of Armenian delegation, I would like to warmly greet the organizers and participants of the 74th World Health Assembly. In these difficult times, when the COVID-19 disease has changed our agenda and lives, delivering a global economic shock of enormous magnitude in many countries with alarming speed, pushing many of us into the new realities, one thing is clear: our collective priorities have not only been changed, but even became bolder. Global priority of combating the COVID-19 remains high on the agenda of all countries, especially Armenia, as our country is one of the most heavily affected in the European region. However, the pandemic was not the only challenge for the Armenian healthcare system during 2020. On September 27, 2020, in flagrant violation of the UN Secretary General's appeal for an immediate global ceasefire, the Azerbaijani armed forces, with the direct involvement of Turkey and its supported foreign terrorist fighters, launched a large-scale, pre-planned military aggression against Nagorno-Karabakh, Artsakh. While the international community was struggling to magnitude the consequences of the COVID-19, the Armenian healthcare workers had to perform their duties and risk their lives on two fronts. The pace at which the global community formulated the COVID-19 response was unprecedented and historical. The progress made in vaccine technology and scaling up is truly remarkable. This gives us the hope that there is a chance to reverse the pandemic and stop the transmission very soon. Taking advantage of this opportunity, I would to express my sincere gratitude to World Health Organization for effective and mutually beneficial cooperation, and COVAX facility as an unprecedented global effort for its tremendous support shown countries in their attempt to revert the disease. It is our utmost importance from a moral, equity and health perspective, trust building in vaccines, addressing misinformation and promoting public health messages and a consistent flow of information as it is made available are all key to increase vaccine uptake and greater trust for communities. Given this fact, in collaboration with many local and international partners, Armenia is currently undertaking various initiatives to raise awareness about the accessibility, safety, and importance of the vaccines. Thankfully, we are already noticing a general increased trend in vaccine uptake. Finally, I would like to wish every success to the 74th World Health Assembly and thank everybody for the attention.
Thank you. May we now invite Jamaica to be followed by Gabon.
President of the Assembly, Director General of the World Health Organization, colleague ministers, delegates, Jamaica, like the rest of the world, has had to face the unprecedented challenges of managing the consequences of the COVID-19 pandemic. We continue to bear the negative implications of the crisis, which have come at a high cost to our human development and livelihood. As at mid-May 2021, just under 50,000 persons were diagnosed and over 830 persons have died from COVID-19 in Jamaica. As a small island developing state, This has long-lasting implications for sustainable development. In our experience, a country often plagued by natural disasters, building resilience to these external shocks is critical to our mere existence. This approach has been entrenched in Jamaica's National Development Plan Vision 2030, and it is therefore through the lens that we look at recovering from the pandemic. Excellencies and colleagues, we recognize that achieving herd immunity is vital to making this happen. The implementation of effective COVID-19 vaccination programs is one of the early steps towards recovery. Jamaica is grateful to its bilateral partners and for the multilateral initiatives, in particular the COVAX facility, through which we have been able to acquire doses of AstraZeneca vaccine. Despite rolling out our vaccine program in March 2021, Jamaica has not been able, however, to access sufficient quantities to vaccinate the population as widely as desired due to global supply chain shortages, amid others. The equitable access and distribution of vaccines is necessary to achieve herd immunity worldwide. We truly believe that none of us will be safe until everyone is safe. It is therefore paramount that there is strong international cooperation around improving access and supporting countries in building capacity for early detection and containment measures. We welcome commitments made by some governments and encourage others to join in efforts to ensure that vaccines can be quickly and safely produced and distributed widely. We should also learn from this experience to put in place relevant frameworks to prepare for the future. Jamaica considers that the lessons learned from the outbreak response can serve to strengthen the International Health Regulations 2005 health systems and service delivery for better preparedness, readiness, and resilience, both at the local and global levels, to mitigate against future pandemics. We must, however, remain seized of the task of maintaining and improving the delivery of other essential health services, including on priorities such as NCDs. This pandemic is an opportunity for global solidarity. Let us strive to work together to address our common challenges and achieve our shared goals, especially in the area of health of our population. Excellencies, colleagues, I thank you.
Thank you. May we now invite Gabon to be followed by South Africa.
Madam President, Gabon endorses the declaration, the statement made by Benin on behalf of the 47 member states of the African region, and congratulates you on your election to the presidency of the 74th World Health Assembly. We also would like to commend the Director General of the WHO and his team for the tireless efforts that they've made since the appearance of the COVID-19 pandemic. Once more, you have shown the entire world the leading role that the WHO plays in public health and global health. Just like other member states of the World Health Organization, Gabon has been affected by the COVID-19 pandemic. Nevertheless, the leadership shown by the President of the Republic, His Excellency Ali Bongo Ondimba, as well as the population's adherence to the response strategy and the technical and financial contribution of partners coordinated by the WHO, WHO in Gabon, my country has been able to limit the impacts of the pandemic on the most vulnerable populations, having stepped up its diagnostic capacity and healthcare provision by acquiring an enormous testing laboratory for COVID-19, which can carry out 10,000 tests per day, as well as establishing PCR testing teams in all regions and setting up an enormous hospital with a great deal of beds available. This has helped to make progress to tackle the main challenges, and the main challenge that remains is to vaccinate over 50% of the population of Gabon. Since the 23rd of March 2021, the COVID vaccination campaign in Gabon has been carrying out, and over 11,000 people have been vaccinated with a Sinopharm vaccination donated by the People's Republic of China. At the national level, we now need to ensure that more vaccinations are carried out, and we acquire more doses of COVID-19 vaccines. Ladies and gentlemen, although COVID-19 has had an enormous impact on our health system, the government has decided to accelerate its transformation by rehabilitating and improving technical facilities and health infrastructure and training health professionals. And at the moment, we need to make sure that we overcome geographic barriers when it comes to solving global problems. We now aim to secure equitable access to vaccines for the African continent. As a result, we are in favour of the adoption of a treaty on the prevention on pandemic prevention and response. A mechanism such as this would allow better, more fair access to treatments and diagnostic tools to be provided, as well as to vaccines. It would also help to promote global coordination in terms of preparedness and response. And this should be an inclusive project. Thank you very much.
Thank you. May we now invite South Africa to be followed by El Salvador.
Thank you very much, the floor, Chairperson. South Africa expresses its gratitude to the Director General for his well-articulated report and thanks the Secretariat for its support. This Assembly will consider critical agenda items and resolutions. Resilience against health emergencies need a foundation of a strong, resilient health system that is based on universal health coverage and effective primary health care. We honor millions of people across the world that lost their lives due to COVID-19. We also pay tribute to all health workers on the front line who have been a bastion in the fight against the pandemic. There is a need to realign all our programs and plan improvements to make meaningful progress towards achieving UHC targets while leaving no one behind, in line with our commitment for UHC and SDGs. There's been a matched sharing of benefits of the tools such as ACT Accelerator Initiative, as well as the COVAX facility. However, the challenge of vaccine nationalism remains prevalent, as one part of the world was able to vaccinate over 60% of their populations, whilst the other parts of the world, such as the African continent, could only vaccinate not more than 2% of the population. The response to COVID-19 pandemic requires solidarity and collaborative efforts at all levels in sharing data and knowledge. We also caution against using instruments such as vaccine certification or vaccination passport to stop the spread of COVID-19. We all agree that no one is safe until we are all safe. On the African continent, we continue to work with the chair of the African Union on the African Vaccine Acquisition Task Team initiatives. And at a global level, we do so in our capacity as the ACTA Facilitation Council's co-chairperson with Norway. We've collaborated with India to propose a limited waiver of the intellectual property rights on vaccines at the WTO. South Africa continues to call on other member states to support these proposals. WHO must continue being at the center of such multilateral system that contributes to the strengthening of epidemic response systems and implementing international health regulations. We support a treaty or agreement as a mechanism that goes beyond rhetoric to one that yields true equity in access and fairness in production and access to global public health goods. South Africa is pleased to co-sponsor the critical resolution on strengthening local production of medicines and other health technologies to improve manufacturing capacity and access to vaccines. Finally, I would like to congratulate and commend the Director General and his team for their excellent work and continue to maintain that a strong and well-funded WHO will be a critical success factor. I thank you, Chairperson.
Thank you. May we now invite El Salvador to be followed by India.
On behalf of Guatemala, we would like to convey our greetings to the 74th World Health Assembly, at which we must understand that a global response to this pandemic is required, and the key element of this is to ensure equitable access to vaccines and treatments. We know that this has been a difficult time. It's been very complicated in terms of global health over the past few months, but it's also shown us that it showed the entire population that the main priority is health and life. And to guarantee these priorities, we need to do our utmost to ensure that every country and every region can have access to overall well-being and health. It is very important for each different country to contribute not only towards ensuring good health for the people in their own countries, but also to assist the populations in the countries next door and in the neighboring countries. Furthermore, we'd like to note the importance of the recommendations that have been made that will help to promote health and well-being at the global level. We will do everything we can as countries in the Central American region to ensure that we can move forward and get out of this pandemic. We've always been working together with a clear goal of guaranteeing the health of our populations, and this is the same for the rest of the world as well. We all have obligations to meet, and we need to continue moving forwards. Our vaccination program is continuing and our efforts are continuing, but most of all, throughout the country, what we've seen most of all is that people have been able to bring together their efforts and remain united to tackle this challenge. And this is one of the great successes of El Salvador. This assembly should be a starting point to allow all different countries to make progress. All different countries which have varying abilities and capacities should pool their resources so that at a global level we can ensure that people work together for the benefit of the global population. Thank you.
Thank you. May we now invite India to be followed by Belarus.
Thank you, Chair. As the world makes its way through various large-scale disruptions imposed by the ongoing COVID-19 crisis, we need to acknowledge the growing need for centrality of WHO in global health dialogue and to encourage collaborative partnerships, streamline discussions regarding global health issues of paramount importance. Chair, India is still in the midst of second wave, but through a proactive, graded, and decentralized approach, we have managed to stabilize the second wave as there has been a constant decline in the number of active cases. Keeping in mind the large population size and the constraints in healthcare infrastructure, India focused on rapid upscale of our health infrastructure and logistics, dedicated upskilling of health skill workforce, and building indigenous manufacturing capacities while leveraging community engagement as an overarching theme throughout our response. Chair, the pandemic has given us sufficient scope for comprehensive evaluation and reforms to be made in order to enhance global health emergency preparedness, and there is an impending need for the WHO to analyze, introspect, and introduce key reforms to manage crises of such magnitude. India looks forward to a comprehensive and fruitful discussion on the IPPR report published recently. In light of COVID-19 crisis, there is a need for the IHR to have a robust mechanism to strengthen the PHEIC declaration process, especially at the regional level. Strengthening pandemic preparedness across all three tiers, regional, national, and international, can help with timely risk assessment and declaration of public health emergency. In times like these, there is a need for robust and resilient health information systems and incorporation of digital health reforms in global health policies. India advocates the need for a system facilitating pan-world surveillance, duly leveraging innovative IC tools. This is imperative for effective mitigating the risk of any health emergency and not waiting for infectious disease outbreaks to transform into pandemic in the future also. Chair, the global scientific community has moved at an unprecedented pace toward the discovery of COVID-19 vaccines. However, our journey does not end here. India concurs with the position of IPPR that vaccines must be distributed more equitably to achieve success against COVID-19, and there needs to be a framework for their allocation. There needs to be a higher burden of responsibility on the part of developed nations with respect to aiding developing and resource-constrained countries. Our world has been disrupted by other pathogens in the past, and we have fought our way through them. However, it is imperative that we understand that in light of growing complexity of global health challenges, we make higher investment in healthcare and innovative solutions and sustain this development so that we remain taller and stronger than ever for the health threats in future. Thank you, Chair.
Thank you. May we now invite Belarus to be followed by Slovenia.
Chair, we are grateful to the DG for his comprehensive and wide-ranging report. In today's turbulent world, public health is especially relevant. Indeed, unresolved and emerging health challenges simply exacerbate negative political trends and complicate sustainable development. We salute the DG's systematic and long-standing efforts to adapt the WHO to contemporary realities. Chief among the top priorities of the organization is reinforcing the WHO preparation and ability to respond to health emergencies. Belarus actively participated in the EU's month-long process to draft a resolution on this topic. We also support the launch of an intergovernmental process on the Framework Convention on Pandemic Preparedness and Response. Belarus is ready to take part in upcoming discussions at work on the implementation of the WHO resolution provision on emergency response. This includes in our capacity as a member of the EB, should our candidature for this position be confirmed, as was the case last year at the regional level. As a member of the EB, we will be ready to contribute to many public health issues, first and foremost to issues where we have accumulated a great deal of experience. A few words on our work on the COVID-19 pandemic. We are convinced that the domestic context is the decisive factor in developing a response to a pandemic. Belarus adopted its own line of action, and as a result, we were able to maintain a functioning state, a strong economy, while providing maximal protection to the population. I highlight this point. Even today, we continue to pursue this focus. The country hosts a strong vaccination campaign. Indeed, we are developing our own vaccine or considering the possibility of exporting this vaccine to other countries via the WHO mechanisms. Sir, in conclusion, let me express hope that this session of the WHO will be a watershed moment in the effort of the organization to strengthen its role in preparedness and response to emergencies, especially health emergencies. Thank you.
Thank you. May we now invite Slovenia to be followed by Sri Lanka.
Distinguished President, Director General, dear delegates, Slovenia aligns itself with the statement of the EU and its member states. As a firm supporter of multilateralism, Slovenia recognizes the vital role of WHO in the response to COVID-19 pandemic and other global health challenges. We recognize the need for strengthening WHO's mandate and capacities. As EU member, we fully support the proposed resolution on strengthening WHO preparedness and response to health emergencies, and we fully align ourselves with the recommendations made by the IHR Review Committee, the IOAC, and the IPPR. The ensure a healthier, safer, fairer world, we need to ensure equitable access to health services, even more so in these difficult times, COVID-19. Most immediately, that means equal access to vaccines, both through scaling up the production, as well as through investing in global mechanisms such as COVAX and ACT Accelerator. In the future, we must avoid a shortage of medicines like the one we see now with the COVID-19 vaccines. Enhancing local production of medicines will be key for preventing this kind of solutions, and we believe that the solution on strengthening local production of medicines and other health technologies is an important step forward. Our experience has demonstrated that prioritizations of primary healthcare services and equal access to universal health coverage for all can address the growing burden of chronic diseases and mental health problems. Furthermore, investing into prevention and health promotion programs that reach vulnerable groups of population should serve as an integral part of health policy. Tackling risk factors and commercial determinants of health by feeding the advice of WHO and implementing best-buy policies. Healthcare costs and, more importantly, lives can be saved. Our health system has been under the enormous pressure of the current COVID-19 pandemic, but at the same time, this gives us a unique opportunity to make a significant change in building more resilient health systems. We need to use the existing resources more effectively, as well as develop and implement innovative solutions in healthcare financing, organization, and delivery of services. In these spheres, we see many opportunities for collaboration with other countries with an active role of the WHO.
May we now invite Sri Lanka to be followed by Ukraine.
Mr. President, Director General, distinguished delegates, ladies and gentlemen. At the outset, let me congratulate you, Mr. President, for being elected to this esteemed position, and thank the Director General, Dr. Tedros, for his inspiring leadership and constructive speech. Sri Lanka would like to thank the Director General for his untiring efforts to bring about equity and fairness in this unprecedented crisis, particularly with regard to making vaccines available for everyone. Sri Lanka has successfully controlled the first wave and second wave of COVID-19 in the country. My government has employed a strategy of strict adherence to key public health principles such as case detection, contact tracing, isolation, and quarantine, building on our well-performing state health system. Until the end of August 2020, we were able to confine the epidemic to about 3,000 cases, and no community cases were reported in the country. However, over the past 6 weeks, following the trend of most of the South Asian countries, we are experiencing third wave of cases. The detection of new variants in the community appears to be a major contributory factor. The government is mindfully addressing the new wave, striving to find the balance between saving the lives and livelihoods. An even strict combination of public health measures and simultaneous vaccine campaign are being undertaken. Similar to many developing countries, we are facing immediate issues related to vaccine supply. We highly appreciate your tireless efforts for fair and equitable access to vaccines through COVAX. We hope countries like ours will start to see the results of your effort sooner rather than later. As the Director General WHO always emphasizes, vaccines alone cannot end the pandemic. However, they are a vital tool, especially in preventing severe diseases. That is why vaccines must be available as a public good and must be shared for global health and prosperity. For Sri Lanka, saving the lives, avoiding serious illness is our highest priority, and we are working hard to rapidly bring down the exponential rise in cases. We need to prevent the overburdening of the health system at any cost. In this regard, we highly value the strong and continuous support from the WHO Country Office, Southeast Asia Regional Office and Headquarters, and other developing partners. I believe, as the health leaders, we can be a collective force to build a fairer and healthier world. In conclusion, Mr. President, I would like to call for an urgent action to strengthen our preparedness to ensure that a future outbreak does not become a pandemic. Specifically, Sri Lanka would like to support the recommendation of the Independent Panel for Pandemic Preparedness and Response to adopt a pandemic framework convention within the next 6 months
very much,
with the highest level of political leadership.
May we now invite Ukraine to be followed by Uganda.
On behalf of the Minister of Health of Ukraine, I will be delivering the speech as advisor to the Minister on International Affairs. Honorable President of the Assembly, Distinguished Director General, Excellencies, colleagues, I appreciate this opportunity to make a statement on behalf of Ukraine at the 74th session of the World Health Assembly. The COVID-19 pandemic has clearly demonstrated to all of us the importance of the WHO work and the imperative for the international cooperation in facing global health challenges. The discussions we will hold during this session will be essential for achieving our collective goals of improving universal access to healthcare, enhancing international response to health emergencies, and establishing improved cooperation between states and the World Health Organization. It's universally accepted that the mass vaccination is the main weapon in the arsenal to stop the spread of COVID-19. This can only be used when the vaccine is universally available. Thus, Ukraine fully supports WHO in its efforts to ensure that vaccines are appropriately tested and approved, and advocates for an equitable distribution of vaccines in a spirit of a global solidarity. We recognize the efforts of WHO, Gavi, and CEPI aimed to coordinate the COVAX mechanisms through which middle and lower-income countries, including Ukraine, are getting COVID-19 vaccines. We must seize this moment to come together in national unity and global solidarity using science and efficient solutions to overcome COVID-19 pandemic. Ukraine's idea that strong commitments at the highest political level are crucial to foster a quick and effective response to pandemic. Likewise, the task to establish clear principles, priorities, and targets for pandemic preparedness and response through a legally binding international framework, most notably highlighted by the COVID-19 pandemic, is a matter of urgency. The COVID-19 pandemic has tested the resilience of Ukraine's healthcare system and has also hampered the delivery of non-COVID related healthcare. Ukraine is committed to full implementation of the biannual collaborative agreement with the European Regional Office of WHO. This document enables us to make further progress in overall goal to provide effective universal health care for all citizens and also to improve our preparedness for current and future global health challenges. We are concerned about the access to quality health care for our citizens living in the Autonomous Republic of Crimea and the city of Sevastopol, as well as certain areas of Donetsk and Lugansk region, temporarily occupied by the Russian Federation. The situation is all the more alarming, especially against the backdrop of COVID-19 pandemic. The collapse of medical system in certain areas of Donbass in context of COVID-19 as essence of the reliable epidemiological control, therein increase the danger of flare-up of the pandemic of the significant extent. The obligation of the Russian Federation and its occupying state under the international humanitarian law is to take all necessary measures to protect life and health of the population of the areas. In particular, under Article 56 of Geneva Convention relative to the protection of civil persons in time of war of 12 August 1949, the occupying state is obliged to ensure the maintain in the occupied territories satisfactory health care and hygiene condition, and must take the prophylactic and preventive measures necessary to combat the spread of contagious disease and epidemics. We demand from Russian Federation to give on a constant basis executive information on the spread of coronavirus disease on the temporarily occupied territories of Ukraine, and on measures is undertaken to assist the population of the territories to cope with the pandemic. The Ukrainian government has been placing in particular emphasis of the provision of
much, Ukraine. May we now invite Uganda to be followed by Italy.
Thank you.
Thank you, Chair. I'm presenting this statement on behalf of the Minister of Health of Uganda. The Nagoya Protocol is a critical instrument for access, collaborative work, and benefit sharing for clinical data, specimen, and genetic resources for pathogens of epidemic potential, and this implementation, together with other related initiatives, especially international health regulations, is of vital importance to global health. Uganda ratified the National Environment, Access, Genetic Resources, and Benefit Sharing regulations in 2005 and became a party to the Nagoya Protocol in October 2014. Since then, Uganda has ensured consistent, streamlined access, genetic resources, and sharing of benefits derived from genetic resources for scientific research, commercial purposes, bioprospecting. Sorry, can you hear me? Can you hear me? Bioprospecting, conservation, and industrial application. In addition, sustainable management and utilization of genetic resources have been promoted. Effective biosurveillance and sharing of information. I beg your pardon. Can you hear me? I seem to have an interruption.
We can hear you. Please proceed.
Thank you, Chair. Effective biosurveillance and sharing of information, including genetic sequencing material, is vital for the development of therapeutics, diagnostics, vaccines, and treatment of infectious diseases. The WHO African region upholds WHO on implementing the recommendations of decision of the World Health Assembly 7213 and the support it avails to member states before, during, and after epidemics. The unique situation COVID-19 has posed calls for greater global collaboration and solidarity in planning and resource mobilization, response, and innovation in use of WHO Afro member states must continue implementation of the Nagoya Protocol and international health regulations, as anything that slows or disrupts global collaborative efforts prepare for and respond to epidemics is detrimental to our economies. The WHO African region thus welcomes the report of the Director General on Nagoya Protocol implementation and urges member states to support and ongoing activities.
Thank you. May we now invite Italy to be followed by Guatemala.
Dear all, thank you very much for this opportunity. It's the second time that we have the General Assembly in a different way, without meeting each other. I hope that this is the last year and that we'll soon come back to our normal procedures. It has been a difficult time with very hard days, and we had many lessons from these hard days. First of all, the first lesson is that we have to spend more on health systems. We have to invest more on health. Health is really the heart of our society, and we have to do all we can to invest more on public health as a fundamental right of our society. The second lesson is that we have to invest more on international relationships. We have to invest on multilateral spaces like WHO, and we have to build a stronger connection between our agendas and between our way to work together. I think that the lesson of these days is very hard, saying us that no one is safe if everyone is not safe. And this has to be the aim of our work, even in these days in which we are investing on the vaccination campaign. The strongest countries have to work because every country should have the opportunity to vaccinate their population. And this has to be, I think, the most important aim of our discussion and of our meeting. Global solidarity is the best weapon we have to win this war against COVID-19. And I hope that together we will win this challenge. Thank you very much.
Thank you. May we now invite Guatemala to be followed by Guyana.
Distinguished members of the Assembly, It is an honor for Guatemala to participate in the 74th World Health Assembly. We, as a country, have been involved in the global crisis caused by COVID-19, and we are searching for ways to move forward. 1 year after the first case was identified in Guatemala, we've continued to work side by side with governmental and non-governmental organizations, including with international organizations, and we've been focusing on the well-being of our population. Health workers have played a key role in these efforts. Nevertheless, we regret the fact that many of their lives have been lost. We have managed to administer around 50,000 vaccination doses in Guatemala. Since 2020, Guatemala has been involved in the COVAX facility, through which 6.6 million doses of vaccines have been negotiated. Through the mechanism, we have also managed to acquire 16 million doses through bilateral and multilateral cooperation. This should cover around 70% of our population. On the 25th of February 2021, we started phase 1 of the National Vaccination Plan, which is aimed at maintaining the integrity of the public and private health systems. We have immunized frontline health workers, and for all frontline workers, to make sure that those people can continue to carry out their work. To meet those objectives, over 500 vaccination clinics have been set up. Recently, we also entered phase 2 of the National Vaccination Plan, which is aimed at reducing mortality and severe morbidity. We've been vaccinating the over 70s, as well as teachers, and then gradually including other population groups. The role of primary healthcare in this pandemic has been crucial as we try to raise awareness among society. On behalf of the President of the Republic, I would like to welcome the important support that we've been provided with by the WHO and the Pan American Health Organization, as well as other strategic partners, as part of the response to this health emergency. Allow me to take this opportunity to express our appreciation to the government of the Republic of China, Taiwan, which has been a valuable partner in our efforts. If we work together, we will be able to build a healthier, safer and fairer world. Thank you.
Thank you. May we now invite Guyana to be followed by Japan.
President of the World Health Assembly, the Director General of WHO, Dr. Tedros, distinguished delegates, we gather for the 74th World Health Assembly at a difficult time, when the devastating pandemic has crushed many lives and livelihoods across the world. While the virus brought sufferings and too many deaths and disruption to the global economy, our scientists, researchers, medical, health, and other personnel have marshaled the science to understand this new disease and to rapidly develop new diagnostic technologies, medicines, and vaccines. We cannot imagine the horrors of this pandemic had science and public health not stood tall. So today, Guyana also joins in acknowledging the efforts of the scientific community, medical and public health communities, and in extending our sincerest gratitude to everyone. Our collective actions under the WHO's leadership have seen the creation of access to COVID-19 tools accelerators to accelerate the development, production, and distribution of diagnostics, therapeutics, and vaccines. It also created COVAX, which has worked hard to secure and distribute vaccines to countries worldwide. These efforts, while far from perfect, has made a tremendous difference to many countries. We, however, remain deeply concerned that despite the best efforts, there persist inequalities in availability, access, and distribution of vaccines. And we would like to urge that concrete steps be taken to rectify the vaccine inequities as quickly as possible. We applaud the stance taken by the United States on TRIPS waiver. Guyana supports the call by India and South Africa for waivers to allow the global production capacity to bring relief to vaccine supply chains. In that regard, Guyana believes that the discussion around the Nagoya Protocol is a significant discussion at this 74th World Health Assembly. As one of the beneficiary countries of COVAX's generosity, Guyana would like to express its gratitude to COVAX and all the donors who have made this possible. This 74th World Health Assembly has allowed us to deliberate on a list of global health priorities. There is no doubt that COVID-19 has changed our world. Although it has left a trail of death and destruction, we have an opportunity to inject hope, to build stronger global solidarity, to transform our world into a healthier and better one. I look forward to the deliberations of the World Health Assembly.
Thank you. May we now invite Japan.
Honorable President, my name is Norihisa Tamura, Minister of Health, Labor and Welfare of Japan. I am honored to speak on behalf of the government of Japan. I would like to express my sincere gratitude for the dedication by Director General Dr. Tedros Adhanom Ghebreyesus and the WHO Secretariat to combat COVID-19 pandemic. First, regarding COVID-19, Japan has placed the utmost priority on protecting people's health and lives. With a strong sense of urgency, Japan has been working hard to deal with variants of the virus and strengthening border measures. Furthermore, Japan fully supports ensuring equitable access to COVID-19 vaccines. Japan will co-host the COVAX AMC Summit with Gavi on June 2nd to contribute to ensuring equitable access to safe, effective, and quality-assured vaccines. Second, it has become clear that ensuring essential health services is vital more than ever during this pandemic. We have high expectations that the WHO continues to support member states to advance universal health coverage in line with diversity of regions and countries. Honorable President, Japan also believes that a comprehensive review of this pandemic will also lead to strengthening global preparedness and response to infectious diseases. We expect that the WHO plays a leading and a coordinating role to be better prepared for future crises based on the recommendations of the Independent Panel for Pandemic Preparedness and Response and the IHR Review Committee. In addition, I would like to emphasize that we should refer to good examples of regions which successfully tackled COVID-19 in terms of public health response, such as Taiwan, and should not make any geographical vacuums which are created by leaving specific regions behind in addressing global health issues such as infectious control. This will serve the purpose of preventing the spread of infection worldwide. Furthermore, regarding the WHO-convened COVID-19 origin study, we call for strengthening efforts to improve access to original data and samples, as well as ensuring transparency. Lastly, malnutrition and growth stunting are on the rise due to COVID-19. Japan will support countries in implementing nutrition programs through the Tokyo Nutrition Summit in 2021. To conclude, the government of Japan will continue to actively support WHO activities to ensure health for all. Thank you for your kind attention.
Thank you. I now have the pleasure in giving the floor to Mr. Vice President.
Je vous remercie. Il est temps de lever la séance ce matin.
Well, it's time to close our session this morning. The Committee on Credentials will meet later today, and we will look at item 23, and the committee will have its third session at the same time as the plenary. So this meeting is now closed.
Dear distinguished delegates, just to precise, the meeting will resume at 2 p.m. Geneva time. Thank you.
Organization is steadfast in our mission to promote health. The World Health Organization is steadfast in our mission to promote health, keep the world safe, and serve the vulnerable. And committed to our 3 ambitious goals, the triple billion targets, laid out in our 13th General Program of Work. Reaching these targets is vital to meet the Sustainable Development Goals by 2030. They are what guides our work across the 3 levels of the organization. First, we work so 1 more billion people around the world can benefit from universal health coverage. We deliver life-saving tools and supplies to countries and support training so there is a qualified workforce to help the world's most vulnerable people. We work so people can have access to the health services they need without financial hardship. Second, we work so 1 more billion people are better protected from health emergencies. We invest in and guide countries so they are equipped to prepare, prevent, detect, and respond to natural disasters and disease outbreaks like cholera, Ebola, or COVID-19. When necessary, we step in to coordinate the emergency response. And we are improving measurement practices so threats are identified early and appropriate responses are deployed. Thirdly, we work so 1 billion more people can enjoy better health and well-being. We help countries establish healthy environments and lifestyles in safe, supportive societies to prevent disease and save lives. We work to improve the water we drink, the air we breathe, the food we eat. One way we do this is by helping reduce risks that jeopardize health and well-being. For instance, through better road safety, decreasing tobacco and alcohol use, and more. And we harness the best science and data available. We know how crucial the power of science, data, and innovation are to improve global health and track impact in countries. We produce cutting-edge research for health. We conduct quality assurance for norms and standards. And we leverage digital technologies to improve health outcomes across the 3 billions. The world can only achieve these targets with strong leadership for health across the globe. That is why the world needs a strong, well-funded World Health Organization.
So the United Nations says that there's a high prevalence of mental distress worldwide because of the coronavirus pandemic, especially amongst healthcare workers, as you would expect, and children as well.
The United Nations is asking governments that as the pandemic crisis drags on, not to forget about the mental health toll that this is having on many.
With all the changes happening as we overcome this pandemic, it's easy to feel overwhelmed, anxious, and stressed. So joining us now is board-certified psychiatrist Dr.
When you are in a dangerous situation, stress and fear is actually guiding us and helping us to get out of the situation. So it's helpful. However, and there is a big however here, because you can have something called toxic stress. This is when the stress is not longer tolerable and you cannot relax after it. So it becomes more chronic and more permanent. It's all about the starting point. If you are a child living in a refugee camp because you have been living for years in a war that you managed to escape from, you're not ready to deal with COVID. You don't have the capacity, you don't have the energy because of your prior traumas. So this is a huge challenge, making these children very vulnerable in this situation.
أول ما سمعنا إنه في كورونا خفنا كثير، لأنه خايفين إنه يجي حدا من برا يعدينا، يعني خفنا كثير خايفين عليهم إذا حدا انصاب من عائلتي يعني. نهاية ويا العيش.
Children are sitting in the camp believing they are going to die. We have to talk with children directly. We have to address COVID-19 directly with them and ask them how they are doing.
يعني نروح أنا وأصحابي المدرسة قبل فيروس كورونا ونلعب وذا، ما نحناش خايفين من فيروس كورونا ذا، وما جا فيروس كورونا يعني احنا خفنا منه. غلق منه سريع الانتشار، يعني يخبون احنا داخل البيت ما يشتون حاجة نخرج بسبب فيروس كورونا، ما يشتوش يخسرون احنا.
I would say that my biggest concern in this situation is that it will be very hard to get all children back to school. And if we cannot get these refugees back to school, they will suffer for the rest of their lives.
Has been the most testing in our organization's history. However, it has also demonstrated why more than ever the world needs a strong WHO. To capture our achievements and challenges, this year we have taken on a brand new approach to reporting on our results for easier access everywhere by anybody. The report is presented fully online on the WHO website. The first report on the GPW13 results framework, we have taken a bold new approach to show in one place our progress towards our triple billion targets and health outcomes, as well as an assessment of the Secretariat's delivery of results. COVID-19 pandemic was undoubtedly the biggest challenge in 2020, and the featured stories show the centrality of WHO's role in the response and the transformation agenda that strengthened it. The report presents the impact measurement agreed with member states. Also, for the first time, the WHO Secretariat is reporting on its performance delivering its outputs, which contribute to the achievement of outcomes and the triple billion targets. This innovative approach further improves transparency in reporting on the assessment of WHO's work across all major offices, unique among UN agencies. The online report also helps to easily probe into how WHO is driving impact in every country through the selection of country case studies. For greater transparency, a key feature of this report is also an interactive page where you can see the budget implementation figures and the financing of the work of the organization. This report also links to relevant pages in the WHO website, where you can get more detailed information such as the Triple Billion Dashboard, the World Health Statistics, and the Program Budget web portal. In sharing our results transparently with the world, we hold ourselves more accountable. A more transparent and accountable WHO is a stronger WHO. The world needs WHO, now more than ever.
What does health mean to you? For many people, it is the foundation to do the things in life they love, to enjoy the company of others, to work, to play, to learn, to laugh. Health is life. So many people have lost their health in the past year, but they have lost so much more: their jobs, their ability to see their families, to travel, to live life. And more than 2.7 million of our sisters and brothers have lost their lives, and we have lost them. The hard truth is that some of those people died simply because they could not get the care they needed, because of where they live or how much they earn. Inequality is not a new problem, but COVID-19 has brought it into sharp focus. The pandemic has pushed an estimated 120 million people into extreme poverty. It has significantly increased gender inequalities, with more women than men leaving the labor force. And as we speak, rich countries are vaccinating their populations while the world's poor watch and wait. Health inequalities are not just unfair, they make the world less safe and less sustainable. So, as they build back from COVID-19, it's vital for all governments to invest in better health services and remove the barriers that prevent so many people from using them, so more people have the chance to live healthy lives.
Achieving health for all requires a strong focus on the populations that we serve, understanding their needs and the barriers to improving their health. In 2018, WHO, through the Joint Working Team for Universal Health Coverage and Primary Health Care, established the Live Monitoring Mechanism, which is a regular opportunity for WHO at country, regional, and global offices, along with partners and donors of the UHC partnership, to convene on supporting country priorities. Live monitoring is about giving a voice to those who are driving impact in countries. It enables everyone involved to contextualize country reports, stories, and data, to have a clear understanding of what's happening on the ground, how WHO country offices work with governments to identify and act on country priorities, and how all these connect with regional and global WHO resources. This mechanism reinforces WHO's corporate planning, monitoring, and reporting systems. reflecting results like never before, with one plan, one monitoring, one reporting. By gathering country intelligence and promoting knowledge sharing across the organization, live monitoring helps us focus resources where they're most needed, maximizing donor contributions and investments, and strengthening accountability and transparency at all levels. Live monitoring allows us to bridge countries, technical experts, and donors, resulting in stronger planning, implementation, and impact that are aligned with emerging country needs. This is how timely, relevant data allows us to work better together to build a fairer, healthier world.
Three factors can help you make safe choices when you're in an area of widespread COVID-19 transmission. Consider the location, the proximity to others, and the amount of time you spend there. Where does your activity take place? Open air spaces are always safer than enclosed spaces, particularly if they're small or without fresh air. Proximity to other people is also important. It's safest when there are fewer people around and you can keep more than 1 meter apart. How long does your activity last? The shorter, the better. Think about each of these factors and avoid situations where the risk dial is high. Small or poorly ventilated places and crowds of people for long periods of time. Stay safe. Lower the risk to yourself and others.
WHO supports countries respond to COVID-19. Sending supplies and protective personal equipment to over 150 countries. Helping establish treatment centres and strengthening laboratory, treatment and biomedical capacity. Providing diagnostics and biomedical equipment. Issuing over 100 technical guidance documents to provide real-time information and best practices. WHO coordinates COVID-19 response, working with world leaders to keep everyone safe. Deploying emergency medical teams to help design fit-for-purpose strategies. Building the Partners Platform and identifying gaps to ensure an appropriate COVID-19 response. Working with multiple agencies, NGOs, member states and the private sector. WHO accelerates COVID-19 research and development. Convening the ACT Accelerator for coordinated research for treatment and vaccines. Engaging in solidarity trials for therapeutics and vaccine research with over 5,000 people in over 100 countries. Establishing the CTAP Access Pool, sharing research knowledge and working for accessible intellectual property for existing and new COVID-19 tools. WHO fights COVID misinformation. Raising awareness and stopping the spread of COVID-19 misleading or false information and messages that promote harmful practices. Holding technical webinars for experts. Offering multilingual COVID-19 online courses through Open WHO and the WHO Academy app. Help by donating to the COVID-19 Response Fund.
Something amazing happens when astronauts see Earth from space for the first time. It changes their perspective on everything. It's called the overview effect. It makes them realize that although we all come from different countries and speak different languages, we're all just passengers on the small blue ball. It's a reminder that none of us are alone and we're all part of a global family. We want the same for our communities and ourselves, a safe and prosperous world. COVID-19 has had a devastating impact. The pandemic has been a cruel reminder that in an interconnected world, what affects one of us can affect all of us. Fighting COVID-19 requires a team effort on an unprecedented scale. Right now, nations, health organizations, and communities are all coming together to defeat this virus. The Access to COVID-19 Tools Accelerator is the world's biggest coalition of partners fighting COVID-19, dedicated to saving lives and suppressing the effects of the pandemic. Uniting to accelerate the development and production of COVID-19 tests and treatments. And when vaccines become available, the ACT Accelerator will ensure all countries have access at the same time. Together, we can save lives and start the recovery our world needs. The overview effect reminds us of what we can achieve when we work together, when we use science for the good of all. So let's act and beat COVID-19 together.
This year, Bahemi make 18 years blooming as a registered nurseman. Me garem that fala interested from me garem out of some fala lo family blooming seleva o ketatu ota NCD patients. Blossom pen to me by me say him very effectful him bara waka good lo tami using lo here lo Central Province for assessing and managing oketa patient side lo NCD.
Virginia have nice woman. It's encouraging of the patient for making frightened. Telling me for planting water, garden, the side house. Then we all share together. What we garden, we give you him. What garden, him give you.
We think in future, suppose me garden samfala. Place or some mila ko SM any building where garamata cooking utensils or some inside lo hem make same time you sa doing demonstration lo how ko prepare to diet block at a patient lo hem.
El equipo debe salir en una lancha a recorrer 40 días para visitar las comunidades que se encuentran sobre ese río. Estamos hablando de 72.000 kilómetros cuadrados, zona selvática, con 80 al 90% de la población es indígena, que vive en comunidades que están localizadas en las laderas de los ríos.
El acceso a Imiria es complicado porque aquí solo se ingresa o por río o por aire, no hay carreteras.
Empezó pues por el barrio, casi en la misma semana, casi todo el mundo pues del barrio resultó contagiado. Se propagó pues de manera considerable y afectando la situación económica. Hubo pérdidas de familiares también, sufrimos la enfermedad.
¿Cuántas personas viven acá, mamá?
Muchas veces las poblaciones, si no se les da una explicación cuál es el beneficio, no lo conocen, no lo interpretan, es más difícil que lo acepten. Por lo tanto, el plan de vacunación a nivel territorial debe de tener ese componente de comunicación. población y así poder contribuir a que las poblaciones las acepten.
Gracias. Fue algo que no respetó ni raza ni estrato social. Yo diría que por el bienestar de todos debemos hacerlo. Es un compromiso para nosotros, para nuestros hijos también.
I think the greatest difficulty at the beginning of the pandemic was just being one of the very first to be hit. So we needed to write the book as we went along.
Korea tried to strike a balance between control and prevention measures and our people's daily lives. The first case of COVID-19 in South Korea was confirmed on January 20th. The KCDC created a task force to monitor the COVID-19 situation. At the same time, we enhanced a broad screening process to block the inflow of COVID-19. From mid-February, the number of confirmed cases skyrocketed in Daegu and the Gyeongbu provinces. Some said the provinces had to be locked down. The government decided to contain the spread while preserving the freedom of movement.
Countries started to shut their doors against travelers coming from South Korea. It was not a foreign policy issue, it was a disease control issue. There was a demand from the public and the media that we should also close our doors. And it was difficult to argue against that and keep our borders open while also keeping our society open.
WHO's regular briefings on COVID-19 has provided the latest updates, thereby allowing us to be prepared for and respond to the virus. Korea studied and analyzed the virus and began to develop testing kits.
We built up this example. The three T's, the testing, tracing, and the treatment are just the very basics of any disease control.
We have been able to pursue creative strategies, including the drive-through screening stations, residential treatment centers, and the non-face-to-face healthcare services.
Some look at the Korean case and say, oh, you have the IT infrastructure, you have the universal health coverage, you have the ingredients to be successful. But I think they're missing the most important element in this, which is the public's trust. Crisis response can be successful only if you are faithful to the fundamental values of your country. And those fundamental values of our very vibrant democracy is exactly openness, transparency, and full government accountability.
정보를 공유하고 함께 협력하는 힘은 바이러스가 갖지 못한 인류만의 힘입니다. 코로나는 인류 공동의 가치인 자유의 정신까지 위협하지만 자유의 정신에 기반한 연대와 협력이야말로 코로나와의 전쟁에서 승리할 수 있는 가장 강력한 무기입니다.
When it comes to COVID-19 response, what's commonly important is first solidarity and the cooperation with every member of society.
We've been getting countless requests for sharing our experience, for our test kits, for our masks, for our PPEs.
Korea supports the Access to COVID-19 Accelerate initiative led by the WHO and will actively take part in international effort to develop and distribute vaccines and treatments.
I think we all know now COVID-19 is here for the long term. We have to live with the risk and manage the risk while ensuring and enabling the people to move about and respecting their fundamental human rights.
The World Health Organization is steadfast in our mission to promote health, keep the world safe, and serve the vulnerable. And committed to our 3 ambitious goals, the triple billion targets, laid out in our 13th General Program of Work. Reaching these targets is vital to meet the Sustainable Development Goals by 2030. They are what guides our work across the 3 levels of the organization. First, we work so 1 more billion people around the world can benefit from universal health coverage. We deliver life-saving tools and supplies to countries and support training so there is a qualified workforce to help the world's most vulnerable people. We work so people can have access to the health services they need without financial hardship. Second, we work so 1 more billion people are better protected from health emergencies. We invest in and guide countries so they are equipped to prepare, prevent, detect, and respond to natural disasters and disease outbreaks like cholera, Ebola, or COVID-19. When necessary, we step in to coordinate the emergency response. And we are improving measurement practices so threats are identified early and appropriate responses are deployed. Thirdly, we work so 1 billion more people can enjoy better health and well-being. We help countries establish healthy environments and lifestyles in safe, supportive societies to prevent disease and save lives. We work to improve the water we drink, the air we breathe, the food we eat. One way we do this is by helping reduce risks that jeopardize health and well-being. For instance, through better road safety, decreasing tobacco and alcohol use, and more. And we harness the best science and data available. We know how crucial the power of science, data, and innovation are to improve global health and track impact in countries. We produce cutting-edge research for health. We conduct quality assurance for norms and standards. And we leverage digital technologies to improve health outcomes across the 3 billions. The world can only achieve these targets with strong leadership for health across the globe. That is why the world needs a strong, well-funded World Health Organization.
Nas primeiras semanas depois do parto, comecei a ficar inflamada, comecei a sentir dor no peito, não conseguia carregar bebê, comecei a me sentir mal, comecei a respirar mal, me senti tão mal e deixar minha filha sozinha, sem mãe. Acreditava que ia voltar ao normal.
At the moment, about 30 million people live with rheumatic heart disease in the world. The same number of people living with HIV/AIDS. The only really big difference is that rheumatic heart disease is not supported by a major organization, and 100 times more funding goes into HIV/AIDS than in rheumatic heart disease.
Taking data from surrounding countries, at least 25,000 people a year in Mozambique may be dying. It affects predominantly women. When you get pregnant, you have more symptoms and more clinical signs that you had before.
Já não estou a estudar, já não estou a trabalhar, parei tudo.
Rheumatic rheumatic heart disease is caused by a bacteria. This causes a throat infection that we call pharyngitis or tonsillitis. Being in a low-income setting, we usually miss the chance to properly treat the bacterial tonsillitis. Those susceptible develop acute fever. The third sign that you can have is called pancarditis. Everything in the heart is inflamed. Most important of them is the valves, which do not work properly. So they let blood flow inappropriately. And then you can develop the very severe complication, which is infection inside your heart. Really, one needs urgent surgery, something that we are usually not able to do. We failed as a community because this is a preventable disease by an antibiotic that is cheap. So as a community, we have to improve access to penicillin. We have to improve access to open heart surgery in low-income settings. When you have a disease that is not happening in high-income countries, there's something about inequalities, about disparity that we have to continue to fight for.
In 2018, at the World Health Assembly meeting, there was a resolution passed to improve detection of rheumatic heart disease, to improve the care of people living with rheumatic heart disease.
What we have to do is to improve access to family planning, to improve access to information, to make decisions regarding their life. If they are willing to get pregnant, are already pregnant, or are having a baby.
The World Heart Federation has set up an entire program on rheumatic heart disease for women who are diagnosed with rheumatic heart disease, and also improving access to surgery in low to middle income countries for cardiac thoracic surgeons.
Agora que tomo medicamentos, já consigo carregar bebê, já consigo varrer, já consigo nenecar a bebê, já consigo cozinhar. Já não estou mais inflamada, já desinflamei. Minha filha é o meu orgulho e a minha vitória. Quando olho para ela, eu não olho com aquele olhar de que ela que me fez eu descobrir a doença.
For women, we have learned how painful it is for them not to be able to plan their life. So I think that this is taking away some of your rights as a person, your human rights. If we want to eradicate the rheumatic heart disease, we have to understand every side of the problem.
सानैदेखि अलिकति केही गर्नुपर्छ भन्ने कुराले चाहिँ हैन यो एउटा समाजमा चाहिँ छोरी भएर पनि केही गर्नुपर्छ भन्ने चाहिँ त्यो लाग्थ्यो त्यो हिसाबले चाहिँ म ड्राइभिङ पेसामा लाग्यो हो
मलाई चाहिँ गुरु खै त डाक्टर साहब कता हुनुहुन्छ भनेर मलाई चाहिँ ड्राइभर भन्नुहुन्छ सबैले हैन उहाँलाई चाहिँ डाक्टर साहब भन्नुहुन्छ किनभने मान्छेले सोचेकै हुन्छ कि केटीले ड्राइभ गरेर चाहिँ यहाँ कर्णालीमा यस्तो माथि आएको छ भनेर
भ्याक्सिन त एकदमै इम्पोर्टेन्ट नै छ यहाँ चाहिँ अब मास्कहरू युज गर्दैन हैन अब त्यस्तो युज नगर्ने भएर फ्रन्ट लाइनमा काम गर्ने मान्छेलाई त एकदम धेरै गाह्रो भयो नि त त्यो भएको कारणले गर्दाखेरि पनि भ्याक्सिनदेखि लिएर त्यो सँगसँगै जनचेतनाको पनि एकदमै महत्त्वपूर्ण छ क्या जब मैले चाहिँ एउटा WHOको टी सर्ट लगाउँछु होइन मैले चाहिँ मेरो काम चाहिँ इमान्दारीपूर्वक काम गर्नुपर्छ होइन म चाहिँ एकदम प्राउड फिल गर्छु क्या
The World Health Organization is steadfast in our mission to promote health, keep the world safe, and serve the vulnerable. And committed to our 3 ambitious goals, the triple billion targets, laid out in our 13th General Program of Work. Reaching these targets is vital to meet the Sustainable Development Goals by 2030. They are what guides our work across the 3 levels of the organization. First, we work so 1 more billion people around the world can benefit from universal health coverage. We deliver life-saving tools and supplies to countries and support training so there is a qualified workforce to help the world's most vulnerable people. We work so people can have access to the health services they need without financial hardship. Second, we work so 1 more billion people are better protected from health emergencies. We invest in and guide countries so they are equipped to prepare, prevent, detect, and respond to natural disasters and disease outbreaks like cholera, Ebola, or COVID-19. When necessary, we step in to coordinate the emergency response. And we are improving measurement practices so threats are identified early and appropriate responses are deployed. Thirdly, we work so 1 billion more people can enjoy better health and well-being. We help countries establish healthy environments and lifestyles in safe, supportive societies to prevent disease and save lives. We work to improve the water we drink, the air we breathe, the food we eat. One way we do this is by helping reduce risks that jeopardize health and well-being. For instance, through better road safety, decreasing tobacco and alcohol use, and more. And we harness the best science and data available. We know how crucial the power of science, data, and innovation are to improve global health and track impact in countries. We produce cutting-edge research for health. We conduct quality assurance for norms and standards. And we leverage digital technologies to improve health outcomes across the 3 billions. The world can only achieve these targets with strong leadership for health across the globe. That is why the world needs a strong, well-funded World Health Organization.
Le cauchemar de tout docteur, c'est de tuer son patient. La maladie du sommeil, ça fait peur. Parce que la maladie du sommeil, vous voyez ces signes d'agressivité. Vous avez les signes de quelqu'un qui devient fou.
characteristic of what we were looking for, a molecule that was called fexinidazole, and it was developed during the 80s and abandoned because of lack of interest of developing a product for parasitology.
Sanofi had the molecule, but we partnered with DNDi, who brought their experience from preclinical research and being able to do the clinical trials in these very difficult-to-reach areas.
We started the study in 2012 in DRC and Central African Republic. It was incredible to have to think about how you would do sophisticated clinical research in an unsophisticated setting.
La RDC est un grand pays et la logistique, elle est lourde.
There was poor infrastructure, lack of scientific lab equipment, no one trained on doing clinical research, and the political instability in these regions. To overcome these challenges, we had to bring electricity. We had to bring microscopes. We also brought some technology like internet and satellites to make sure we would have the connection. We did training of 200 people in good clinical practice, in pharmacovigilance, to make sure that they could comply with what is needed to have a new drug registered according to international standards. We supported the national programs with cars, with boats, to go and look for patients. We work with the best teams, those that know how to diagnose these patients, those that are treating these patients.
Abanye oyo kasoni. Bana na bela ki na koma ki makais na lamba na kenda zamba na lamba gito pe na bana na ngato za bien tata ilo te makasi na nzo.
Patients can be treated much closer to where they live.
Donne confiance aux patients et c'est bien.
We're on the path to elimination of sleeping sickness.
It's not utopia anymore to be able to do this incredible research in these incredible conditions.
If we bring the right partner together, we can achieve the best science for a very neglected population.
Le Fexi, d'abord, il rejoint mon rêve. C'est merveilleux. C'est merveilleux.
The World Health Organization is steadfast in our mission to promote health, keep the world safe, and serve the vulnerable. And committed to our 3 ambitious goals, the triple billion targets, laid out in our 13th General Program of Work. Reaching these targets is vital to meet the Sustainable Development Goals by 2030. They are what guides our work across the 3 levels of the organization. First, we work so 1 more billion people around the world can benefit from universal health coverage. We deliver life-saving tools and supplies to health coverage. We deliver life-saving tools and supplies to countries and support training so there is a qualified workforce to help the world's most vulnerable people. We work so people can have access to the health services they need without financial hardship. Second, we work so 1 more billion people are better protected from health emergencies. We invest in and guide countries so they are equipped to prepare, prevent, detect, and respond to natural disasters and disease outbreaks like cholera, Ebola, or COVID-19. When necessary, we step in to coordinate the emergency response. And we are improving measurement practices so threats are identified early and appropriate responses are deployed. Thirdly, we work so 1 billion more people can enjoy better health and well-being. We help countries establish healthy environments and lifestyles in safe, supportive societies to prevent disease and save lives. We work to improve the water we drink, the air we breathe, the food we eat. One way we do this is by helping reduce risks that jeopardize health and well-being. For instance, through better road safety, decreasing tobacco and alcohol use, and more. And we harness the best science and data available. We know how crucial the power of science, data, and innovation are to improve global health and track impact in countries. We produce cutting-edge research for health. We conduct quality assurance for norms and standards. And we leverage digital technologies to improve health outcomes across the 3 billions. The world can only achieve these targets with strong leadership for health across the globe. That is why the world needs a strong, well-funded World Health Organization.
सपना, हमने तुम्हें ये नाम दिया था क्योंकि हम चाहते थे कि तुम अपने सारे सपने पूरे करो। पर तुम लड़ रही हो इस कैंसर से। मेरी बेटी, तुम इसे हराओगे।
Somewhere in the fog I heard her cry. It kept me up for hours, haunts me every night. Screaming through my veins, the fire spreads. Fill me up with poison, dark clouds overhead, I'm soaking wet. I'm hurt, you didn't know. But there's no pretty way to tell you so. I'm tired, so tired, I'm letting go. I've been burning flies to let you know. Time is up, time has flown. Time has flown. Here she comes, she lays beside my head. She holds me through my winter in this awful bed. Softly in my ear she casts her spell. Fuck this cursed cancer, send it straight to hell. She knows me well. I'm hurt, this body's wearing thin. A beautiful mistake I'm living in. I'm tired, sometimes I fantasize. They push me out to sea, coins on my eyes. Family, friends, say goodbye. Say goodbye.
The Assembly is called to order. The Assembly will now resume its consideration of item 3 of the agenda, and I would like to hand the floor over to the Secretariat to moderate this session. Thank you.
Thank you, Madam President. We will start off this session by inviting Afghanistan to the floor, to be followed by Malaysia. Apologies, Afghanistan. There is a technical issue. We will come back to you. We now hand the floor to Malaysia. Dear distinguished delegates, we have technical issues which we're hoping to sort out in the next few minutes. We will be back online shortly. Thank you. Dear Mozambique, we now invite you to the floor.
Gostaria de começar por congratulá-la, Senhora Presidente, pela sua eleição, assim como aos senhores vice-presidentes. Muito obrigado, Dr. Tedros, pela sua liderança e pelo apoio que tem concedido.
Thank you, Dr. Tedros, for your leadership. On behalf of the Republic of Mozambique and on my behalf, I would like to extend my solidarity to each member state for the suffering caused.
You may proceed, Mozambique. Apologies.
On behalf of the Republic of Mozambique and myself, I would like to extend my solidarity to each member state for the suffering caused by the COVID-19 pandemic. I would also like to express my deep admiration to healthcare professionals from all over the world who every day expose themselves to serve others. While we take care of the health promotion and strengthening our healthcare systems are of the utmost importance. Everything is dependent on the successful immunization of all people eligible for the COVID-19 vaccine. The National Mozambique Vaccination Plan wants to immunize 50% of the population. The procurement strategy is done through COVAX, the AVATT initiative from African Union, as well as bilateral acquisition. According to the amount of available doses, we have vaccinated so far 323,000 people among health professionals and selected high-risk groups. This number corresponds to only 1% of the total population of Mozambique. We want to encourage the continued response of the international community through financing, debt relief, and other forms of support to our health situation. However, it is urgent that more vaccines are made available to the low and middle income country. We are living a global situation of injustice related to the access to COVID-19 vaccine. While millions of high-risk people remain without hope of being vaccinated in the most poor countries, many rich countries go on vaccinating low-risk population groups. We therefore add our voice to those who protest against the criteria of profit and national interest for making vaccines available. If we wish to end this pandemic and prevent the next one and build a healthier, safer, and fairer world, we need to take collective action and make vaccines against COVID-19 available to the communities most vulnerable, regardless to where they live. Thank you, Madam President.
Many thanks, Mozambique. We shall now invite Bahrain to the floor.
Thank you, Madam President, Director General, Excellencies, Heads of Delegation, ladies and gentlemen. When we met at the last World Health Assembly, we had the hope of being able to meet in person and to prevail over coronavirus. But now this year we are once again meeting virtually. But that is not because we have not prevailed over COVID. We have vaccines available now and they are effective and they have been made available in a record time, just a year after the appearance of coronavirus, and that will enable us to get rid of this pandemic. And we are meeting as governments together with the WHO and with a number of international organizations, and we have drawn conclusions from this situation in order to strengthen coordination and the response to the pandemic. And in particular, we are looking at coronavirus, which has caused a lot of negative consequences, and we have to build a better and fairer world. Madam President, facing this virus, as a number of other countries are in the process of doing, and thanks to His Royal Highness, Prince Salman bin Hamad Al Khalifa, and the Prince who has undertaken measures and policies at all governmental levels, we've been able to face all of these challenges, and we have a great success story, not just in terms of this pandemic, but also in terms of implementing the principles of health justice when it comes to the tests, therapy, diagnosis for all sectors of the population, whether they are residents or citizens of our country. And we have been able to cover 70% of all persons eligible for the vaccine in line with WHO recommendations. And this is free and without exception. Everyone has been able to choose the vaccine of their desire. And of course, we will not be safe unless everybody is safe. And of course, health justice knows no geographic borders, and we have strengthened our screening tools, our diagnostic tools and treatments in order to overcome this pandemic. Madam President, our world has changed profoundly following the appearance of this virus, and of course this requires us as states and as governments to strengthen our health systems, particularly in terms of health emergencies and epidemics, and to do so quickly so that we can build on our capacities and strengthen our capacities to produce vaccines and to transfer technologies, and of course to remove certain patent protections. And so I would like to thank you all for your attention.
Thank you, Barry. We should now like to invite Lebanon to the floor.
بداية نتقدم من رئيسة المؤتمر.
At the outset, we would like to present to the President and the Vice President our congratulations on your election and to wish you success in your work. And we would like to commend the Director General for his opening address, and we would like to assure him of our support and to commend the organization that has fought against this pandemic. And we are proud of our bilateral cooperation, which is very fruitful and transparent between the government of Lebanon and the WHO. And this pandemic has shown us the importance of cooperation in order to put an end to this pandemic and to combat the negative effects on society and the economy. And of course, our organization is at an important point now in terms of international cooperation. This is particularly the case for countries that have undergone very difficult consequences and which have been exacerbated by COVID-19. Lebanon is among these countries which is facing an acute economic financial crisis and a refugee crisis, and the pandemic has added to this, and there is a humanitarian crisis taking place now, and we need to ensure access to vaccines in order to limit the injustices and to ensure early warning systems to prevent catastrophes. And of course, developing countries need to be assisted. Humanity has truly progressed by producing this vaccine in record time. However, we need to distribute these vaccines fairly across the entire world. And as part of these efforts, companies producing the vaccines need to remove the patent protection, and we of course call upon the international community to show its solidarity and to multiply the tools that exist to overcome this pandemic. And to conclude, I would like to draw your attention to the important role played by the WHO, and of course this role depends on regular funding of the organization in a visible and transparent manner in order to guarantee their success in terms of diagnostics and treatment, so that they can seek solutions in order to ensure that WHO activities are successful, particularly in terms of sustainable development. Thank you.
Thank you, Lebanon. We should now like to invite Israel to the floor.
Good afternoon. Dear Chair, estimated colleagues, we are nearly a year and a half into the COVID-19 pandemic. Thanks to the tireless efforts of healthcare workers and those who work on the various vaccines against the virus, we are beginning to see the light at the end of the tunnel. Israel is a small country with advanced information technology and logistic capability, allowing for smooth and successful vaccine enrollment. This setting provides a robust platform to examine vaccine effectiveness and the impact of high vaccine coverage in real-life conditions at the national level. By May, low infection rates indicate effective control of the pandemic within the country borders, with a lift of most domestic restrictions. Actually, from next week, there will be no restrictions in Israel almost at all. Unfortunately, we're still experiencing a continuous stream of infected individuals traveling to the country, including those infected with a new variant, despite strict testing and entry policies. This phenomena indicates the need for an international approach to a safe travel-based and vaccine verification for individual travelers. Like most countries, Israel suffered during the pandemic, and each loss of life due to COVID-19 was a tragedy. We know that many other countries are still facing waves of increased COVID-19 cases, shortage of supply, and overall fatigue. We know that no one is safe until everybody has access to vaccines. We recognize that this is a global challenge, and we have to fight it together in solidarity. Though we are proud to share our lessons learned from the vaccination effort with the international community. We encourage this body to take coordinated steps to combat vaccine hesitancy worldwide. Excellency, we are not yet in the clear. To be truly free of COVID-19 pandemic, we must ensure the vaccination of all people worldwide. Israel would like to emphasize the imperative role of multilateral and global cooperation responding to this pandemic. We wish to thank all member states who participate in the valuable consultation with WHO, who work to produce vaccines or share their experience with others to identify the best practices. Israel would also like to emphasize the importance of ensuring access to information as well meaningful practitioners by all stakeholders in addressing this global challenge. In this spirit, we are collaborating with our neighbors to ensure safely and efficient vaccination rollout for all of our neighbors. As we look forward, we are to learn from COVID-19 pandemic. We will be able to strengthen our worldwide health system in a manner never seen before. The multi-dimensional challenge of COVID-19 crisis had created.
Thank you very much, Israel. We should now like to invite Afghanistan to be followed by Malaysia.
Bismillah ar-Rahman ar-Rahim. President of the World Health Assembly, His Excellency Dr. Tedros, health ministers, distinguished delegates, ladies and gentlemen. Assalamu alaikum wa rahmatullahi wa barakatuh. The World Health Assembly is being held in a critical time as the world fights against COVID virus. While millions of people have lost their lives due to the COVID-19 pandemics, I mourn for every life lost and express condolences to the grieving families. In Afghanistan, we have done everything within our control to support and assess our people in need. Our number one priority is to do everything we can for preventing, controlling, and treating COVID-19 pandemic. We have applied prevention, quarantine, detection, treatment, and tracing strategies. We have trained our staff, and we have deployed critical supplies to our hospitals and health facilities. And we have vaccinated about 600,000 vulnerable people so far within the public sector. I would like to take this opportunity to thank COVAX facility and the government of India for providing 500 doses of vaccines each. We look forward to further support from these two addresses. Mr. President, distinguished delegates, Afghanistan has learned many lessons from COVID-19 pandemics. COVID-19 has revealed our health system's gaps and weaknesses. We have understood that need for bringing reform to many aspects of our health system is more needed than any time. Ensuring that lessons are well captured and embedded into our health system, the government of Afghanistan would like to focus on the following areas. Number 1, effective response and recovery from COVID-19. Number 2, transform the basic package of health services and essential package of hospital services to the integrated package of health services to include additional interventions to respond to emergencies and epidemiological needs of the country through the most cost-effective interventions. Number 3, reform of hospital sector. 4, reach the polio eradication goal. 5, reform pharmaceutical market and food security in Afghanistan. Besides these 5 areas, we're committed to strengthen the governance and leadership capacity of the Ministry of Public Health through institutional transformation and decentralization, rule of law, respect of human rights, gender equality, inequity, principles at all levels of the health system. We are aware the development of human resources is a key to answer the health needs and disease profiles of the population. Therefore, we plan pre-service and in-service training to become need-based, competence-based, and quality-oriented, aiming at meeting the good international standards. Furthermore, health financing will be improved through diversification of financing sources, improving of operating efficiency of public health facilities, and implementation of optimal payment mechanisms. Options to increase budget allocation for health will be explored, and financial protection mechanisms will be identified and piloted. Moreover, we plan to further develop health information system to integrate a culture of evidence-based decision-making, and the organizational culture at all levels of the health system, and to improve direct communication with users of health services and patients. Mr. President, distinguished guests and colleagues, the government of Afghanistan is committed to providing health services
to invite Malaysia
Afghan.
to be followed by the Democratic People's Republic of Korea.
Distinguished delegation from member states and observers, ladies and gentlemen, greeting from Malaysia to this assembly. We wish to express our appreciation to the World Health Organization under the leadership of Dr. Tedros and our Western Pacific Regional Director, Dr. Takashi, for having commanded the biggest ever multilateral response through the Strategic Preparedness and Response Plan, containing and countering this threat with a transparent, evidence-based science and coordinated global response. Most parts of the world are yet again facing with the resurgence of the infection, with the surge of cases since during the third wave, which had begun back in September 2020. The Malaysian government implemented reimposition of the Movement Control Order, MCO, restriction nationwide. Malaysia outlined a 5-point strategic plan to break the chain of transmission of COVID-19, which are reduce morbidity and deaths, strengthening diagnostic and surveillance, achieve herd immunity, and increase awareness of the new normal. COVID-19 vaccines have given the world a sense of hope. Vaccine rollout has been fast expanding since the start of this year. Malaysia has taken an integrated approach in obtaining vaccine through its diplomatic relations and strategic international cooperation with countries, vaccine manufacturers, as well as World Health Body. Government of Malaysia embraced the joint effort of inter-ministries and agencies to ensure the national COVID-19 immunization program runs smoothly, and vaccination is to be done effectively in the effort to curb the pandemic. Malaysia embarked on his journey to nationwide immunization program in February 2021. Since then, we have successfully vaccinated 1.9 million of our 32 million population to reduce infection, hospitalization, and deaths. Malaysia has always instilled trust in our public by being transparent by showing live talikas of national leaders receiving the vaccination. This strategic communication is of utmost importance in encouraging the public to come forward to sign up for vaccination. we have also actively managed the fake news and misinformation on vaccines that has spread like wildfire all over social media. Therefore, accepting this new reality and staying committed to SOP as a new normal are very critical to prevent COVID-19 infection. The whole of Malaysia is working together to combat the spread of COVID-19. We advocate nationwide effort and cannot stress enough that the success to flattening this curve lies on the whole of government and whole of society approach. With the surge of COVID-19 cases within Malaysia and this region, Government of Malaysia has also secured the commitment of several private healthcare facilities to receive referral and treat both COVID-19.
Thank you very much, Malaysia. We would now like to invite the Democratic People's Republic of Korea to be followed by Thailand.
Honorable Chair, Director General, distinguished delegates, the world has been working together to combat COVID-19 based on principle, no one is safe until everyone is safe. Yet our member states have been showing considerable disparity in their processes and pace. I would like to express my gratitude to the WHO Secretariat for its efforts in addressing this inequality by supporting countries' health systems and equitably distributing COVID-19 tools through COVAX. For our part, Korea has been supplying COVID-19 diagnostics worldwide and through contract manufacturing of vaccines contribute to making sure that vaccines reach every country. Korea promises.
Delegates, we apologize for the video. We shall be starting with Democratic People's Republic of Korea shortly. We shall now invite Thailand.
It's a multilateral initiative involving more than 70 countries and other organizations that drives the world towards safety from infectious disease threats. Thailand, as a current chair of GHSA steering group, underscores two main points. First, effective containment of the pandemic requires preparedness and response capacities, as well as whole government approaches and active international collaboration. Since 2014, the GHSA has contributed to strengthening these capacities at the country level. The rapid research development, manufacturing of COVID-19 vaccines, and country commitments to vaccine rollout all contribute to global health security. No one is safe until everyone is safe. Collaborations between FAO, OIE, and the World Health Organization at country and global levels are cornerstones for effective One Health approach, which supports global health security. Second, the GHSA supports investments in strengthening preparedness and response capacity through different action packages identified and prioritized by the joint external evaluations of international health regulations. GHSA will continue to achieve its targets. I am making the following statement on behalf of Thailand. The government is working hard to contain the outbreaks in prisons, factories, and major crowded communities by mobilizing surge capacity for active case findings, offering quarantine places, and providing medical services for free under universal health coverage. Numerous field hospitals have been established to accommodate the cases. Thailand is in the middle of massive vaccine rollout. By end of this year, we will vaccinate 100 million doses for everyone in Thailand, including migrant workers, diplomats, and UN staff and the families. This will cover 70% of the population. All public vaccines are fully subsidized by the government budget and provided free of charge throughout the country including shopping centers, clinics, and hospitals. Systems to monitor adverse events after vaccination are fully established to ensure people's confidence and trust. International lessons remind us not to be complacent. This government gives high priority for protection to our staff who are the frontliners dealing with COVID. We foster high levels of personal prevention behavior, such as use of face masks, hand hygiene, and physical distancing even after vaccination. The government of Thailand provides financial support packages to mitigate the impacts of the COVID and to stimulate the economy. Also, we closely monitor the emergence of variants of concern. Finally, the government stands ready and is fully committed to containing COVID-19 and recovering our economy. Thank you.
Thank you, Thailand. We would now like to invite the Democratic People's Republic of Korea to be followed by Barbados.
Assembly and highly appreciate Dr. Tedros, WHDG, and the Secretariat for their active efforts to overcome this global health crisis. I would like to pay our tribute to the health workers devoting themselves to save the lives of the people even at this very moment. Today, the world is in an all-out war against the virus never known in history. This terrible pandemic has claimed the lives of more than 3.4 million, lasting more than a year. The severe lesson from this highlighted once again for the importance of WHO and the responsibility of every government for the lives of their people, as well as necessity of the global cooperation. Public health is important in protecting and promoting the health of the people, and making constant progress in the health system is everlasting policy of our government. Free medical care system has been enforced in 1950s during the war when the destiny of the country was at stake. Since then, everyone in our country is enjoying the benefit of the advanced public health system and the treatment of the diseases free from worries for its fees. Comrade Kim Jong-un, the president of the State Affairs of DPR Korea, has personally attended the groundbreaking ceremony of Pyongyang General Hospital last year. It is under the construction at the best place in Pyongyang, and at the same time, the preparation for its operation is pushed ahead. It is a full will of our government to restore the materialistic and technical basis in the health sector and bring up the main health indicators as the average life expectancy and the rate of prevention of the communicable diseases to the advanced level of the world by 2025. Amid the global crisis getting serious day by day, all our people has rose as one under the wise leadership of the respected Comrade Kim Jong-un and is waging the emergency anti-epidemic work to defend the health and well-being of themselves and their children. My government is extending its full support and encouragement to WHO. It's standing at the very front of all-out war against the pandemic, and regards that WHO should duly take the leading role in overcoming this crisis. WHO should lay out a legal framework, concrete strategy, and milestones to stamp out COVID-19, including IHR. It is also necessary for all the countries to exchange their best experiences and lessons learned and join hands in wisdom. WHO should also advocate the moral and ethical aspects of the public health to save the human lives and removal of the inequality in the world. Some countries are storing the vaccines more than its needs, plainly adhering to vaccine nationalism, while other countries can't even procure them with their own affordability, which is very sad reality. National egoism and seeking only the profit is an immoral act, indifferent to others' misery and current crisis, and this cannot be justified in any circumstances. The Alma-Ata Declaration 40 years ago affirmed that health is not a privilege but an elementary human right. WHO should devote its efforts to build a fair world where everyone is granted proper health care without any discrimination. The DPR Korea government, upholding its people-first principle as its noble political ideology, will be loyal to its responsibility and obligations for the protection and promotion of the people's health and their well-being under any circumstances, and make its contribution to the construction of the righteous and fair health system in the world. Thank you.
Thank you. We would now like to invite Barbados to be followed by Zambia. Barbados, you have the floor. Barbados, we will come back to you shortly. We would now like to hand the floor to Zambia.
Distinguished delegates, ladies and gentlemen, Zambia aligns with a statement delivered by Benin on behalf of the Africa region. We thank the Director General for the concise report. We further appreciate the collaborative work of WHO and the African Union Commission. We have so far recorded 93,428 confirmed COVID-19 cases and 1,167 deaths as of 24th May 2021. Zambia continues applauding our healthcare workers who are our heroes and heroines. Our response as a country is anchored on the multi-sectoral COVID-19 contingence and response plan developed with technical support from WHO and aligned to the Global Strategic Preparedness and Response Plan, which informs resource mobilization and action across all pillars in Zambia. Zambia, through the Zambia National Public Health Institute, continues to coordinate COVID-19 surveillance to ensure timely detection and management of cases. Using a multi-sectoral approach, we've implemented a robust school surveillance system, which is a critical step in preventing COVID-19 in institutions of learning. Mr. President, the shortage of essential commodities that continue to rock the low and middle income countries has the potential to undermine our response to interrupt transmission of COVID-19. We note the more than 200 combined recommendations contained in the reports of the International Health Regulation Review Committee, the Independent Expert Oversight Advisory Committee, and the Independent Panel for Pandemic Preparedness and Response. However, it is our conviction that unless the world applies unprecedented solidarity and acts in a way that leaves no one behind, the hope of defeating COVID-19 will remain a pipe dream. We note with concern that the Access to COVID-19 Tools Accelerator, a well-intended initiative that assures equitable access to vaccines, diagnostics, and therapeutics, is being undermined by vaccine nationalism. Zambia appeals to member states to support the efforts of WHO as it takes the lead in thwarting the catastrophic effects of COVID-19. Mr. Moderator and the President, I thank you.
Thank you very much, Zambia. We should now like to invite Barbados to be followed by Lithuania. Barbados, you have the floor.
Sorry, Barbados's intervention is going to be done by Minister Bostic, who's listed as rapporteur.
Thank you. It is an honor for me to address the plenary session of the 74th World Health Assembly and for Barbados to lend its voice to the status of public health at the global, regional, and national levels. Let me place on record my country's support for the work being done by the Secretariat and our solidarity with previous speakers who have expressed sympathy to all those who lost loved ones to this devastating pandemic. To those who have come to the aid of our country and our CARICOM region, a mere expression of gratitude is clearly not enough. But nevertheless, we thank you most sincerely. Our battle against the pandemic has reinforced the point that we are strongest when we fight together. We must be our brother's keeper, since a spike in COVID-19 in any one territory represents a threat to all. I am sure that others will agree with me when they say that it has been most gratifying to have a regional organization like the Caribbean Public Health Agency working in concert with PAHO to help all of us to navigate what is indeed a heavily mined and fortified COVID-19 battlefield. While acknowledging the important role being played by Gavi and its partners through the COVAX facility, Barbados strongly advocates for a leveling of the international playing field with respect to the access to vaccines and therapeutics for small island developing states, states that are too often excluded from negotiating and planning processes. We further reiterate our call for greater leadership and partnerships on COVID-19 so that truly no country is left behind. Our mantra of no retreat, no surrender has been taken to another level as we are determined not to surrender to COVID-19 and equally not to retreat from our responsibility to continue to deliver the wide range of healthcare services that have been integral to our national development. It is against this background that we remain committed to investing in other aspects of healthcare and the development of health systems. Consequently, we support the work and seek the assistance of the Secretariat in the areas of climate change and health, antimicrobial resistance, non-communicable diseases, health information systems, mental health reform, and research and development for health. Barbados commends the Secretariat for assuring access to healthcare for an additional 1 billion persons across the globe, but urge that you consider innovative ways for increasing universal coverage and access to healthcare for those countries that, even though with small populations, still struggle with the fundamental aspects of making public health more accessible and health systems more resilient. Finally, irrespective of culture, religion, political ideology, wealth, or size, let us truly unite to fight this virus so that those who have to go to battle against the next pandemic would be better prepared to do so because of the legacy that we would have left behind. I thank you.
Thank you. We would now like to invite Lithuania to be followed by Australia.
Excellencies, colleagues, Lithuania fully aligns itself with the statement on behalf of the EU and its member states. The COVID-19 pandemic has changed the lives of every country in the world, with almost all areas of our everyday life were touched: health, economy, social life, and human rights. The crisis showed that health systems were not ready to respond rapidly to such public health emergency. In future, we have to rethink our priorities and put all our efforts to be able not only to manage emergencies, but also to be able to prevent them in the future. We also saw an increased amount of misinformation, which posed another challenge for all of us: to ensure that people trust the measures which are best suited to contain epidemics. No one is safe until everyone is safe. Effective multilateralism and unity are crucial in effective management of the global response. Vaccination is vital to end the pandemic. Therefore, it's essential to ensure the production and availability of vaccines to all the world's population equally. Global crises need global responses. We emphasize the importance of the global leadership in coordinating joint international efforts and actions and adherence to the principle of effective multilateralism to achieve our goal: make the world healthier, safer, and fairer. World Health Organization leadership is extremely important in this area. The pandemic highlighted the shortfalls in rapid response. Therefore, we stress the importance of further WHO reform in order to strengthen organization which will be fit to respond much more effectively to future health crises. We strongly believe that all countries and all regions in the world must be involved in global health issues, as only by involving all stakeholders can we not only manage pandemics properly, but also be better prepared for challenges that pose in the future. Taking this opportunity, we would like to congratulate the decision of USA to remain in the World Health Organization. Finally, we would like to thank the WHO for its continued work and leadership in coordinating the global response to COVID-19. Thank you.
Thank you. We would now like to invite Australia to be followed by New Zealand.
The COVID-19 pandemic has had profound personal, societal and economic impacts. And Australia recognises the continuing suffering of so many countries, and we express our condolences to everyone who has lost loved ones to COVID-19, and we thank the extraordinary and tireless workers in health, in medical and in community areas across the globe. At last year's Assembly, I spoke of the need to learn from the lessons from the global response. And when the pandemic struck, Australia acted promptly to prevent the spread of COVID-19, at times ahead of WHO advice. And domestically, we focused on containment, capacity and collaboration. At the same time, ensuring that decision makers are guided by expert medical and scientific advice. At this stage, we've been fortunate to have 91 days of zero community transmission this year, but every day we're on watch. And so as we carry forward our national vaccine rollout, we've also worked to ensure that our vaccine supply can be used to assist other countries in our region with pressing needs, including through our contributions to the COVAX facility and other regional initiatives to purchase vaccines. And this builds on our ongoing technical and regulatory efforts to strengthen vaccine programs and COVID responses in the region. I particularly want to thank the Independent Panel for Pandemic Preparedness and Response for their bold and ambitious global recommendations. And those recommendations include a call to end the current pandemic and, in so doing, save lives, strengthening the independence and authority of the WHO and its functions, formalising universal periodic peer reviews on pandemic preparedness, and halting outbreaks at their source through early action, as well as supporting a strong WHO with its operations on the ground. And so ultimately, we need to ensure that the WHO and its processes are strengthened and adequately resourced to deliver on the job, and we've provided the support to do that. The world needs to be able to rely on the WHO's expertise and guidance to support an effective pandemic response. COVID-19 has underscored the importance of working with all partners, including Taiwan, to address global health security concerns. That's what will protect all of us. Ultimately, Australia will continue to work with the global community to end this pandemic and prevent the next. And for that, we thank you.
Thank you. We would now like to invite New Zealand to be followed by Turkmenistan.
States stood together in solidarity and commissioned a wide-ranging review into the global response to COVID-19. We did not know the devastation that was yet to come and the lives that would be lost, but it was clear even then that we needed to do better. New Zealand welcomes the report from the International Panel on Pandemic Preparedness and Response. We support the level of ambition and look forward to working through the recommendations with other member states as a matter of urgency. Nevertheless, we need not wait to acknowledge the challenges the report has laid bare, most notably that the toll of COVID-19 has not been borne equally. Across all countries, the communities that had poorer access to healthcare and fewer socio-economic resources have been the hardest hit. In my country of Aotearoa, New Zealand, we have worked hard to ensure COVID-19 does not exacerbate existing inequalities. Māori, our Indigenous people, have lower life expectancy and high rates of preventable deaths. Our response to COVID-19, and now our vaccine rollout, has focused explicitly on ensuring that testing and vaccines, for example, are available in places and ways that are culturally appropriate. Equity has also been a driving force for New Zealand as we look beyond our borders. Our focus on elimination within our own unique context has enabled us to largely keep COVID-19 out and to quickly stamp out community cases when they arise. This approach was also chosen because it could afford an additional layer of protection for our Pacific neighbours, as New Zealand is the gateway to many countries. New Zealand has contributed globally to ensure equitable access to vaccines. We were an early supporter of COVAX and continue to do so through the contribution of nearly 1.7 million doses to date. We're also working to support vaccine access and rollout to our nearest neighbours in the Pacific. New Zealand's vaccine strategy includes a focus on contributing to global and regional efforts, and we will continue to look for opportunities to increase our contribution. At this World Health Assembly, and in the weeks and months after, as we make decisions on next steps, it is vital that we once again stand together in solidarity. This includes upholding the principles of inclusivity and non-politicisation. There is also no time to lose. Another pathogen could potentially emerge at any time, and we need to prepare now. New Zealand strongly supports the ambitious approach outlined in the panel's report. We stand ready to work with other member states to strengthen global health security, noting this impacts not just our own people, but everyone, today and into the future. Together, we will all stand stronger. In New Zealand's Indigenous language, Māori, we say, mā whiro, mā pango, ka oti ai te mahi. Where everyone does their part, our work will be complete.
Thank you very much, New Zealand. We would now like to invite Turkmenistan to be followed by Luxembourg.
Уважаемый господин региональный директор
Director General of the World Health Organization, ministers, esteemed delegates, ladies and gentlemen. Thank you for giving me the opportunity to address you today. At the outset, on behalf of the government of Turkmenistan, we would like to support the work of the World Health Organization and its Director General, Dr. Tedros Ghebreyesus. We would also like to thank him for his long-standing cooperation with Turkmenistan. Turkmenistan is a member state of the WHO, and we approve and support the work carried out by the WHO, and particularly the principle of nobody being left behind, and to deal with public health emergencies of international concern. Turkmenistan is demonstrating this through its approach to its own citizens, and we are following international standards, and we are strengthening our epidemiological surveillance, which is particularly important given the global situation. And we are cooperating with the World Health Organization as regards preparedness and response plans, which have been developed together with the WHO and the United Nations agencies in line with WHO strategies to combat COVID-19. The issue of strengthening the presence of WHO in our countries in order to achieve the Sustainable Development Goals, and also in line with European Union programs, we are working to. Well, we would stress that the country offices and the regional offices of the WHO play a key role, particularly given this unprecedented pandemic. At the outbreak of the pandemic, the country offices and regional offices of the WHO provide assistance to the Ministry of Health of Turkmenistan by organizing regular meetings in order to exchange information, and we are continuing our work to implement joint projects of the WHO, and I am convinced that the results of this World Health Assembly will help all countries to achieve global and regional goals. by implementing intersectoral measures in a number of areas. Thank you for your attention.
Thank you. We would now like to invite Luxembourg to be followed by Azerbaijan.
Monsieur le Directeur Général.
Director General, Excellencies, Madam President, in this context of a global health crisis, Luxembourg would like to reaffirm its full support to the World Health Organization to overcome this pandemic. 1 year after the World Health Organization declared this as a public health emergency of international concern, we have to note that the global situation remains concerning, particularly given the epidemiological data that is quite alarming in certain regions of the world. Luxembourg commends the efforts of the Director General to promote equity in terms of vaccinations, and we commend Gavi, the WHO, and its partners for their remarkable commitment through the COVAX facility, which has contributed to saving millions of lives thanks to the equitable distribution of vaccines at a global level. My country is ready to strengthen its support to COVAX in order to vaccinate the most vulnerable populations. This is a moral imperative, and it is our collective responsibility to do so in order to achieve, as quickly as possible, global health security. And to that end, we're going to announce additional support during the COVAX meeting that will take place next month. And we fully commit to a global response to the COVID-19 pandemic in order to contribute to a world of solidarity, which relies on resilient health systems that promotes universal health coverage and access to primary health care. The lessons that we should be drawing from this will make the WHO stronger and more active and better prepared to face future pandemics. Luxembourg commends the work of the IPPPR, the Independent Panel for Pandemic Preparedness and Response, and in that regard we support the development of a treaty as long as negotiations of such an instrument do not hamper the response to the current health crisis and acts as a complement to international health regulations. And we recognize the need to substantially increase funding in order to improve preparedness and international response to health crises. And we hope that the Working Group on Sustainable Financing will manage to reach an agreement on the issue of increasing assessed contributions of member states. And another initiative supported by government is the need to strengthen the sharing of samples and genomic sequencing at a global level to better respond to the mutations of viruses. And Luxembourg would like to participate in the initiative of a global biobank hosted in Switzerland, and we will make available our knowledge in that regard. Madam President, last year we paid tribute to health workers and to the victims of the COVID-19 pandemic. We must not forget them. And I will conclude with the main lesson that we have learned from this crisis, which is that we have the opportunity today, together, to build a fairer world, a world of more solidarity, and one that guarantees health for everybody. Thank you.
Thank you. We will now invite Azerbaijan to be followed by Bolivia.
General, ladies and of course, at such a significant assembly, which is followed previous one being held for in such a format, the main priority is a coordination of measures to combat the COVID-19 pandemic. Unfortunately, in many cases, countries are fighting this scourge alone. Every country should know that the problem of Asia, Europe, Africa, America is not only their problem, it's a problem for all of us. Only by combining efforts, building a purposeful, well-thought-out strategy of action, we can achieve success in combating the pandemic. As for the experience of Azerbaijan, I want to say that our government has organized measures to combat coronavirus in several areas. Measures taken to prevent the entry of the virus into the country, measures taken to prevent the spread of infection within the country, timely identification of infected people, the organization of treatment of patients. Now started immunization campaign free of charge for all citizens, as well as for diplomatic missions and foreign citizens residing in Azerbaijan. As a result of these measures taken in a country with a population of 10 million, we succeeded stability in firm control of infection. Dear colleagues, in the fight against the global pandemic, solidarity and cooperation between countries and international organizations is especially relevant. We express our readiness to continue cooperating with international institutions and the world community. We firmly believe in necessity for more proactive agenda to be held by WHO from the point of view derived from possible forthcoming new pandemic course, especially in terms of the subject of worldwide specialized lab setups, vaccine production, and its fair global distribution. We strongly believe that there is obvious necessity of political, scientific, and legal empowerment of WHO. I am rest assured that the valuable ideas and suggestions expressed today by the heads of delegations, heads of international organizations will contribute to our joint fight against coronavirus. This important session is dedicated to elaborating international efforts led by WHO to fight global pandemic threatening the whole world. And this task requires genuine cooperation and joint efforts of the whole international community. It's regretful that against this backdrop, the representative of Armenia this morning has tried to hijack the focused attention of distinguished delegates and use this high rostrum for his government's narrow political interest. Despite 30 years of Armenian occupation and large-scale destruction on the liberated Azerbaijan territories, my country at the top political level has already proposed its long-term vision of restoring peace and establishing stability in the region. Now it's Armenia's turn to respond. At the end of my speech, I want to express my confidence in the further strengthening and consolidation of our efforts in the name and for the benefit of protecting the health of people, the most valuable asset of the world civilization. I wish you all good health, success, and prosperity. Thank you.
Thank you. We would now like to invite Bolivia to be followed by Senegal.
El Estado plurinacional.
The plurinational state of Bolivia sends its greetings to all delegations that gather here in the 74th World Health Assembly. Today, we have a shared goal. We need to face COVID-19. For us, it's extremely important to be able to participate in this assembly to promote joint actions to combat this scourge. It's difficult to understand the current situation we are in when a small percentage of countries gathers to itself a large percentage of vaccines, actually accumulating 9 times the capacity that other countries require, while a large percentage of countries does not have access to the same vaccines. That is why the initiative of our President, Luis Arce Catacora, is to release these patents.
I would like to invite South Africa.
That way, all laboratories
followed by
that have the requirements will be able to produce the vaccine, and this will provide greater transparency and accessibility to the vaccine according to democratic values. If we do not take joint measures, our isolated measures will be fruitless. If we do not let vaccines reach each and every citizen of the world, that will allow the virus to mutate and spread. We appeal to all of you to solve this global crisis of selfishness. In Bolivia, we are carrying out a containment strategy based on 10 pillars with 3 main focuses: early diagnosis, access to medicines, and all being free of charge. We work closely with all our levels of government within the plurinational state of Bolivia. One of the key axes here is vaccination. For vaccinations to be effective, we need proper action from each and every country.
Business as usual.
We need to understand that our actions always need to be
fundamentally change
global. And if we join our efforts to defend the life and health of all populations, only by acting together and only by working in a synergy will we be able to emerge victorious. Thank you so much.
This is why we are very pleased that
Thank
we've
you.
reached
We would now like
consensus
to invite
at this
Senegal
World
to be
Health
followed by
Assembly
the United Kingdom
to pass a decision that creates a dedicated moment in November 2021 for a special
Madame la
session
Présidente.
of the World Health Assembly to consider the benefits for such a convention, agreement, or other international instruments.
At the outset,
In
I
our
would like
view,
to
a
pay
pandemic
tribute
treaty under the
to the
roof of
victims
the
of COVID-19
WHO is the
and
preferred
wish
way
a
forward
swift
to
recovery
strengthen the
for
multilateral
all
health
those who
architecture,
are suffering from the disease right
including
now.
the IHR,
I would
and
like
to
to
heed
commend
the
the
call
World
by
Health
so many
Organization
experts
for
to
coordinating
reset the
the
system.
global response to
The
this threat,
open-ended working
and I would
group
encourage it
established
to continue
through
its
the
efforts.
WHO strengthening resolution
Madam
will
President,
prioritize the assessment of
since
such a way forward
2020,
and will
our
present
countries
its
have been
findings
particularly
to the special
tested by
session.
the COVID-19 pandemic.
Ladies and gentlemen,
This
we
unprecedented
heard
health
yesterday
crisis
from world leaders as
has
well as the
shaken
UN
health
Secretary General,
systems and
strong
provoked
support
much
for global
thought and a
cooperation
number of initiatives
towards a
on
pandemic
resilience
treaty.
in a
We need
context
to
of the resurgence
capitalize
of
this
epidemics.
moment to act now for the
I would
next
like
health
to welcome the
crisis,
courage and
or indeed
sacrifice
other
of health
crises
workers who have
are
experienced
around the
months
corner
of
in
stress
today's
and
complex
professional
and
burnout.
interconnected world.
Thanks to the
Indeed,
effectiveness of their
the
actions,
26
the world is in
components
the
of the
process
treaty
of
decision
overcoming a
and
global
partners are
health
fully aware
emergency
that this is not easy,
which has
as we
undermined
are
our
all
health systems
still
to an
working
unprecedented
tirelessly
degree.
to address the
At a
pandemic.
regional level, Senegal
Probably
is
the
playing an
most
active part
important lesson
in
COVID-19
the
has taught us
response
is the need
efforts as
for
part
stronger
of
and more agile
ECOWAS,
collective
WAHO,
defenses
the West African
against
Health
health
Organization,
threats
and the
as
African
well as
Union
for
through
building
the African
resilience
Center for
to
Disease
address
Control
future
and Prevention.
potential pandemics.
As part
A
of
new pandemic
efforts
treaty
to increase the
is
resilience
central
of our
to
health
this
system, Senegal
and will continue
has
to work tirelessly
improved
and
its
inclusively
technical facilities by
to turn
building
this
and
vision
equipping 4
into
new
reality.
hospitals
We're
in
committed
remote
to
regions
seize
in order to
this
improve
moment and
the
welcome
geographic
others
accessibility and
joining this
financial
collective
accessibility
action
of quality
and our
to
common
quality
endeavor
healthcare.
for
In
global
addition to the enormous
cooperation and
investment
solidarity that
which has been made
extends
to
beyond
treat
this
patients
crisis.
in
I thank you for
epidemic
your
treatment
attention.
centres and other health
Thank you,
structures.
South Africa. I now
Senegal
ask
has
Togo,
just
on behalf of the member states of the African
mass
region, to take the
recruitment
floor,
of
followed by
health
Portugal.
workers, which comprise doctors, midwives,
Thank you, Madam
nurses
Moderator.
in line with its Human Resource Development Plan for the years 2020 to 28. All of
President,
these efforts are being carried out as part
Ministers,
of
Director
the
General
Social and
of
Economic
WHO,
Resilience Programme
ladies and
initiated
gentlemen,
by Mr.
Togo
Macky
is
Sall,
honoured to take
President
the
of the
floor,
Republic,
speaking on
in
behalf
order
of the
to mitigate
47
the
member
socioeconomic
states
impacts
of
the pandemic,
WHO in the
but
Africa
also
region. We would like
through our
to
multi-sectoral contingency
thank
plan to combat
the
COVID-19.
Independent Oversight
In
Advisory
addition,
Committee
Senegal
for the
launched
Health
a vaccination
Emergencies, the Review Committee on the functioning
against
of the
COVID-19
IHRs, as well as the
23rd of February
Independent Panel
2021,
on Pandemic
thanks to
Preparedness and
the acquisition
Response.
of
We
these
thank the chairs of all of
vaccines
those
using its
groups
own
for
resources.
their reports. We note the recommendations made and we eagerly await more in-depth analysis of what has been stated during the intersessional period.
First vaccines that have
As
been
for the
acquired by
report from the
Senegal are
IOAC,
Sinopharm vaccines.
we note the conclusions that
Despite
systems
the,
at local and
encouraging
global
results
levels
in
encounter
combating the
challenges
disease,
in
there are
managing the
significant
pandemic.
challenges that remain.
It is
I would like
stated that
to
health systems were
commend the
overwhelmed
surge of
and there was
international
disruption
solidarity which
to
is
access to health
underway
care.
and which is
That
enabling
being
a number
so,
of countries
we
to
believe that the recommendation to increase investment in resilient health systems and in
campaign.
universal health coverage is a very relevant one.
so that
While the pandemic is continuing to cause harm, what is critical is to save lives. in particular by guaranteeing just and equitable access to health products, including vaccines. We understand the challenges that have been encountered by the ACT Accelerator and the COVAX mechanism as emphasized in the IOAC report, and we also note the proposed actions. We welcome the fact that there is a need for international initiatives to be inclusive and to guarantee participation of all member states in design, implementation and funding. In the light of the above, we note the appeal from the IPPR that we should expand production capacity in all regions of the world, especially in developing countries. No one is safe until everyone is safe. With reference to the application of the IHRs, we note that there has been a drop in the transmission of annual reports from state parties, 165 in 2020 as opposed to 175 in 2019. However, we note progress in some of the 13 required capacities as well as the conduct of 24 simulation exercises. Other achievements have been noted too in terms of additional health measures. These relate to the focal points for IHRs at national level, entry points and vaccination against yellow fever. We also note the conclusions from the review committee that legal provisions that include certain shortcomings having an impact on the efficacy of coordinated response to the crisis need to be reconsidered, and therefore we support the proposal to revise the 2005 IHRs. In conclusion, the Africa Group believes that while it is indeed prudent to plan for the future, it is particularly important right now to continue to respond to the current pandemic, especially by grappling the issue of inequalities in access to medical products, including vaccines.
Thank you. Just as it has in the past. And we believe that fair access to life-saving vaccines, therapeutics and diagnostics is vital. As a leading donor to the Accelerator, to COVAX and to Gavi, we encourage all others to redouble their efforts to support these organisations. But much more than this, we need to see vaccines made available at cost. The UK government funded the research for the Oxford AstraZeneca vaccine, which is available at cost to the whole world. We believe that is the best way to vaccinate all. Already, this support has allowed 400 million doses to be deployed, two-thirds in lower and middle-income countries. We call upon other vaccine suppliers to follow the UK approach. After all, today is a decisive moment. It's a moment when we can use our unity of purpose to take the steps that we can really together bring about a healthier, safer and fairer world.
Of the national focal points and to develop universal periodic peer reviews. We also want to stress the importance of enhanced laboratory capacities for surveillance and sequencing. The COVID-19 pandemic also urges us to review our approach to preparedness. Indicators used to assess preparedness need to take into account, among other things, two key factors: the adaptability of health systems and the ability to address the socio-economic challenges.
We also thank the authors of the several evaluation reports submitted to this Assembly, which guide us to learn the lessons from this pandemic. And it's now time to take action
to publish information about outbreaks.
We expect that this World Health Assembly will adopt firm commitments for the renewal of the international system for pandemic preparedness and response, to build a stronger and more independent WHO, and to launch negotiations on a pandemic treaty, an initiative fully supported by Belgium to fill the gaps
COVID-19 pandemic also urges us to review our approach to precautionary measures. As pointed out by
Please
the
allow me to
IPPR,
stress 3
one should
points
assume
for
that an
these
emerging
discussions.
respiratory pathogen
First,
is
as
transmissible
no one
human
will
to
be
human
safe
until proven otherwise.
until everyone is
As
safe.
pointed out by the OAC,
International solidarity will
precautionary
be crucial
principle
to
in the
end this
implementation of
pandemic.
travel-related measures
Belgium
should allow for
supports
rapid action
COVAX
against
as well as a
emerging
seed
pathogen
initiative
with pandemic
launched
potential.
last year.
We urge the WHO
Together
Secretariat
with Costa
to
Rica
facilitate
and the other
discussions among
partners, we
experts on
call on
those
the global
issues and to
community
report
and
to
the
member
pharmaceutical
states.
industry
Finally,
to voluntarily
the
share
COVID-19 pandemic
knowledge and
shows us
intellectual
that while the
property
AHR provides
to
for
extend
preparedness and
our
alert,
vaccine
they are not
production
enough
capacities
for the nation
and
of
to
our global
offer
response.
faster and
The IHR
equitable
do not provide
access.
measures for rapid and equitable
Secondly,
delivery for life-saving
I want to
health
stress the
technologies.
crucial role
This is why
played
we are
by
committed
health
to work
workers
towards an
in this
international
pandemic.
treaty on pandemics that would complement
Our
the IHR.
appreciation
To
for
the chairs and
them
co-chairs
shouldn't
of the
limit
review
itself
panels,
to words.
we hear loud and
It should
clear
lead to
your message
improved
on the urgency
investment
to act now.
in the health
We want to
workforce.
avoid repeating the mistakes of the past.
Thirdly,
And the
we should
next
be
item,
cautious
a resolution on
not to
WHO
reduce
threatening
the
will be
WHO's
proposed for
mandate
adopting by the
to
WHO.
health security
This
alone
resolution
in wake of
is a
this
first
crisis.
important step in our collective
We
endeavor
cannot
to
ensure
draw all the
global
lessons
health
from the pandemic
without
and
strengthening
to
health
improve our
systems and
systems and
achieving
tools for
universal
prevention,
health
preparedness and
coverage.
response, and in short,
Without
to
fighting
build
against
back
inequities,
It
without
sets up
promoting human
a member
rights,
states working
including
group
sexual and
that will
reproductive
consider
health
each and every
rights.
recommendation you made.
We will never
ask you
prevent another
challenges
public
when you
health
started
crisis
your work.
without
Please allow us
adopting
now
a One
to
Health
challenge you
approach
on the
to
recommendations
fight
you made.
against
Thank you in advance for the
antimicrobial resistance
opportunity.
as
Thank you
well
so
as to
much.
tackle root causes of
Thank you,
pandemics,
Portugal. We
such
now
as climate
invite the United
change,
States of America to take the
deforestation,
floor, followed by
or
Norway.
intensive farming. Dear Dr. Tedros, we need a strong and independent WHO that can rise up to these challenges. Together, we can rebuild a fairer, safer, and healthier world. Thank you very much.
USA, you have the floor.
Thank you. We would now like to invite Cuba to be followed by Iraq.
It seems like the USA is not yet ready, so
Señora
we'll
Presidenta.
call on Norway
Madam
to
President.
take the floor, followed by Australia.
Mr. Director General, Excellencies,
I'm sorry. I'm so sorry. Can you
the
hear me now?
COVID-19 pandemic has generated
I apologize. I'm so sorry, everyone. I
crisis,
couldn't unmute myself. I'm
a
very,
crisis
very
that
sorry.
involves all sectors
I'm very sorry.
and
Thank
has
you
had
so
a
much.
terrible
This is
impact on the
Beth
Sustainable
Cameron speaking
Development
on behalf
Goals.
of the United
The
States
international
government. I'm
community
honored to be here
is
today. This World
complex,
Health Assembly may
and in
be
our
the
country,
most consequential convening
as
of
well as
this
other
body in our
places,
lifetimes.
cases
The global
are on the
pandemic
rise.
continues to upend the lives and livelihoods of millions, and we must all confront the fact that
Cuba,
still
the rollout
today,
of our
the
national
virus
program
is moving faster than we are.
to
Those gathered
limit
here have unmatched
COVID
experience
and
were
the
further
use
aided
of
by the wisdom and
fresh health
expertise
protocols
of the expert panels that
has
we just
allowed
heard
us
from.
to
So we
address
have no
a
shortfall
high
in
percentage
knowledge.
of the
We
people
made
that have been
considerable
infected,
progress in building the
which
capacity of
is
our
one of the
countries to prevent,
successes
detect,
of
and
our
respond
project.
to
We've
global health
developed
threats.
5
But
candidate
progress
vaccines,
is not enough to defeat
some of
a
them that are
virus
already
whose only fear
in
is our
advanced
success.
clinical trials.
The United States believes that
The results
even
we
as
have
we join
achieved
forces
to
to end
date
this
are
pandemic, we
hopeful.
must also, now and without fail, succeed in the united
Recently,
effort
we
to achieve
started
global health security.
interventions
On this, I'm sure
in
we
the
all
most
agree.
at-risk
But agreeing
parts of
upon
our
a goal
country,
is
and more than 1
relatively
million
easy. The
of our
harder work
population have
comes with
received
agreeing on a
some of
concrete
our
and tangible
candidate
plan
vaccines.
of action that commits us to take measurable steps to which we all agree
Bearing
to be
in
held
mind
accountable.
all these positive results,
We believe that our success rests in building a
70%
strong
of the
foundation
Cuban population
by
is
focusing squarely
already
and practically
vaccinated.
on 4 key imperatives. First, we must reform and
Once
modernize our
we have all the
existing
information
institutions to
that
render
is
them both
coming our way,
agile and fit
we'll be
for
able to
purpose.
provide further
And in doing
assistance
so, we
to
must
other
remember
countries.
that these institutions
Excellencies,
are only as strong as the commitments of their
The
members.
COVID-19 pandemic
Second,
has
we must secure
put a great
full
strain on
adherence to the
scientists,
norms that
health
enable
staff,
global health
governments,
security
and everyone.
consider the establishment of new norms as warranted and based on
On
what
top
we've
of
learned
the
from
health
this
challenges
pandemic.
of facing the virus,
Third, we must land the
there is
solution to global
the added
health security
burden
financing,
of the economic
and in
blockade,
particular, the financing
of which
for
my country is a
capacity
subject
building
for
that is
over 60
necessary
years,
to
which
ensure
limits
that all countries
our
can
access to the
prepare
necessary
for, but
tools
also prevent,
to combat
detect,
the
and
virus.
respond to the threats that we know are coming. We cannot depend solely on unpredictable flows of aid,
85% of the
as
products
this
that we
mission
use in our
requires
treatment
predictable
protocols
and
are now
sustainable
made
financing
in
over
Cuba.
time.
And this
Finally, and
means
fourth
that
are
our
the
national
enablers,
sovereignty
the principles which,
has
if
been
rendered
promoted.
actionable, will define our success or failure. These are oversight, transparency,
There are many actions
and
that try to discredit
Without these, we can offer up
our
the right
successes,
words and
but we've managed to help over 40 countries,
but we can't
and
fully
57 of our health brigades have gone to these countries,
commitment, resources,
which represent
and most
over
importantly,
28,000 health
political
staff
capital.
providing
the United
support.
States is prepared to do the hard work required of all of us, and we look forward to working with this body and its members to achieve the unity of purpose that can
The
protect
current situation
our friends,
has laid
our
bare
families,
the
our
need we have to
communities,
strengthen our
countries,
healthcare systems
and
to focus on primary healthcare. We need to have a broad scope that promotes the health of all.
Thank you, USA. We now invite
We are part
Norway to
of an
take the floor,
interlinked
followed
world,
by Australia.
and we need to have a broad focus. Only joint measures by governments and peoples in a spirit of solidarity and cooperation can guarantee our success in this battle.
Thank you, Chair.
Thank you.
Thank you.
The COVID-19 has demonstrated clearly how unprepared we all were for a global outbreak.
السيد رئيس جمعية الصحة العالمية الدورة الرابعة.
Despite lessons from earlier outbreaks, we failed to prepare and respond sufficiently to prevent the devastating effects the pandemic had on individuals, on societies, and on the global community. We knew the risks.
At the outset, I'd like to thank WHO for all the efforts made.
We also know that this will happen again.
Especially with respect to how countries could face the COVID-19 pandemic.
There will be other pathogens like the SARS-CoV.
In my country, the government has rolled out preventive measures from the beginning of the crisis so that we could control the spread of this virus and contain its negative effects on our health system and on the health of our people. Obviously, we've taken all pertinent measures to reduce its spread. For example, we've set up high-level committees so as to manage this crisis.
To establishing lasting commitments.
These committees have made different decisions, such as banning travel to countries where the virus was spreading. We've also imposed quarantines on all those who worked in government bodies,
in particular for their bold
and we've banned assemblies.
The sum of recommendations
These are just a few examples.
by the independent panel.
We've also incorporated distance learning in schools, universities, and we've closed all places of worship, as well as cultural venues, so as to limit the spread.
The need for a multi-sectorial and whole-of-government approach to preparedness
and this is how we faced increasing numbers. We've expanded the capacity of our hospitals and also increased the number of respirators and hospital beds in emergency care units. We've also strengthened our lab capacity. We have now more than
if we do not act,
70 labs up and running. We've purchased PPE as well as the necessary components to promote treatment. This has allowed us to continue to contain this epidemic during the second wave.
Here,
government started working early on with companies that produce the vaccine
and later supported by Guyana,
get our share.
Moldova, Montenegro,
we signed an agreement
Paraguay,
with the COVAX facility so as to be able to vaccinate 20% of our citizens. We've also multiplied our channels of communication with the companies who produce vaccines so as to get extra doses for the most vulnerable.
These measures. Thank you, Chair.
Thank you.
We've also set up vaccination centers for specific targeted categories. This pandemic has laid bare how small our world is and how interconnected we are, and that nobody is safe. And therefore I appeal to the international community and WHO to work on that basis, on the principle of solidarity and cooperation, so as to strengthen all of our capacities so that we can face this crisis and the crises to come, and to improve health technology.
Preparedness and management of the pandemic must be heeded. We're heartened by the ambitious and decisive actions which are recommended. We support this
Honourable President, Director General, Excellencies, ladies and gentlemen, Romania fully aligns itself with the European Union statement delivered by Portugal. A year ago, we were meeting in a virtual format for the first time, due to the limitation created by COVID-19. That reunion was marked by our engagement to work together to fight the spread of the new virus. We have mobilized, but still the pandemic has taken a heavy toll,
including country-level capacity.
This year we have something new. We have a hope that has become a reality. Through science and hard work, we are now able to see an end to this ordeal. We are now out of the danger yet, but the safe and the efficient vaccines created in a very short lapse of time are fundamental to regaining a certain normalcy. We should use this opportunity to build back, and to build back better. I would like to thank the WHO for the steadfast engagement and support. Together we have managed to better articulate our actions in countering the pandemic. We now need to continue our common actions to ensure a better preparedness and response on all levels for the changes of future pandemics. The COVID-19 pandemic has humbled us and has shown the flaws in our preparedness and responses. It has been a hard lesson, and we have paid a very heavy price learning it. We have to make sure that such catastrophe will not repeat itself. We need to be better prepared to anticipate and react to emerging public health threats. And we need to make sure that our citizens understand the importance of this approach and gain support and engagement in a collective effort. Only a consolidated whole-of-society approach will allow us to move forward and act to counter the challenges to come. And we know that there will be new challenges. We need to prepare. We need to provide ourselves with the means and instruments that will allow us to prevent, but also to face, if when necessary, future pandemics. Build back stronger should not ignore our relationships with the environment. And we must not forget that almost all the pandemics that have affected humanity and most of the emerging diseases have an animal pathogen origin. Our actions have created an unhealthy relationship with the environment through climate change, but also by reducing the natural habitats for many species and thus reducing biodiversity. The climate changes play a fundamental role in altering the pattern for some seasonal diseases, impacting the ecology and increasing the risk for new infectious diseases. We have to rethink our approach, and we need to have a green build back. This could even be presented as a real preventive measure. Thank you.
WHO. Many thanks.
Thank you, Romania. We now invite Honduras to take the floor.
I now invite the Republic of Korea to take the floor, followed by the Russian Federation.
Honorable señor presidente.
Thank you, Chair. The Republic
Madam
of
President,
Korea government
distinguished Director General of the World Health Organization, Dr. Clarissa Ken, Director of the Pan American Health Organization, distinguished Ministers of Health, distinguished delegates. It's an honor and a privilege to speak to you as the Minister of Health of Honduras. I am deeply moved after over a year since Honduras notified the first cases of COVID. And now, just like the rest of the planet, we continue to face this pandemic. And now cases are increasing due to the variants that circulate in our country. Madam President, during the last World Health Assembly, we argued to promote research and the distribution of vaccines, and obviously much has been achieved. However, distribution has been uneven and limited. We salute the noble behavior of other countries that have shared vaccines with us. Also, we commend PAHO for all its work. However, what we need is a worldwide commitment and to honor the vision behind COVAX to distribute the vaccine fairly in order to save lives. Honduras is still working to contain the disease, and our path has not been easy. We continue to provide the essential health services that our population requires. We wish to emphasize that in the face of the COVID-19 pandemic and the emergence of new variants, we need to applaud those who have managed to move forward in other areas of public health. That is why we presented to the director of the WHO the appeal to include the Republic of China, Taiwan in this August Assembly, as occurred in the past before 2017. We ask that they be accepted as an observer and that their valuable experiences be borne in mind so that we can move forward facing these current challenges.
Virus is still replicating itself.
Madam President, we urge this Assembly to uphold principles of solidarity, cooperation for the health of our people. We wish to reiterate our urgent appeal that all countries that have not had open access to vaccines be provided with these spaces, these tools to be able to mitigate the negative effects of the crisis. Nobody will be safe until everybody is safe. Thank you very much.
We thank you, and now invite St. Lucia to take the floor, to be followed by Fiji.
In the process, we are
Mary Isaac, Minister of Health and Wellness, St. Lucia.
Is trying to compromise.
The government of St. Lucia applauds the findings in the consolidated report by the Director General regarding the 1 billion more people benefiting from universal health coverage. The Immunization Agenda 2030 is critical in the control of vaccine-preventable diseases as it builds the framework to tackle key issues related to immunization within the primary health care and universal health care coverage. COVID-19 presents an opportunity to reset and accelerate the approach to immunization. St. Lucia recognizes the valuable contributions of the Access to COVID-19 Tools Accelerator and the COVAX facility, and we are thankful for the ability to vaccinate our people against COVID-19. However, there is need to accelerate the delivery of vaccines to some low and middle-income countries, as no country is safe until each country is free from COVID-19. Accelerating COVID-19 vaccination coverage remains a challenge, considering
the pandemic is not over. Nonetheless, we can already conclude that countries with strong health and epidemiological services have clear advantages over others. From the very start, Russia has taken a proactive approach, and this has made it possible for us to tackle COVID-19 successfully, to prevent exponential growth of the disease, and to save many lives. We commend the central and coordinating role played by WHO in resolving the global challenges thrown up by the pandemic. We are grateful for the reports that have been submitted. However, not all of the conclusions and recommendations are, in fact, fully in line with an accurate analysis of the situation. Here we have to look, for instance, at the efforts to move responsibility for response from a national level to WHO. We emphasize that WHO is responsible for a number of things, for providing reliable information and giving help when it is needed to countries with weak health systems. And this indeed is something that allows countries to cope with the epidemic. However, in countries that have developed systems, they do not need official declarations of a pandemic. Such countries are able themselves to take appropriately tailored decisions which can allow them to protect the public health of their persons. We think that it is clearly important to enhance the role of the national focal points for IHRs, to develop national capacity, laboratory infrastructure, to support laboratory networks with the ongoing support of WHO. We also need to ensure that we are able to combat unreliable information and to guarantee biological security. Russia has knowledge in these areas and a wealth of experience, and we have given and will continue to give support to WHO and to interested countries in the aforementioned areas. That being so, we recognize the importance of international cooperation, and we recognize what has been done particularly with WHO and the GOARN. Russia has done a great deal. We have participated in 18 missions. We have provided millions of tests, PPE, laboratory and medical infrastructure and equipment, mobile laboratories and training when required. We were indeed the first country in the world to develop a vaccine, and we now have many products available that we can make available to others. We have developed them using 3 different platforms. However, we do feel that some of the conclusions that have been reached in these reports and in these recommendations are not entirely correct. For instance, we think when it comes to complying with the IHRs, here we have to recognize that it is not acceptable to propose that unverified information on outbreaks of the infection be disseminated. Also, it is not appropriate to create any kind of parallel structures or informal interaction with member states. We think that kind of approach would merely weaken the WHO. Let me emphasize again, we believe that it is not appropriate for us to do anything that would in any way endanger biological security, and that is the basis for our stance on these issues. We also believe that when it comes to external joint evaluation, there is no evidence to confirm that countries that did undergo that evaluation were able to cope with the pandemic better than others. And indeed, the Global Health Security Index has shown its failings in the light of what has happened. We wish to emphasize, however, that the pandemic is not yet over. There is still a great deal to be done, and only once COVID has been defeated will it be appropriate for us to consider fundamental changes to the way WHO works and new treaties or conventions. We must understand why the instruments we have are not working. Is the problem with the instruments themselves or the way that they are being used? Only a multifaceted analysis involving all states could allow us to draw conclusions of that and to develop a future health architecture. We are grateful to all member states and to the Secretariat for the fruitful work done and the efforts to find consensus decisions in the course of discussions on a draft on strengthening WHO preparedness for and response to health emergencies. Thank you.
I now invite Bahrain to take the floor, followed by France.
Greater emphasis must be placed on primary health care as a more effective strategy to help us to achieve our goals of preventing a pandemic and building a healthier and safer world. In the spirit of our theme, this August budget should review its position on the participation of the Republic of China
Thank you for giving this opportunity
at the World Health Assembly. There is simply no principled basis to justify the continued exclusion of Taiwan
17.
from this forum, given its long history
we confirm that COVID-19 has demonstrated the challenges we face and the weaknesses in preparedness and response, and the great inequalities between countries.
In the true spirit of international
solidarity, all of the tremendous efforts that have been made at international, regional and national levels to try to respond to this crisis. We've taken note of the findings and recommendations concerning the response to COVID-19 in the various reports. And we've taken note of the need to strengthen national research capacities and capacities for the exchange of information. But we still think that we need to modernize healthcare systems and enhance research and development capacities in order to rise to these challenges more effectively. We also need to strengthen and scale up vaccination campaigns. Turning now to the report by the IPPPR, we read about the failures and gaps in the system, and we've taken note of them. With regard to gaps in national preparedness and response capacities, we have also seen some positive responses, thanks to the lessons learned from previous crises. In that context, we do believe that we need to take these recommendations very seriously in order to improve preparedness and response in the future. We call on all member states to support the organization's efforts to implement these recommendations. On the 9th report of the review committee on the IHR, we've taken note of the weaknesses identified at international level and the weaknesses in implementing the IHR more generally. This is a major problem, and what really needs to be done is to strengthen the implementation system for the IHR. Madam Chair, all responses must be based on national core capacities, and that's why they must be strengthened further. We also need to have a mechanism for capacity building in this regard. Turning now to the response to health emergencies and strengthening of the IHR, we think what needs to be done is to promote preparedness for health emergencies and strengthen WHO's role so that it can play this leadership role. We support its role in issuing recommendations and playing that leadership role, and we support them. We've, on our part, established national plans, and we've given our commitment to full implementation of the IHR and improve our international cooperation.
We now would like to go back to Fiji, to be followed by...
We need to strengthen our capacities, in particular, in combating diseases of animal origin.
The President of the World Health Assembly.
Finally,
Director General of the World Health Organization,
to thank
Excellencies, distinguished guests.
All of the
Fiji welcomes the Director General's report,
notes
the continued progress on many fronts in addressing global health issues and reaffirms its commitment to WHO's efforts in this regard.
Thank you, Madam President. Madam President, France defends multilateralism.
Going beyond a health crisis,
it is important, it is vital that each and every one of us works flat out and without any hidden agenda for the good of global public health here within the WHO and within its various fora. The international community needs to benefit from the experience of all in tackling the COVID-19 pandemic, because health is a matter for all of us. We can't have a two-tier global health system. Strengthening the multilateral health architecture with WHO at its heart is the best way forward, and it's something that we cannot wait for any longer. We also need better implementation of the IHRs. We need to act now to strengthen our preparedness and response to health emergencies. And that is what is behind the resolution put forward by the EU on strengthening the role of WHO in the light of health emergencies. We must also learn lessons from the current crisis, and we must do that right now by taking into account the recommendations from the various reports submitted to this WHA. We wish to commend the work done by the IPPR. The work done allows us to understand better how to organize the international response to the crisis, and also allows us in the medium and longer term to guide the direction taken by the international community in that regard. France supports the idea that underpins these proposed recommendations, and we are ready to discuss them in greater detail in future, particularly those relating to governance and funding. France also commends the work done by the IOAC. We recognize that the work done by this committee is particularly valuable, and we share its conclusions, particularly with reference to the need to improve the alert system for health emergencies, and also with the need to have a sound funding mechanism. That being so, France is participating in a pilot phase of a universal review mechanism alongside a number of African countries as well as Germany. We also welcome the work done by the IHR Review Committee. This work emphasizes, for instance, the importance of strengthening laboratory capacity, and as you well know, the WHO office in Lyon makes a significant contribution to that work. Thanks to the review that has been conducted, Madam President, we now have a set of proposals before us, and we need, without further ado, to put them into practice. challenges together. France will participate fully in the work done within the working group on this topic, the group established by the resolution that was put forward by the EU. What is at stake is our health, our security, and our common prosperity. Further, a treaty on pandemics that would strengthen the IHRs could also be the result of the reform that we wish to see. Thank you for your kind attention.
Thank you, France. I now invite Monaco to take the floor, followed by New Zealand.
Vanuatu, can you hear us?
Thank you, Madam Moderator. Madam President, Monaco wishes to thank wholeheartedly the IPPR, the IOAC, and the Review Committee on the IHRs. We thank them for the work done. We wish to emphasize the extraordinary job of work that has been done, and also the very high quality of the information now available to us. Now, it appears necessary for us to take some time to analyze in depth all of these documents, to explore the options we now have available. We need to do that in order to learn lessons from the COVID-19 pandemic and to be prepared as well as possible for possible future pandemics. COVID-19 has highlighted shortcomings within member states and WHO in pandemic preparedness and response. It has also shown the need for profound change to take place in the way that we operate collectively. We wish to support the adoption of the draft resolutions and draft decisions before us, and we wish to co-sponsor them. We can assure you of our active and constructive participation within the working group on pandemic preparedness and response that will look at the findings and the recommendations from the IPPR, IOAC, and the IHR Review Committee. Thank you.
Thank you, Monaco.
I also want to thank Dr. Ahmed Bessaled, Regional Director for the EMRO WHO region.
Chair,
I want to thank him for his effective contribution in the regional fight against the virus.
Supports the findings and recommendations of the International Health Regulations,
express my support for the theme of this session. It's of interest to all of us to put an end to the pandemic and obviously to assure
to which we would add solidarity and equity as guiding principles.
A life filled with dignity in all stages. We should all benefit from good health.
By WHO of Article 11, the standardization of post-emergency committee director general
the pandemic has had consequences in many spheres, economic, social, and so forth. And therefore, we all need to redouble our efforts to work together. Madam President, esteemed delegates, to conclude, I want to once again pay homage to all the efforts made by brother and friend countries as well as UN agencies located in Tunisia that have helped us improve our capacities.
A point which New Zealand strongly
I want to express the gratitude of my country for the constant support that you've provided during this sensitive
It is clear that taking forward an ambitious program of change and improvement will require.
And from here, I just want to express once again our most heartfelt gratitude.
New Zealand urges all concerned in Geneva and New York and in capitals
I would also like to mention the health situation in Palestine pursuant to Israel's aggression. We believe that WHO is the pioneer organization in the subject matter. Specific measures need to be taken to help the Palestinian people, these brothers, to reduce their suffering, and so that they can benefit from medical assistance as well as access to the vaccine against the virus. My country commits itself to working on the international level to promote the goals of health, and we'll do this in a very concrete way because Tunisia will be part of WHO's EB. Thank you for your attention.
The pandemic, looking forward to a better world.
Thank you, Tunisia.
We note the panel's urgent call for countries to expand their funding for the ACT Accelerator to help ensure equitable availability of vaccines, diagnostics, therapeutics,
ladies and gentlemen, here we are for the second year meeting virtually again instead of seeing each other in person. I hope all of you would share my sentiment in hoping for this to be the last virtual WHA. I went through the agenda of the Assembly this year, and I commend the Secretariat's efforts to sustain the normative work of the organization.
to ensure there is no
the global community is waiting to see or hear at least of an end to this pandemic.
6 countries in the Pacific.
Mr. Chairperson, we have evidently made progress in understanding this pandemic's nature and root causes, identifying some measures for its prevention, managing its spread and parts of its effects, and developing a bank of knowledge, lessons about it. But this is not enough. The pandemic is still taking too many lives and must be brought to an end very soon. In Oman, through global cooperation to achieve stronger health institutions,
it is critical that no doses
for
go
human
to waste.
security and peace, stemming from our strong belief in this principle. We hosted in cooperation with the WHO and the UN Secretariat a meeting to call for health, security and peace in the Eastern Mediterranean region, where we were pleased to have reaffirmed our regional commitment with partners from across the globe to expand in cooperation in health, especially within the context of COVID-19, as a tool to harbour international solidarity, stability and peace. And in a similar vein, I am pleased to inform you that Oman, in cooperation with Switzerland, has submitted a Global Health for Peace initiative to the WHO, which will be discussed in January during the Executive Board meeting. I appeal to everyone to join that initiative. Additionally, Oman participated in June last year in the launching of Coalition for a Universal Health Protection Architecture, which calls for a multilateral cooperation approach to protect everyone's health anywhere and at any time. Mr. Chairman,
it is my honor to speak on behalf of the Kingdom of the Netherlands, and we align ourselves with the State of Portugal on behalf of the European Union. Allow me to convey our condolences for all lives lost and express our deepest appreciation for the healthcare workers around the world.
With a phrase used by the Director General last Assembly.
The evaluation panels have spoken and call for immediate, collective and decisive action on pandemic preparedness. The Netherlands stands ready to contribute to implement their recommendations. Advancing their recommendations requires our collective commitment to firstly, a better and independently positioned WHO for more predictable and sustainable
Director
funds.
General of the World Health Organization,
Secondly,
ladies and gentlemen,
national health systems need to be strengthened and the IHR implemented.
On behalf of
Vulnerable
Jordan
countries
at the
should be
74th session
on the
of the World
international
Health
community.
Assembly,
This starts with vaccine availability and initiatives to scale up global production and distribution.
Now we can
the
see
Netherlands
light
is
at
in
the end of the
favor
tunnel
of strengthening
when it comes
local
to this
production
pandemic.
capacity around the globe and will make a substantial batch of vaccines available.
We need
Thirdly,
to be
commitment
prepared
at the highest political level,
all
both
threats
for the short and the long term.
which may
An international
cause problems
framework
in the
on
future.
pandemic
We have been able to
preparedness
take into
would
consideration
enable us,
new
member states,
diseases,
to
new
ensure we
pandemics,
remain
new epidemics,
focused,
and we have
determined,
taken
and raise the
all
alarm if
necessary
too little
measures
progress is
to
being made worldwide.
respond and prepare
Our global
ourselves
health
for this
infrastructure
rapidly, and we
relies
have
on our
carried out
capacities
research and
to
innovation
prevent,
in order
detect, and respond to health emergencies. Worldwide
able to,
digital systems in order to immediately share reliable
be prepared
information
nationally
should be established.
so that we can
And with the health of
face
human
all of
beings,
the challenges
animals,
that we
and
may
the
have to
environment
deal
so
with in the
closely
future. We
linked,
need to strengthen
we
all
should
of our
all
structures.
realize that a One
For a long
Health
time, we've
perspective
known that
in the
preparedness
prevention
and
and
response
detection
in a
of zoonotic
coordinated manner is very
pathogens
important
is key.
as regards health
The Secretariat
emergencies.
to follow up on the report on the risks of wet markets and discuss
this is the
with
same
member
for all
states
emergencies
on the
that take
next
place in life.
steps
We need
reducing
to
zoonotic health
review what
risks
we have done in the
associated with
past
these markets.
in order to be able to
Finally,
improve our plans for the future.
Phase 2 of SARS-CoV to start
When we review what we have done
and we
with
request
this pandemic, we will be
to
able
brief
to
us and
review all of our weak spots as well as the successes that we have recorded so that we can improve our preparedness in the
to
future.
overcome the current health
We have had
crisis
to
and
adapt
building a
ourselves to a
healthier,
new
safer,
lifestyle.
and fairer
We
world
have
for us all.
used
Thank you.
technologies which have changed
Thank you, the
our
Netherlands.
methods
I
of
now invite Saudi
studying, of
Arabia to take the
living,
floor, followed by Sri Lanka.
and this means that we have been able to meet in virtual conferences, and we have also been able to work remotely. And this is a new means of working, and this will perhaps continue after the pandemic. These dramatic changes in our conduct and behavior due to COVID-19 are going to lead to new strategies that we will have to improve upon in order to deal with future pandemics. And during the meetings of this session, I hope that we will be able to develop some recommendations to combat this pandemic. Thank you.
We need to ensure that this pandemic is the last.
I now invite Tonga to take the floor, please.
As the IPPC has said, and we need to work to ensure that we implement all of these recommendations, including those regarding the strengthening of preparedness and response and the full implementation of public health measures.
Thank you.
Mr. President,
to continue with
Director General,
dialogue on health
Excellencies.
We need to strengthen
this global pandemic has revealed profound weakness
come up with
in
the
healthcare systems
solutions.
Around the world.
Some of the recommendations are extremely
While COVID-19 has spread worldwide,
public health
the impacts on poor
in particular
and vulnerable individuals
preparedness
and
for public health
communities
emergencies,
have been
and we need to do this worldwide.
disproportionate and will require deeper consideration and targeted solutions
protect
to address these unique
from the
circumstances.
risk of pandemics. And
the Marshall Islands continues to take measures in strengthening our health infrastructure through the help and support of our partners. We join the WHO in the effort to eliminate multiple diseases within our borders, in battling in disease, and to ensure the safety
in fact, there are a
of
number
generations
of
to come.
the IHR, which
We encourage the WHO and the international system to continue to strengthen specific approaches
mechanisms
on
under the
public
IHR,
health responses.
which already exist.
As the Marshall Islands extends its border closer this month, we continue to
create
and implement our repatriation program for essential travel.
Better
However, there is still much more work to be done at the national, regional, and international level. The Marshall Islands reiterates its call for urgent and robust international and bilateral cooperation to ensure equitable distribution of safe and effective COVID-19 vaccines to all, including to the most remote populations in the Pacific and all regions of the world.
The WHO, so that it can play its role.
Virus knows no borders. The Marshall Islands also joins other nations calling
we must ensure that the WHO
for
has
Taiwan's
the necessary
participation at the WHO
to carry out
and in
its vital
WHO activities.
mandate.
Therefore, and inclusively, every nation, including Taiwan, has an opportunity to voice and support our fight against current and future pandemics that may threaten our global health and security.
Variants.
Mr. President,
we are facing
in the wake
challenges
of this global pandemic,
the access to
let us build
vaccines,
back better.
politicization of
all states
the crisis
should give serious consideration
and that's why
to the WHO manifesto
learn from the
for a
lessons
healthy and clean recovery from COVID-19.
Thank you very much, Saudi Arabia. I now invite Sri Lanka.
As an atoll nation, the Marshall Islands is on the front line of another global crisis in climate change. We therefore strongly encourage the further strengthening of the WHO critical work on climate change and for all countries, polarization of full climate action as an opportunity to improve public health. Let us continue to live up to WHO's creed in which all world citizens can live healthy, productive lives by putting people first and encouraging all countries. Thank you and Kamol Tata.
joint external evaluation in 2017 with the involvement of health, non-health sectors and WHO. With the recommendations of WHO, stakeholders prepared the National Action Plan for Health Security 2019-2023.
Director General,
we are in the process of
Madam
incorporating the functions of four national focal points into the Quarantine and Disease Prevention Act as approved by the Cabinet
World
of
Health Organization for its leadership
This will be done with the
and its
assistance of
commitment
Legal
in
Draftsman
organising
Department
this
of
historic
Ministry of
World Health
Justice.
Assembly. And we are
Quarantine unit
experiencing
shares
a global
events
crisis due to the
notified at
COVID-19
event
pandemic.
information site
This
with the
pandemic
other stakeholders.
is a mirror
Simulation exercises were conducted and desktop simulation was conducted
in
on
which all
chemical
of us,
emergency at the port.
societies,
Health
governments,
staff, including the
international
staff of
communities,
the
we have
health
seen
officers
our
at
own
points of entry,
reflection,
were trained on
a reflection that has
CBRNE
stressed our
in
weaknesses.
2019. State Party Annual Reporting Tool 2020 was filled and uploaded to the WHO site. Scores increased from 54% in 2019 to 62% in 2020.
Showed that we need collective solutions in order to overcome difficulties. This crisis has obliged us to understand that no person or no country is safe unless all human beings are safe. Now, more than ever, we need to work together
on health response to COVID-19
based on the principles of multilateralism and solidarity under the aegis of the organization, and we must not leave anyone behind. These vaccines that we have created are a glimmer of hope. They have been prepared in record time.
Has identified the importance of COVID-19 vaccination while adhering to other preventive measures.
Vaccines need to be available
three types of
quickly
COVID-19 vaccines
and accessible to everyone. And for the time being, the response of the international community has been ineffective. Economic and political preferences have prevailed over the well-being of populations. This nationalism and individualism and protectionism, these are the things that have prevailed. And in terms of preparedness and response to the COVID-19 pandemic, the government of the Dominican Republic has been able to vaccinate
I now invite Cambodia to take the floor,
33% of its population. They have received their first dose, and this has been carried out thanks to collaboration with the public and private health,
Cambodia, you
public
have the
and
floor.
private sectors. And we have a number, over 1,000 a number of vaccination centers, and we would like to thank other countries for the collaboration, which has been very fruitful, which has helped us to create our own vaccination plan, and we thank developed countries, and they must continue to collaborate with us in terms of their experience in vaccinations. The Dominican Republic, as a developing country,
the Kingdom of Cambodia welcomes all the review
defends the principle of multilateralism, and in this regard, Madam President, we would like to recall on behalf of the government of the Dominican Republic that we are grateful to the Director General of the WHO, and we'd also particularly like to thank the Regional Office of the Americas for the work that they have carried out, which has enabled us to get out of this crisis effectively. And we'd also like to thank all of the stakeholders. We would like to show our solidarity with all peoples across the world who have been impacted by this pandemic, and we are committed to fighting against this pandemic so that we are all safe and so that we can return to normality. Thank you.
By the Ministry of Health will be the core elements in controlling the spread of the virus. Investment in pandemic preparedness and overall health system for future healthier population mean investment in the economy. Health and the economy can go hand in hand. Strengthen and improve the core capacity, but not limited to disease surveillance, monitoring and evaluation, especially human resources to be equipped with knowledge and means for public health emergency management.
The World Health Organization
Second,
General Assembly.
for the
Mr. Director
WHO,
General of the
as
WHO,
a technical agency with strong technical leadership, as a coordinator in health-related response,
for the second year in a
shall
row, we are
provide more
holding our World
support
Health
and
Assembly
assist member
meetings while we are
states
still
in
combating
pandemic
the
preparedness and
COVID-19
response.
pandemic and its significant
Resource
global
mobilization
repercussions on
and
various
coordination
aspects
in
of
health
life.
sector among
pandemic has
partners
clearly
will assist
demonstrated
the
that
country
health security
in
is a joint
implementing the
responsibility
Vardhan plan
and essential
and
to
shape
achieving
the
the goals
way
of
of
sustainable
immediate
development.
responding
Under
to
the wise
pandemic
leadership
in the
of His
right
Highness Sheikh
direction.
Tamim bin Hamad Al
More
Thani, Emir of the
investment
State of
in
Qatar,
WHO,
Qatar is
including
supporting
human
the
and
efforts of
financial
countries and
resources,
organizations.
is much needed
Qatar has
to
funded
help the
dozens of
country
countries in
to end
support
the
of their
pandemic
efforts in the
and
fight against the
preparing for the
pandemic.
future
It
public
has
health
allocated
emergency.
$20 million
Third, for the
to
global
the Global
level,
Alliance for
we must
Vaccination
work
and
for the
Immunization,
future
and more
and
recently
be
Qatar
ahead of the
signed a
curve
$10 million
in
core
anticipating and
contribution
addressing
agreement
future
with
challenges.
WHO to support
Solidarity
WHO's
and
13th
cooperation are a
General
must in
Program of
sharing
Work and the
information,
initiative of
technology,
accelerating
and when
access
it comes
to
to health
COVID-19
security
tools in
threats.
countries most in need.
IHR shall be
Your
implemented
Excellencies,
in
ladies
real
and gentlemen,
and
Qatar has
appropriate
developed
manner.
a comprehensive
Further
strategy
review to
to
fulfill
protect
any
its
gaps
population from the
with
risk of the
improvement of
COVID-19
capacity
pandemic.
for
We
assist
understood
countries with
early
resource
on
limited.
that a whole
How to
government
make the
approach, strong
resilient health
national
system
governance, reliance
to
on
be
science
in
and facts, and the
reality
engagement
and be
of the
defined
general public are
appropriately in
essential.
accordance
Our high-quality health system,
the
which is
country
based on universal
context.
health coverage,
More
has put in
resources
place
in
strong
health
emergency
are
preparedness and resilience
inevitable
plans and reacted
if
to
we
this
want
challenge
to a
with
safer and
determination and
healthier world.
commitment. Although facing
Equitable
very
access
intensive
to
epidemic
vaccine
waves,
help
we
to
have been
save
able to
life for
contain
people
mortality
around
to
the
very
globe.
low levels.
In brief,
Our
Cambodia
national
supports the sustainable
COVID-19
investment
vaccination
and
program,
political
which
leadership,
prioritized
the
our
functioning
elderly
of
and
the
other high-risk
IHR,
categories
and
of
the
the
technical
population,
leadership
is
role of
proceeding at an
WHO in
accelerated
pandemic
pace,
preparedness
and well
and
over
response.
50% of
Thank you
Qatar's
very
adult
much for your
population
kind
has received
attention.
at least one dose of the
Thank you,
COVID-19
Cambodia.
vaccine.
I now invite
As new
Kenya
variants
to take the
continue to
floor,
emerge,
followed by
vaccine
Mexico.
and treatment developments as well as scientific collaborations are essential. Throughout the course of the pandemic, our response, our decisions and choices have been guided by science. In a number of cases, we have applied innovative decisions in the control of the epidemic in anticipation of international practices and protocols. In addition, our scientists have contributed to a better understanding of the pandemic at an international level. A number of scientific researches carried out thanks to our extensive database of electronic medical records have been undertaken and published in prestigious international journals, ranging, for example, from the effectiveness of the vaccine against variants to the duration of the immunity. Your Excellencies, ladies and gentlemen, during these difficult times, health systems must not be weakened or threatened. We call on the WHO and the international community to support the health emergency in Palestine so that the Palestinians can receive the needed health services and provide aids and supplies. In conclusion, COVID-19 has been an unprecedented challenge for all countries. We all have confronted the pandemic with commitment, making choices and learning along the way. It is our global responsibility to do everything we can to prevent the next pandemic and manage it better than we have done this time. For this reason, Qatar welcomes the conclusion and recommendations of the Independent Panel for Pandemic Preparedness and Response and looks forward to the process of finalizing its review, especially clarifying the roles and responsibilities of the different stakeholders to ensure that the necessary changes and measures highlighted are implemented. Together we have faced the pandemic, and together we will get out of it and ensure we avoid future crises. Thank you.
We thank you, Qatar. We now would like to invite Chad, please, to take the floor.
And the IOAC for
Monsieur le Président de l'Assemblée,
Madam President, for member states,
Secretary General of the United Nations, heads of states and government, Director General of the WHO, I would like to thank you for the opportunity that you have given me to speak at the 74th World Health Assembly at a moment when my country, Chad, has lost our own president.
Only then will we be able to make meaningful adjustments towards a safer
we would like
future. The world must indeed
say that since the first confirmed case of COVID in
Thank you, Kenya.
Our country, we have taken
now invite
health
Mexico
measures
to take the floor, followed by the United
together
Kingdom.
with the support from the World Health Organization. We've taken a number of measures, and
thank you.
We have
Mexico is grateful for the reports
cases
submitted, and we would like to thank the experts on the 3 panels for their efforts in completing their work in timely fashion. We've taken note of their findings and recommendations. My delegation agrees with the Director General and the panel experts about the seriousness of the crisis triggered by the coronavirus 2 virus and what this means for member states. And that is that we need to consider urgent, immediate and substantive changes, both at national and international level, to avoid health emergencies of this nature happening again. We will therefore participate constructively in the work of the working group, carrying out an analysis of the recommendations, including a roadmap proposed by the IPPPR for its future implementation. My country has always maintained in this forum that we need to strengthen international preparedness and response for health emergencies. And along with a group of countries, we submitted a number of specific proposals on how to improve implementation of the IHR. They include the creation of a mechanism for the periodic review of implementation of the IHR and the review of the criteria for core national capacities for preparedness. In particular, one of the key lessons that we've drawn from this crisis is that we do have valuable instruments such as the IHR, but the political will to implement them remains weak. If we don't recognize this key failure to respect our international obligations, if we don't address this tremendous failure in a practical way, we run the risk of committing the same mistakes again in the next emergency. Well, there are areas in which we need and we can move forward quickly to strengthen the WHO and the international system. We must remain careful when we adopt measures to set the basis for responding to future emergencies. We recognize the relevance of the need to maintain this political momentum and avoid a new cycle of panic and negligence. However, we are concerned by the speed of adopting any decisions, given the fact that a large part of the world remains in a fight against the pandemic. And this might affect the quality and inclusivity of the process of decision-making, and at the end of the day, the legitimacy of any decisions taken. The future will depend on agreements that we will strike on a whole list of issues not restricted to health, which include international trade, research and development, human rights, scientific cooperation, and equitable and timely access to the relevant technologies and products. Rhetoric is not enough. Mexico is prepared to move forward if the necessary conditions are in place and if the membership is ready to assume new commitments. And we support the resolution on strengthening the WHO presented by the European Union and the decision of the Group of Friends for a framework convention on pandemics. We believe that both of these decisions move us in the right direction. We recognize the leadership of the proponents.
More precisely, it has caused significant
President, the panels have completed their mandate. Therefore, it's now up to the member states to learn from the lessons drawn and maintain the political momentum to continue to strengthen the WHO. It is up to us now. Thank you.
Thank you, Mexico. I now call on the United Kingdom to take the floor, followed by Botswana.
It is, however, a fragile dawn with transmission and death rates still high.
To the chairs of the panel for pandemic preparedness and response, the IHR Review Committee, and the Independent Oversight and Advisory Committee for their updates to the Assembly. This is our second May World Health Assembly under the shadow of the COVID-19 pandemic.
At the same time,
over the past year, we have seen that the existing global health structures are not robust enough to hold back global health threat caused by a novel, highly transmissible disease of unknown origin. We have been active in discussing and identifying changes that should be made to better prevent, prepare for and respond to future pandemics, and ensure an inclusive international system that works for all. These ambitious and comprehensive reviews are a crucial element of these improvements. The UK is pleased that the reports have highlighted several key reforms that we have previously voiced our support for, particularly stronger cross-sectoral, global and regional surveillance systems to better detect potential disease outbreaks earlier, a clearer process of independent epidemiological assessment on site and prompt information sharing, including samples of pathogens and genetic sequence data when outbreaks occur. Improved early warning system with clear actions for member states to take at each stage. Improving IHR compliance through a stronger member state-led review process and monitoring framework. finding sustainable financing approaches which allow WHO to fulfill and enhance its core normative role, including strengthened technical guidance,
Haiti to take the floor,
and a pandemic treaty or other international instrument on pandemic preparedness and response as one vehicle to further drive reforms and catalyse global cooperation and action.
Ladies and gentlemen, ministers,
the starkest message from the independent report is that we did not learn the lessons of past emergencies, and we did not do more to prevent the current pandemic. We must act now and ensure that we are best prepared for health emergencies. It is now in the hands of member states to make the necessary changes ourselves and hold our multilateral partners, including WHO,
since the beginning
to account.
of the epidemic, we have had
Member states have already taken the first important step by tabling a process to WHO 74, by which we will consider and take forward these
over 2,000
recommendations.
hospitalizations,
The UK is ready to
over
work with
200
you all to
deaths.
translate
The
these
scale
reports
of the
into concrete
impact
change and
of
tangible
the health,
improvements to strengthen
social
preparedness
and economic
response
impact
to health
of
emergencies.
COVID-19
Thank you.
requires of us supplementary
I now invite
efforts
Botswana to
which
take the floor,
must
followed by Fiji.
turn into strategic action that are well targeted in order to remedy the systemic deficiencies and structural deficiencies of health services in countries such as Haiti. Madam President, COVID-19 has underscored the need to have national health systems that are resilient, and these need to be based on solidarity, and this must be the foundation of global health, safety and universal health coverage. And in this regard, Haiti fully supports the international cooperation platform that aims to accelerate the development and equitable distribution of tests, treatments and vaccines, as well as strengthening health systems of vulnerable countries. Haiti affirms the need to guarantee that everyone has access to primary health care. However, Haiti cannot face these health and economic challenges alone, which continue to be exacerbated by COVID-19. Therefore, we would like a better organization of international health cooperation, which must be aligned with the specific priorities of each country, of each beneficiary country. No population must be left behind, and we initiated COVID-19 vaccination campaign in partnership with Taiwan, China, and we support its participation as an observer in the World Health Assembly. And to conclude, Haiti expresses its solidarity with the governments and peoples that are still being affected by COVID-19. Together, we will overcome this difficult period. Thank you.
Only 6% of the target population is
Thank you, Haiti. And
on the implementation of the international health regulations, we know we coincide the Global Pulse Survey, which revealed disruptions across all states and request for continued efforts to ensure strengthening of the primary health care
Madagascar is honoured to take the floor on this topic, which is focusing on ending this pandemic and preventing new ones, and to build a better and safer world. The negative consequences of this pandemic, whether it be in terms of health or society or economy, but also the freedoms of populations, reminds us of the need to cooperate with one another.
In principle, the decision to
COVID-19
development of a framework convention
also aligns itself with other diseases,
in order to strengthen the AI chart,
and it constitutes a burden for low-income countries. And we have developed a national plan
on strengthening WHO preparedness and response
for the health sector,
in an inclusive and transparent manner.
It covers human health and the environment.
Thank you, Botswana. Before I hand over to Fiji, I give back the floor to Madame
Need a better We need to invest more in health services.
I would like to remind member states that statements
so that we can prevent outbreaks of diseases
of 4 minutes.
And prevent them from turning into epidemics, and particularly stop them turning into pandemics. Improving detection and surveillance systems is necessary, and we need to have reactive systems.
Madam Chair. I now
this is absolutely vital.
To take the floor, followed by Afghanistan.
For Madagascar, the capacity of biological diagnostics has been improved. We have high technology equipment in our laboratories, and we have improved our technical material that is available. To put an end to this pandemic, measures such as vaccinations need to be promoted because they are efficient. From Madagascar, developing research has been promoted, and in addition, structures for pharmaceutical production
Today we have recorded
have been improved, and coordination at the highest level of the state has allowed us to mobilize all aspects of the state together with our technical partners, and the desire of the state to improve our human resources has also been demonstrated. This pandemic is an opportunity for all health systems at a global level to be strengthened so that we can have a better and more innovative collaboration
United Kingdom, USA,
internationally,
China,
and
India, Japan, and South Korea.
Strengthening health systems remains an important challenge for us, and I would like to thank you for your attention.
Whole of society approach.
Thank you very much.
Guided by our national preparedness and response
please
plan.
Take the floor to be followed by
Fiji acknowledge and thank the work of the COVAX facility and its generous sponsors and funders.
Madam President,
and echo the sentiments of the Director General,
delegates, ladies and gentlemen, the Czech Republic fully aligns itself with the statement of Portugal delivered on behalf of the European Union.
To date, we have managed
the
to vaccinate 15% of our target population.
That outbreaks of infectious diseases still represent a significant health threat.
And we hope to improve
after several months of fight with this pandemic. We can see more than ever the importance of multilateralism, compliance with international obligations, and sharing of experience.
Fiji also acknowledged the great work of the independent
Thanks to the international cooperation, the humankind was able to produce safe and effective COVID-19 vaccines in an unprecedented time, and the rollout started within 1 year from the moment when COVID-19 disease became part of our lives.
Fiji as a small
the vaccine race has started, and in this context, it is our duty to ensure an equitable access and to leave no one
recognizes
behind.
The urgent
the pandemic has reminded us how crucial it is to ensure key drugs for patients and appropriate protective equipment for healthcare workers.
The provision of predictable and
we should not accept any restrictions imposed on trade with medicines and other life-saving goods. Together and with a strong political commitment at the highest possible level, we can defeat the COVID-19 pandemic and tackle its wider economic and social implications. We are very thankful for the continuous effort of several evaluation
bodies. I now invite
dealing
Afghanistan to take the floor,
and comprehensively with the assessment of how WHO and the international community responded to the COVID-19 pandemic.
Madam Chair, can you hear me?
We are looking forward to their recommendations that will be presented
very well. Please
during this
proceed.
Assembly. In closing,
thank you very much,
I would like to stress that the Czech
Afghanistan
Republic
commands
sees
the work
WHO
of the
as an
independent
expert
panel
organization
for pandemic
which
preparedness and
fulfills its
response, and
mandate
as well as the
without any
report of the
politicization.
panel. We also command the efficient leadership and the support of WHO in all of the hard work the organization has rendered combating the pandemic. Last year, the emergencies of COVID-19 caught the world by surprise, affected almost all the facets of human life and societies in every corner of the world, revealed our collective failure to invest in emergency preparedness and response in the primary health care and resilience.
I wish to thank the Director General, Dr.
It taught us
for his
that in today's interconnected world, nobody is safe unless everyone is. And reminded that solidarity is the only way to address facing and its recovery.
Unprecedented health crisis that spill over into all segments of our lives.
One of today's preeminent global challenges.
let me reiterate Montenegro's full commitment to further strengthening cooperation with the World Health Organization and with its regional office for Europe. Needless to say, also with the COVAX facility, 1 year into the pandemic has taught us that collaboration and solidarity are the only way forward. Montenegro is heartfelt grateful to the health professionals who has been showing extraordinary dedication and courage on a daily basis, as well as to all others who work tirelessly in their fields, including those working to ensure equal access to vaccines for all.
In this regard,
it remains crucial that no one is left behind. The evolving COVID crisis has alarmingly demonstrated the importance of multilateral institutions, international cooperation, and solidarity for collective health, security, and welfare. The pandemic has made clear the urgent need to invest and create resilient health systems. This is why Montenegro has supported the adoption of the resolution on strengthening World Health Organization preparedness and response to health emergencies tabled by the EU. In terms of national processes, the reforms that Montenegro has been implementing in the EU accession process are complementary to achieving the 2030s. In our response to the COVID-19 pandemic, we relied on the strong primary health care as our critical first line of defense to keep people safe and healthy.
The great efforts
as
of the
on the very first days of my mandate, I focused on capacity building of primary health care teams to manage effectively COVID-19 cases at the community level in line with the updated clinical guidelines. Exploring innovative ways to deliver primary health care and exploiting potential offered by digital technologies and telemedicine is an imperative. The government of Montenegro implemented a set of epidemiological measures aimed primarily at preserving the health of Montenegro citizens, but also the economic consolidation of countries. At the moment, Montenegro has the lowest 14-day cumulative incidence rate since September 2020. Immediately after the outbreak, Montenegro adopted national strategy for the introduction, distribution and application of COVID-19 vaccine and plan of action for comprehensive response, which was also supported by the World Health Organization. In parallel, Montenegro has ensured enough
vaccine summit with Gavi on June 2nd contribute to securing funds needed for COVAX and demonstrate
Namaskar,
the unity
Mr. President of the Assembly, Mr. Director General of the WHO, Excellencies. The world is confronting the harshest of times in human history due to the COVID-19 pandemic. The leadership of WHO in addressing the global crisis has been commendable at all levels. I take this opportunity on behalf of the government and people of Nepal to express our deepest condolences and most sincere sympathy to the governments and people of the world who have lost their loved ones to the pandemic. I would like to convey my regards and sincere appreciation to the frontline workers who have been working round the clock to save the lives in this adverse situation. While the world is now recovering gradually from the pandemic, the countries in South Asia, particularly Nepal, is witnessing an alarming surge in COVID-19 cases. The unprecedented rise in the caseload has strained our health infrastructure as well as the medical supplies and equipment. At this moment, I thank our neighboring countries and development partners for providing support during this crisis. Mr. President, Nepal is struggling hard to overcome this grave situation. While we have put in place appropriate preventive measures including restrictions on movements and awareness campaigns as well as increased testing, tracing and treatment facilities. The ultimate way out of this crisis is expansion of vaccination.
the additional work
disheartening to
and
note
relevant
that
risks
high and
that may
upper
arise
middle income
from
countries
this
have received
precautionary approach.
83% of the world's
Finally,
vaccines, while low
we
and
fully agree
lower middle
that
countries have
raising
received
political
just
commitment
17%
to global
of the
health
world's
is
vaccines.
vital.
On behalf of
Ensuring
government
strong
of Nepal,
leadership and
I therefore
accountability
would like to
so that
appeal global
sustainable
community
financing
to ensure
will
equitable
contribute
distribution of
to
the
future
vaccines and
pandemic
prioritize
response.
the most vulnerable
We recognize
first.
that
The
immediate
COVID-19 pandemic
actions are
taught
needed
us that
to strengthen
strong and
the
resilient
overall
health
global
system
health architecture
are
with
crucial
a
to
strong
contain the
WHO
crisis and
at
ensure
its core.
continuity of essential health
Japan
services.
takes the
To make
recommendation
this happen, health
seriously
systems and
and will work
emergency
with
health
the
programs
WHO,
should work
member
together.
states,
And a strong
and
health
the
security
whole
program is needed
international
to
community
bring together
to strengthen
leaders,
national
scientists,
and
experts,
global preparedness
and people of the world for effective
to the current
preparedness
health
and response.
emergency
Against
and
this
those
backdrop,
ahead of us.
I would like
Thank
to
you very
recall
much.
the theme of 13th General
Thank you,
Program of
Japan.
Work
I now
that
invite
we
Denmark
endorse
to take the
jointly,
floor, followed
promote
by
health,
Finland.
keep the world safe, and serve the vulnerable. I am hopeful that the consideration will be made by global community for ensuring equitable access to the health technologies, including vaccines, as we accept the fact that no one is safe until everyone is safe.
International health
Thank
regulations. We would also like to thank the independent panel for pandemic preparedness and response for its comprehensive and well-structured report. We have definitely noted the message, make COVID-19 the last pandemic. For this vision to come true, we must collaborate to safeguard critical societal functions by handling and containing future health emergencies, including through comprehensive preparedness planning.
Okay, so we will move then to
the World Health
Nauru.
Organization plays a central role in the global handling and control of international spread of diseases. The Constitution notes that the Health Assembly shall have authority to adopt regulations concerning sanitary quarantine requirements and other procedures designed to prevent the international spread of disease. The current IHR entered into force in 2007 with the purpose and scope to prevent, protect against, control and provide a public health response to the international spread of disease in ways that are commensurate with and restricted to public health risks. While the COVID-19 pandemic has real flaws and insufficiencies in the IHR, we find it important to highlight that the IHR has been and will be a cornerstone in an all-hazard preparedness and response to future health emergencies. Therefore, it is also vital that countries have a continuous focus on implementing, strengthening national IHR core capacities, including comprehensive and rapid surveillance systems, essential public health functions and management of events, as well as emergency preparedness and response mechanisms. Denmark supports the continuous learning and evaluation from the COVID-19 pandemic and other health emergencies at all levels in order to improve global health security, fostering resilient health systems, and strengthening of the IHR core national capacities. Multilateral collaboration also needs to be improved if we are to succeed in preventing the next global health crisis. Coordination before, during, and after a health crisis will ensure a united and effective global response. Denmark supports the IHR and the continuous work to secure its full implementation across member states and further dialogue on the improvement global health response to international health emergencies. Thank you.
Nauru is one of the few countries in the world remaining COVID-free.
I invite Finland to take the floor.
is mandated on completion of the quarantine period. This ensures that all travelers are tested negative prior to entering our local community.
Your Excellencies,
From May to
Finland aligns herself with the statement made on behalf of EU and member states. We thank the independent panel for preparedness and response, IHR review committee, and IOAC for their reports. We appreciate the special attention paid to the complementarity and transparency of work during the process. The comprehensive set of findings and recommendations provide a basis for discussions on strengthening WHO and the global health emergency preparedness. Further, we note the increase in reported IHR core capacities during the response and the Secretariat's ongoing efforts to support monitoring and evaluation. It is important to integrate this readiness and successful models for cooperation in the future preparedness planning. Finland supports the recommendations of all three panels on strengthening the integration of gender equality in preparedness and response. We are currently conducting a study on health and societal impact of the pandemic on gender equality in Finland. Strengthening the health emergency program, fostering synergies across the general program of work is a key of importance. We support the IOAC recommendations on the formalization of the emergency program's accountability structures and processes, including those relating to strengthening the prevention of abusive behavior. Health emergency preparedness is a global public good. Investing in strong and resilient health systems and essential public health functions at national level and ensuring sustainable financing of WHO are of critical importance. The ACT Accelerator can provide valuable lessons for addressing the risk of market failure. We would be interested in hearing more from the IPPPR about proposed financing mechanisms. Stronger cooperation in human-animal environment interface is needed beyond pandemics. Strengthening multi-sectoral linkages in national health security strategies and the implementation of the Sendai framework for disaster risk reduction support preparedness for all hazards. Finland stands ready to contribute to discussions on how to secure political commitment for strengthening preparedness. We also look forward to the reports of the Pan-European Commission on Health and Sustainable Development and the Global Preparedness Monitoring Board later this year, as well as to the work of the Council on the Economics of Health for All. We believe the horizontal approach to societal well-being and resilience can benefit both health and the economy. We look forward to engaging in constructive discussions on recommendations and their implementation and to ending the cycle of panic and neglect. Thank you.
Thank you, Finland. I invite Canada to take the floor, followed by Tanzania.
We thank Cyprus. I see that we have a sound issue.
The HR Review Committee and the AOAC.
So I would like to now give the floor, please, to
the chairs and co-chairs,
to be
as well as to all panelists and committee members, including Canadian Dr. Joanne Liu, for their commitment and dedication over the months.
The COVID-19 pandemic
these three reviews have accurately assessed what went wrong, charted a path out of this pandemic, and provided a roadmap to strengthen future efforts.
The deepening economic crisis in
we must learn from our mistakes in order to strengthen global health security architecture appropriately and in a timely fashion. In doing so, we must include equity at the core of our work, prioritize the most vulnerable populations, and support health system strengthening that maximize the capacity to reach everyone. Having a roadmap is one thing. Following it sensibly and with a unity of purpose and commitment is another. In this regard, we can and should distinguish between what we can do now and what needs to be done over time. The reports underscore what we already knew. Preparedness and prevention are key. There are relevant recommendations here we can act on immediately. In particular, we must bolster surveillance systems to detect health threats before they are widespread. Alert systems must also be strengthened to effectively communicate real or potential threats more rapidly and clearly. Another example, strengthening or creating mechanisms for rapid scientific information sharing on potential threats, including epidemiological information. Other recommendations may require longer-term implementation strategies and even new international health instruments or frameworks to implement. I note, for example, the recommendations of the HR Review Committee for strategies to ensure timely and rapid sharing of pathogen specimens and genome sequence information. Key to successful implementation of many of these recommendations will be sustainable financing to help break the cycle of panic during a crisis and neglect in the absence of one. This is not out of reach if we can mobilize innovative collective action. It will necessitate a whole-of-government and society approach. Local communities, including indigenous communities, play important roles in facilitating greater collaboration across sectors. All must be part of the solution. As we work together to consider what improvements to make and start to implement our vision for the future, it is critical that the system we build is coordinated, cohesive, and efficient, and that our actions do not unintentionally result in further fragmentation. New structures must be well thought out and aligned with existing mechanisms, such as the HR. Member states must lead in taking action. This is why we are pleased to co-sponsor the resolution on strengthening WHO preparedness and response for health emergencies, as well as the decision point on the potential benefits of a new international instrument. We must be accountable to ourselves and each other to ensure that we collectively follow through. To that end, we look forward to engaging with other member states on these ideas through the open-ended working group, and will consider how Canadian skills and assets can best be leveraged in support of these efforts. Thank you, Chair.
I would like to now give the floor to Cabo Verde.
Thank you, Canada. I now invite Tanzania to take the floor, followed by
Madam President, Mr. Director General of the World Health Organization, Honorable Ministers of Health, ladies and gentlemen. I would like to begin by welcoming all the distinguished participants and guests of the 74th World Health Assembly. On behalf of the Minister of Health of Cape Verde, I would like to congratulate Mr. Director General and the WHO for the engagement and leadership in facing the serious health, social and economic crisis. Madam President, the pandemic of COVID-19 pandemic represents one of the greatest challenges humanity has ever faced. However, we cannot forget that millions of children die every day all over the world, victims of precarious conditions in prenatal care, childbirth due to lack of vaccine, malnutrition, malaria, HIV, and hepatitis B. Furthermore, we must not forget that thousands of women, 800,000 of them in sub-Saharan Africa, lose their lives due to complications related to pregnancy and childbirth, representing about 2/3 of all maternal deaths worldwide. Dental and ophthalmological pathologies responsible for the highest rates of disability worldwide, and the lack of geriatric programs that promote a better quality of life to our elderly also calls for greater attention. A robust response is needed to the impact caused by the pandemic on health systems, which has set back the gains already made in universal health coverage. Small island states already severely shaken by the climate change with economic base on the tourism sector have seen their economies weakened, employment rising, and social cohesion hits at its foundation. Cape Verde increased the life expectancy of the citizens about 20 years as a result of public policies developed since the independence in 1975. Moreover, the gains in health translated into main health indicators place Cape Verde amongst the middle-income countries in the group of high-income countries, and a fact recognized by the WHO.
And how it could ensure effective and equitable distribution and timely access to needed goods.
Even through COVAX mechanism, the amount of vaccine received has only allowed us to vaccinate 2% of our population. The question that we must ourselves is the following. Should there or should there not be a global policy that takes into account positive discrimination of small island states? Cape Verde, the small island states, count on the leadership and engagement of the WHO and the UN system so that all countries can achieve sustainable development goals and no country is left behind. To conclude, we leave a word of deep recognition and thank all healthcare professionals, civil protection agents, and all those in one way or another that have helped us fight this pandemic. Our deepest sympathy to the families and friends of those who lost their lives in this pandemic. Thank you.
Align with the international health regulation. I now have the pleasure of giving the floor to you, Madam President.
Thank you, Tanzania. I invite Turkey to take the floor, followed by Zambia.
As we have come to the end of the session for today, I would like to express our condolences for all the lives we lost due to COVID-19, especially health and care workers all over the world. From the first moment of the pandemic, Turkey has been successfully fighting against COVID-19
I would like to kindly request that in delivering a right to reply, delegation be as brief as possible and in any event not exceed 3 minutes.
Applying the most effective treatment protocols,
if there are subsequent requests by delegation for additional spoken right of reply concerning the same matter as previous replies, may I kindly request delegation to limit such spoken statements to 30 seconds or less. Again, I hope delegation will understand that these requests are made in our common interest in the good order of our proceedings. I shall now give the floor to Japan.
Directly or indirectly. Considering the effect of the pandemic on the economy, we are faced with the fact that health security and the security of livelihoods are two different sides of the same coin. This situation imposes historical responsibilities on health policy makers within the framework of their decisions and practices regarding not only human health but also factors affecting human life. These developments provide us with historical opportunities for effective implementation of whole of government and one health approach to health policies that we have been talking about for years. This pandemic made it clear that when a global health problem occurs, all eyes turn to WHO. Actually, for this reason, DG and his team devoutly organizing briefings at least twice a week to inform the international community. Based on this reality, it has been practically observed by the world that WHO is sole structure we have in our hands. Thus, we believe that the international system should be discussed openly with a pluralistic participation without hesitation of debate. In line with the lesson learned, starting with the strengthening of WHO and discussing a treaty if necessary. In line with this consideration, we support and become co-sponsors of both relevant resolutions. I thank you.
To the international community, I now
including international conferences hosted by the IAEA, the OECD, NEA, and others in a
Chairperson, thank you for the opportunity to make this intervention on this agenda item. And Zambia aligns this statement to that made on behalf of the Africa region by Togo. We thank Secretariat for the work they are doing and they continue doing in the region and to member states. We wish also to show gratitude to the Director General for the leadership in this period of COVID-19 pandemic and for facilitating the establishment of the various review panels and committees whose reports we are discussing now. Zambia has been working with WHO and other stakeholders in strengthening public health security in the country, including emergency preparedness and response. Notably, we have conducted vulnerability risk assessment and mapping, developed various strategic documents such as the National Action Plan for Health Security, National Action Plan for Antimicrobial Resistance.
Thank you, Japan.
The All Hazards Emergency Preparedness and Response
States
Plan,
of America.
and also established the National Public Health Institute and the Public Health Emergency Operations Center to anchor the coordination of public health security and strengthen the implementation of the international health regulations
The United States wishes to
in the
exercise its
country
right of
through
reply to
domestication of
Venezuela's
the
statement on
IHR
sanctions.
2005.
The United States-Venezuela sanctions
Zambia
programs
has been
includes
able
broad
to
exemptions and
respond to public health
authorizations that allow
emergencies
for the
and manage
provision of
diseases
humanitarian
outbreaks,
assistance
including the
commercial sale
COVID-19
and export
pandemic
of
due
food,
to
agricultural commodities,
capacity building that has
medicine, and
been
medical
made
devices
possible
to
through
Venezuela.
collaboration
Our
with the
sanctions are
various
designed to
stakeholders.
not be an obstacle to
However,
providing humanitarian
there is
aid to
need for
Venezuela.
continued support,
We have also made it
particularly
clear to
from
the
the World
Maduro
Health
regime that if there were
emergency
specific
program
instances where
at country
excessive
level,
compliance
in which
with U.S. sanctions prevented the
we
provision
require
of
enough
humanitarian aid to
financial
Venezuela,
resources to
they
meet
should
the
let us
technical
know so we
demands.
could take appropriate steps to facilitate
Zambia
the
takes
flow of
note
aid.
of the reports
As
of
yet, they have failed
the
to
review
identify a
committees
single factual
and
instance.
acknowledges
For our
the progress
part, the
made
United
in
States,
strengthening public
international
health
partners,
emergency
and the Arab
preparedness
government in
and
Venezuela
response.
are proactively
We
responding
therefore
to
support the
COVID-19 in
adoption
Venezuela.
of the
The U.S.
draft
government has
decision
provided
calling
more
for the
than
development of
$1.2
a
billion
pandemic treaty
in total
to
U.S.
strengthen
humanitarian,
WHO's health
economic,
health
and development
emergency
assistance
preparedness
in
and
response to the
response
Venezuela
capacities,
regional crisis
including to
since
address
fiscal year
the recommendations
2017.
contained in the
very
report
much.
of the IPPR, the IOEAC, and
Thank you,
the
United
IHR
States
Review
of
Committee
America.
on functioning
I
of
shall
the
now give
international
the
health
floor to
regulations
Russian
during
Federation.
the COVID-19 response. Chair, to conclude, Zambia wishes to be included on the list of the co-sponsors for the draft decision calling for a special session of the World Health Assembly contained in document A74/A/home/5/1. I thank you, Chair.
74th session of the
Thank you,
World
Zambia.
Health
And now I
Assembly.
hand the floor back to Madam
Ukraine
Chair.
has never been subject to
Thank you
military
very
aggression
much.
from
Dear
Russia.
delegates,
There is a
we now
civil
come
conflict
to
that
the
is
end
taking
of our
place
meeting this
between
afternoon.
the
So we will suspend the
citizens
discussion
of
on this
Ukraine
group
and their
of
government.
items, 17,
And
public
this has
health
been taking
emergency,
place in Ukraine since
preparedness and response,
2014.
and 18,
There are no
mental
occupied
health
territories in
preparedness for a
Ukraine. The
response to
Republic
the
of Ukraine and the
COVID-19
city of
pandemic.
Sevastopol are
I would like to invite the
inalienable
moderator
part
to
of the Russian
please
Federation.
read the list
Crimea,
of member states still
in line
wishing to
with
take
the
the floor,
UN
as they will
Charter
need to
for
raise their hands
Self-Determination,
again when
had
we
a
reopen the items.
peaceful election in line with all international
Thank you, Madam
standards.
Chair.
Russia has
Spain,
not occupied any
Ghana,
territory of
Colombia,
Ukraine.
Brazil, Algeria,
So in
Philippines,
this regard,
Sudan,
it is
Ecuador,
it is
Uruguay,
inadmissible
Singapore,
to
Indonesia, China,
address these
Germany,
claims against
Vanuatu,
Russia.
Afghanistan, Angola, Bahamas, Ghana, Argentina,
And
United Arab
we hope
Emirates,
that
Thailand,
the
Algeria,
World Health Organization
Egypt,
will not be
Madagascar,
used
Andorra.
as a platform for making such provocative
Thank you
statements.
very much.
And we are
We will
concerned by
continue
the
our discussion
situation
on these
in
items
Sevastopol,
at our first
and
session
we should
tomorrow
be
morning.
focusing our attention
Please refer
on
to the Daily
trying
Journal for
to
full
resolve the
details.
health situation for their
I
own
thank you
citizens. Thank you for
for
your attention.
a full and constructive discussion today and wish you a nice rest of the day. The meeting is now closed.
Russian Federation. I shall now give the floor to Turkey.
Can you hear me? Good afternoon. Can you hear me?
Yes, we can.
Thank you, Madam President. We are exercising our right of reply in response to the allegations of Armenia made against our country during the general discussion under item 3. Despite the very stimulating deliberations by many countries, we regrettably heard unfounded claims against Turkey from Armenia, which are at odds with this atmosphere. We categorically reject all the claims by Armenia, who is in a desperate attempt to cover its unlawful and inhumane acts. Armenia's disinformation campaign aims to divert attention away from its illegal occupation and portray itself as a victim. Instead of giving account for the occupation lasted nearly 30 years in Nagorno-Karabakh and the crimes against humanity and war crimes committed during this occupation, Armenia tries to deflect its responsibilities with unfounded and unrealistic allegations. The baseless claims regarding foreign terrorist fighters in Nagorno-Karabakh are detached from the facts on the ground. On the other hand, it is common knowledge that Armenia deployed Syria-based PKK-YPG terrorists and ethnic Armenians from the third countries to Nagorno-Karabakh. Bearing in mind the fact that there is a historic opportunity for a sustainable peace in the region and that Turkey will reciprocate any positive step taken by Armenia, we urge Armenia to stop abusing and politicizing this platform in order to reiterate its baseless allegations. I thank you.
Thank you, Turkey. I now give the floor to China.
Madam President, the Chinese delegation requested to exercise the right of reply in accordance with Rule 57 of the Rules of Procedure of the Assembly. Yesterday, the plenary session of the World WHO, the WHA, rejected the Taiwan-related proposal again. This fully demonstrated that the One China principle was widely supported by the international community. However, the delegates of a few countries, such as the United States and Japan, ignored the consensus of all parties and insisted on making irresponsible interventions, challenging the One China principle, seriously violating the relevant resolutions of the United Nations and WHO, and undermining global solidarity and pandemic response efforts. China solemnly protests and resolutely opposes this. China reiterates that the reasonable arrangements must be made for the Taiwan province of China to participate in the activities of international organizations through cross-strait consultations under the One China principle. The Taiwan Authority refused to accept the One China principle. Thus, the political basis for their participation in the World Health Assembly no longer existed. Since the outbreak of the pandemic, the Chinese central government has repeatedly informed the Taiwan province of the pandemic and approved Taiwan experts to participate in WHO technical activities. There is also a focal point of international health regulations established in Taiwan province, and the information exchange with WHO and other countries is smooth and the mechanism is impeccable. The so-called international gap in pandemic response in Taiwan province is groundless. Some countries manipulate the Taiwan-related issues in order to create two Chinas, or one China, one Taiwan, in the world, and interfere in China's internal affairs through the Taiwan issue. Their attempts shall never succeed. Thank you, Madam President.
Thank you, China. I now give the floor to Armenia.
Madam President, in response to the groundless allegations of Azerbaijan voiced during this August Assembly, Armenia would like to draw the attention on the humanitarian and healthcare disaster caused by the aggression of Azerbaijan against Nagorno-Karabakh. From day one of the war, Azerbaijan deliberately targeted the civilian population and infrastructure. The civilian hospitals, including child